AT&T moderator, can you hear me?
Yes, I can.
Perfect. Thank you very much for confirming.
Good morning. This is a check-in for CEO's office. Can you hear me?
CEO audio check. Good morning.
Thank you. Is County Council with you as well?
Yes, ma'am.
Thank you. Good morning, AT&T. Can you hear me?
Yes, loud and clear.
Thank you very much.
Good morning.
Good morning, Supervisor Barker.
How are you?
Good in yourself. Thank you.
I'm cold.
Good morning.
Good morning, Supervisor Kyo.
Good morning.
Good morning, everyone. Welcome to the regularly scheduled meeting of the Los Angeles County Board of Supervisors. Today is Tuesday, January 26, 2021. Our meeting today is being held remotely due to the current public health crisis to protect the health of all. Before we begin, I'd like to take a moment of privilege to acknowledge that we have a new president, Joe Biden, along with California's very own Vice President Kamala Harris, who, as we know, was inaugurated this last week. I am very, very hopeful and confident that with the new administration, the national COVID response will be substantially improved, especially in regard to the vaccine rollout. This is indeed a new day for the nation and for Los Angeles County. We have much work to do ahead of us, but we can now count on the federal government's support, which will be immensely helpful in our efforts as we move forward. I will now take the roll call to confirm attendance. Please unmute your mic and respond when your name is called. Supervisor Mitchell.
Present.
Supervisor Kuehl.
Here.
Supervisor Hahn.
Here.
Supervisor Barger.
Here.
Kezia Davenport, Chief Executive Officer.
Present.
Rodrigo Castro Silva, County Counsel.
I'm here.
Celia Zavala, Executive Officer of the Board.
Here.
As indicated on the posted agenda, we will be taking telephonic public comment separately for regular agenda items and public hearing items during today's meeting. The Executive Office of the Board has received over 3,300 written public comments for today's meeting. And as those written comments were received, all of them were available to the supervisors for their consideration, consistent with the Brown Act's requirements. We will continue to receive written public comments throughout the meeting, which will become part of the official record. Madam Executive Officer, please call the agenda.
Good morning, Madam Chair and members of the board. Today's agenda will begin on page 2, set matter, 11 a.m. Item S1 is a discussion of the public health order related to COVID-19. This item will be held for discussion. On page 3, special district agendas. This is the agenda for the Los Angeles County Development Authority. Item 2D is a recommendation to adopt a resolution declaring an intent for the Salvation Army Pasadena Hope Center or a Los Angeles County Development Authority approved assignee to undertake bond financing in the amount not to exceed $21 million to finance the construction and development of the Pasadena Hope Center located at 1000 West East Walnut Street in the city of Pasadena. This item relates to item 37D. Also, this includes indicated on the supplemental agenda as an addition. On page 4, this is the agenda for the Regional Park and Open Space District. On page 5, public hearings, items 1 through 7. These items will be held for hearings. On page 9, consent calendar, Board of Supervisors, items 8 through 27. On item 9, Supervisor Kuehl requests that this item be continued 2 weeks to February 9, 2021. On item 11, Supervisor Kuehl requests that this item be held. On item 12, this includes a revision as indicated on the supplemental agenda. On item 13, Supervisor Kuehl requests that this item be referred back to her office. On item 24, Supervisor Solis requests that this item be held. Also, this includes a revision as indicated on the supplemental agenda. On item 26, Supervisor Solis requests that this item be held. On page 22, administrative matters, items 28 through 39. On item 28, the Chief Executive Officer requests that this item be continued to March 23rd, 2021. On item 32, this item will be held for a report. On item 28, this includes miscellaneous additions to the agenda, which were posted more than 72 hours in advance of the meeting as indicated on the supplemental agenda. On item 37A, Supervisor Hahn and Supervisor Barger request to revise Directive Number 3 of their motion to state, authorize the Emergency Operations Center in partnership with the Department of the Public Health to coordinate and execute an MOU and/or other necessary agreements with cities and/or other agencies in the county to transfer vaccine allotments from the Department of Public Health to other agencies for distribution to county residents in support of the county's vaccine implementation plan and as permitted by law. On item 37B, Supervisor Hahn requests to revise her motion to state in support of taking all measures possible to prioritize resources needed for the safety evaluation of Oxford, AstraZeneca, and Johnson & Johnson's COVID-19 vaccines. On item 37C, Supervisor Hahn requests that this item be held. On item 37D, this item relates to item 2D. On item 37E, this item relates to 37F. On item 37F, this item relates to 37E. The request for continuances or items to be referred back through 37F are before you.
Moved by Supervisor Barger, seconded by Supervisor Hahn to approve these items. That will be the order.
On page 29, separate matters, 40 through 42. On item 40, this includes a revision as indicated on the supplemental agenda. On item 41 is a recommendation to adopt a resolution authorizing the issuance and sale of the fiscal year 2021 tax and revenue anticipation notes in an aggregate principal amount not to exceed $255 million. Item 42 is a recommendation to adopt a resolution authorizing the issuance and sale of the Lenox School District General Obligation Bonds in an aggregate principal amount not to exceed $3 million to fund various school modernization and facilities improvements throughout the district. On page 30, notices of closed session. That completes the reading of the agenda, Madam Chair.
Okay, very good. Thank you. We will now take public comments for all agenda items except for public hearing items 1 through 7. Madam Executive Officer, please read the call-in information that was also provided on the agenda and explain the speaking rules to those members of the public who are calling in to address the board.
As indicated on the agenda, members of the public wishing to offer public comment should call 877-226-8163 and use participant code number 133-6503. To repeat, please call 877-226-8163 and use participant code number 133-6503. Do not call the number if you only want to listen to the meeting. To listen only, please call 877-873-8017 and follow the instructions. To members of the public calling in, when it's your turn to speak, please state your name and which agenda items you wish to speak on. You have 1 minute to speak on one agenda item or 2 minutes to speak on 2 or more agenda items. In addition, those who would like to address the board with general public comment will be provided 1 additional minute for a maximum total up to 3 minutes per person for all agenda items, including general public comment. We will allocate up to 60 minutes for public comment on all of the items, including the public hearing items. If there are no speakers waiting before 60 minutes have lapsed, we will close public comment. We will continue to accept all written comments that come in during the meeting, which will become part of the record. When speaking on the agenda items, you must be on topic. Your goal is to get through as many speakers as we can. If you're not speaking on topic, or if we cannot tell if you're speaking on an agenda item, you will get 1 warning from County Council or the Chair. If you do not immediately or clearly get on topic, or if you stray off topic again, you will forfeit the rest of your time and the Chair will move to the next speaker. Please note, if you are also listening to the board meeting on a computer or speakerphone, you will need to turn down the volume on those devices as soon as the moderator calls on you. If you do not turn on the volume, there will be an echo. Moderator, may we have the first speaker, please?
Thank you. As a reminder to address the board, if you have not done so already, please press 1 then 0 at this time. Do not press 1 and 0 a second time, or you will be removed from queue. Our first participant is Austin Butner. Please state the regular agenda items you are addressing today and whether you will address general public comment. You may begin.
Thank you and good morning. Thank you, Madam Supervisor, and I said it with pleasure to say that 5 times over. I'm speaking this morning on the resolution of partnering with schools for COVID-19 vaccine distribution, and I want to begin by acknowledging the tireless efforts of the county, public health staff, and all who are supporting the vaccination effort, which is certainly a Herculean task. As goes Los Angeles, so goes California. And while supply may be today's problem, tomorrow's will become access and trust. And we believe school-based efforts can help provide both access, equity, and build the trust and support of the community. Los Angeles Unified and our schools are uniquely situated and qualified to help be a portion of a comprehensive vaccination effort. We have more than 1,400 schools located in residential neighborhoods, making them accessible to people in all communities, in particular those which may otherwise lack access to health care. The necessary infrastructure is already in place: security, electricity, restrooms, and covered and open areas to support the vaccination process. We have school-based clinics already licensed in high-needs areas to provide vaccinations.
Thank you. Your time has expired. Next speaker, please.
Our next speaker is Tancredi DeLuca. Please state the regular agenda items you'll be addressing today and whether you'll be addressing general public comment. You may begin.
Yes, my name is Tancredi DeLuca. I'm addressing Agenda S1. Good morning, everyone. I just want to let you know that I'm a restaurant owner. I currently own 7 restaurants in Los Angeles. Before the first shutdown, I had employed over 200 people in my organization. After the first shutdown order, I let to go 160 of my team members. The adverse impact and the current closure on my family and my employees has been devastating at a minimum. I only operate with 30 people right now. If this continues, I will be forced to go out of business, and myself and 200 families that depend on me will be without a job. I implore you to allow us to reopen and stay open. Thank you for your time.
Thank you. May we have the next speaker, please?
Our next participant is Robert Garcia. Please state the regular agenda items you will be addressing, and if you are addressing general public comment, you may begin.
Thank you. I'm addressing 37A and general public comment. I want to thank, of course, the Board of Supervisors for a few minutes. Robert Garcia, the mayor of Long Beach, and it's great to be with you today. I just wanted to make a request to all of you that we've already made at the staff level. Long Beach and the county have an incredible partnership. We had an incredible partnership during testing and have had for many, many years. I think you're all aware that within the county, both Pasadena and Long Beach do have their own health jurisdictions. We would love the opportunity to continue to assist the county like we've done for testing and setting up a partnership to help test cities around, in our area. And for us, it'll be extending that to vaccination. So we've been doing a lot of the testing for the county as it relates to cities like Signal Hill, Lakewood, Paramount, and we would love to have that same partnership for vaccinations as well. And so vaccinations have been going smoothly in Long Beach. We like the county. We would love to have more vaccine, and we're ready to do more. But we just also love the county to consider if...
Thank you. You now have 1 minute to speak on general public comment.
Thank you. We would love the county to consider allocating its vaccine for the cities surrounding us and giving us opportunity to do all those cities if there's help that is needed. So we just want to partner. We have the same agreement for testing, and we'd like to expand that to vaccination as well. I thank you all for your hard work and support, and we'll get all through this together. Thank you.
Thank you. Next speaker, please.
Our next speaker is Hannah Shin-Haydorn. Please state the agenda items you will be addressing, and if you will address general public comment, you may begin.
Thank you. I will be speaking on agenda item 37A and also general public comment. Good morning, Honorable Chair and Honorable Supervisors. My name is Hannah Shin-Haydorn. I am the City Manager of the City of Signal Hill, located in the 4th Supervisorial District. I appreciate the opportunity to address the board this morning. I'd like to begin by thanking Supervisor Hahn on behalf of Signal Hill residents for championing the expansion of vaccinations for people 65 and older. After seeing the numbers of cases and fatalities in this age demographic, it's important that we take immediate actions to provide available protections to this vulnerable group. I'm calling today in support of the recommendation as submitted by Supervisors Hahn and Barger and to make a formal request on behalf of the Signal Hill City Council that the county's allocation of COVID-19 vaccine for the city of Signal Hill be transferred to the Long Beach Department of Health and Human Services as soon as available. The City of Long Beach has offered to serve as Signal Hill's point of distribution for the COVID-19 vaccine. Being completely surrounded by the City of Long Beach, this makes geographic sense for our residents and businesses in terms of ease and convenience. In addition, we understand the LA County Department of Public Health is actively seeking out agency partners.
Thank you. You now have 1 minute to speak on general public comment.
For Signal Hill, we are requesting that partner be the City of Long Beach. We appreciate the efforts undertaken by the LA County Department of Public Health to administer the vaccine rollout in as efficient and equitable a way as possible. And on behalf of the Signal Hill City Council and Signal Hill residents, I urge the county to approve this request. This partnership would support all of our efforts towards a safe reopening and recovery. Thank you for your time, and I appreciate your consideration.
Thank you. Next speaker, please.
Our next speaker is Brian Dennehy. Please state the agenda items you will be addressing, and if you will address general public comment, you may begin.
Yes, good morning. Brian Dennehy here. I will be addressing all the items on the agenda and public comment. I'd like to thank the Board of Supervisors for their robust time that they spend on this agenda, the fact that they are granting us 3 minutes to speak on a 70-item agenda is above and beyond the call of duty. I'd like to welcome Holly Mitchell to the board and ask her if she is renovating her office like the previous occupant did on the first meeting that he was in order with. He came in with the Obama election. There was an item on the agenda regarding reverberation of his office or helping the VA. And so I brought up to the Board of Supervisors that the money spent on reverberation should go to the VA instead of the office. So I'm wondering if she has refurbished her office. I'm also wondering if the board will be using any of the excise, the MRT tax that was put on the marijuana initiative to help in the COVID distribution. It is a robust agenda, absolutely robust. And I'm also very concerned about the attempt to take the sheriff out of office, because it's the Board of Supervisors, the elected officials, that actually negotiate with the sheriff's personnel. And so the sheriff actually has really no oversight. And speaking of oversight, maybe the Inspector General could put in a request to have the previous supervisor who just left office come in and testify about some of the problems.
Please continue. Next speaker, please.
Thank you. We'll go to Gay Ewan. Please state the agenda items you'll be addressing, and if you'll be addressing general public comment, you may begin.
My name's Gay Yuan, and I'm the chair of the board of the Chinese American Museum. I want to thank the supervisors and I'm speaking in support of agenda item 24, the Restorative Justice Village Master Plan. I want to thank the supervisors because I've spoken to them many times regarding the needs and wants of the Chinatown community, and they've all been very sensitive and supportive. And this master plan is a very positive indication that they've listened to us. The Chinatown community has so many needs, as noted. We regret that this, with regard to this master plan, making available a massive amount of public housing should be the priority, and it seems like it is. While community revitalization is the goal, with focus on job training, mental and physical health intervention, and the care first, jails last focus, really without affordable housing, the residents of Chinatown will be left in limbo and forced to leave their communities. The other part I want to speak to is identifying Chinatown's stakeholders to be consulted for the feedback and report.
Thank you. Your time is expired. Can we have the next speaker, please?
Our next speaker is Sunil Watamal. Please state the agenda items you will be addressing, and if you will address general public comment, you may begin.
Good morning, everyone. Thank you for the opportunity to address agenda item S1 with general public comment. My name is Sunil Watamal. I'm Vice President of Property Management for Caruso, where I am responsible for retail operations, including our tenant relationships. Over the past 11 months, I've personally worked with small business owners across our properties, navigating evolving ordinances and restrictions on how they operate. These businesses make up the heart and soul of our communities, and I've become intimately aware of the devastating impact of the closures in LA County. In spite of our partnership with every merchant, including rent abatement and deferral, many of these businesses will not be able to survive another shutdown. Across the county, many of the small businesses that closed will never reopen. We were saddened to see that despite our help, a few restaurants on our properties were unable to withstand the multiple closures and were forced to close permanently. Closures are not the answer. We've also watched as Angelenos turned to other counties, either counties with different guidelines or where businesses were not following guidelines, and this is unacceptable. We all know that small businesses are the backbone of our economy and that their success is our success. Today, I implore the Board of Supervisors to rally around small businesses in Los Angeles County before it's too late.
Thank you. You now have a minute to speak on general public comment.
Dr. Monica Gandhi, Associate Division Chief of Infection Diseases at UCSF, recently pointed to overwhelming anecdotal evidence that banning outdoor dining had an impact on recent surges in COVID-19 cases. In her view, the way forward is not to push back against our natural instinct to gather, but to work towards guidance that creates a safer environment for all. Lifting the outdoor dining restrictions is just the first step in providing small businesses with a chance at survival, and there is still more to be done. Caruso thanks the board on their decision yesterday, and moving forward, we respectfully encourage the board to lead with data and scientific evidence in their decision-making. Thank you.
Thank you. Next speaker, please.
As a reminder, to address the board, if you have not done so already, please press 1, then 0 at this time. However, do not press 1 and 0 a second time, or you will be removed from queue. Our next speaker is Cynthia Anderson Barker. Please state the agenda items you will be addressing, and if you will address general public comment, you may begin.
Thank you very much. I'm addressing item 32 and general public comment. I'm with the National Lawyers Guild and also with the Check the Sheriff Coalition, and I'm here in support of the charter amendment to allow for the impeachment and removal of the sheriff for cause. I really urge you to please, board, move on this quickly. I know the AG has now announced a pattern and practice investigation into the sheriff's department, and we applaud that, and we lobbied the AG to do this investigation, but that will take at least a couple of years. But right now we have a crisis in the sheriff's department. You probably recently saw the news article about, of course, the killing of Andres Guardado, the 18-year-old, but the same two deputies were involved in an incident of grave misconduct 2 months before Andres was shot and killed, and only now have they finally been disciplined and let go for what they did to another victim of the sheriff's department.
Thank you. You now have 1 minute to speak on general public comment.
Okay, thank you. Just before Andres was killed, this other young man was severely injured, and only now were those two deputies let go because they lied in their investigation. So we have a pattern and practice of misconduct, but the board needs to act now. You don't want to lose your insurance policy like the city of Maywood did because there were so many incidents of misconduct. So please move forward, and thanks so much for letting me speak, and welcome to Holly Mitchell.
Thank you. Next speaker, please.
Our next speaker is Sissy Trin. Please state the agenda items you will be addressing, and if you will address general public comment, you may begin.
Hello, Supervisors. My name is Sissy Trin. I'm calling in support of the Restorative Justice Village Master Plan. I'm the Executive Director of SICA, a youth organizing group in Chinatown. Chinatown was one of the first of many communities established under racial containment policies designed to segregate undesirables from the rest of the city. Even though these policies were thrown out decades ago, we are still suffering from their impacts today, and Chinatown remains the most polluted neighborhood in LA. This motion not only has the ability to develop alternatives to incarceration, which we support, it can and also should undo a century's worth of redlining and environmental justice. This requires more affordable housing at deeper levels of affordability, massive amounts of environmental remediation, and a community engagement process that empowers local community residents and low-income stakeholders to partner with advocates fighting for alternatives to incarceration. Thank you.
Thank you. Next speaker, please.
Our next speaker is Naresh Solanki. Please state the agenda items you will be addressing, and if you will address general public comment, you may begin.
Good morning. I am calling in under general public comment in item number 37A, today's agenda. Good morning, Supervisor. I am Naresh Solanki, Mayor of City of Cerritos. On behalf of City of Cerritos and my council colleague, I would like to thank Supervisor Janice Han for directing the County Office for Emergency Management to work with Department of Public Health to put together a clear vaccine implementation plan for Phase 1B. So all cities and community partners can stay coordinated in vaccine distribution effort. On January 14 of this year, I sent a letter to Supervisor Han expressing the City of Cerritos' strong interest in supporting the county by offering a vaccination site in the city to serve our residents and those in surrounding area. The site in Cerritos would be convenient for all the seniors in our community, and the city is able to offer several locations that would serve as a successful vaccination site. If a vaccination site in Cerritos is not possible, I respectfully ask for the
Thank
board.
you. You now have 1 minute to speak on general public comment.
Thank you for board consideration for all allocation of vaccine to be given to the city so that it can be administered by the healthcare providers in Cerritos. The city of Cerritos is grateful to the county for the tremendous work it has been doing in the battle against COVID-19. We are ready and willing to join your effort and to offer our help to get as many people vaccinated as quickly as possible. Thank you for your time and support for consideration of this request. Thank you.
Thank you. Next speaker, please.
Our next speaker is Lourdes Caracoza. Please state the agenda items you will address, and if you will address general public comment, you may begin.
Hello. Yes, I'm addressing. Can you hear me?
Yes, we can hear you.
Okay. Good morning, supervisors. My name is Lourdes Caracoza. I am the president and CEO of Alma Family Services. I want to start by thanking Supervisor Solis for issuing an executive order. I'm speaking on item 21 to expand access to the COVID-19 vaccine to residents 65 years and older. At Alma, we serve seniors. We've stayed connected to them through various ways. Our aquatics have turned into Zoom exercise classes. Our support groups have turned into knitting Zoom groups. Our mental health services have turned into Zoom and other ways to stay connected to keep them safe. I also have a father of 89 years old, and we've been working with our seniors to keep them home and safe, but it has affected them immensely. Their grandparents, their parents, their children and grandchildren are staying away because they don't want to bring the virus home. They want to stay, and they're afraid to die alone. That's what they're hearing. And we know that once they go into the hospital, the isolation...
Thank you. Your time has expired. May we have the next speaker, please?
Our next speaker is Julie Martinez. Please state the agenda items you will address, and if you will address general public comment, you may begin.
Yes, I will be speaking on item 32 and general comment. First, I'd like to say good morning and thank you so much for giving us this venue to speak. In addition to that, I am a part of a group called Check the Sheriff. I'm requesting that the LA County Board of Supervisors create a comprehensive plan to begin the process of removal of Sheriff Villanueva. My family, for the past 5 generations, have been both a victim and bore witness to sheriff abuse. The LA County Sheriff Department acts with impunity within our communities. My family has been personally impacted by Sheriff violence. In addition to that, they have been impacted by harassment. My grandson was shot in the back and killed by a sheriff deputy at a routine traffic stop, of which there was never any citation given. Video was taken by private citizens, which indicates sheriff misconduct. Sheriff Villanueva protects and serves his deputies first.
Thank you. You now have 1 minute to speak on general public comment.
By refusing to end police brutality that is inflicted on the community. When a sheriff refuses to maintain order by allowing rampant misconduct, then the social contract with the community is broken, and the time for the LA County Board of Supervisors to step up is upon us. It is evident from 1, the community's cries for redress, 2, the FBI investigation of the Sheriff Department in terms of deputy gangs, and 3, the state of California Attorney General Becerra has opened up a civil rights violation probe into the LA County Sheriff Department. Villanueva must be removed immediately from office. The community relies upon you to protect our communities from Villanueva's Sheriff Department. Please utilize the trust that we as a community have entrusted upon you through our vote. And please follow through and remove Sheriff Villanueva. Thank you.
Thank you. Next speaker, please.
As a reminder, to address the board, if you have not done so already, please press 1 and then 0 at this time. Do not press 1 and 0 a second time, or you will be removed from queue. Our next speaker is Marissa Hermer. please state the agenda items you will address today and whether you will address general public comment. You may begin.
Hello, my name is Marissa Hermer, and I'm speaking to the S1 Public Health Order. I live and work in the Palisades. I am the co-owner of the Draycott in Palisades Village and also Olivetta in West Hollywood. I'm also the mother of 3 young homeschooled children. And needless to say, this has been an incredibly challenging time for me, our family, our community, our over 200 employees and their families. We will not be able to survive another shutdown, both economically, but also our mental health is severely at stake. As a restaurant community member, we need to hear governor's news, but by now we're also all too familiar with the LA County Board of Supervisors releasing last-minute guidelines that leave restaurants jumping through hoops to be able to reopen as soon as possible. We're very happy to be guided by science, but not the arbitrary implementation of guidelines such as 9 p.m. curfews and minimizing outdoor dining by 50%, even though tables are also set apart feet. The guidelines were based in science in order to reduce COVID-19. And the Board of Supervisors.
Thank you. Your time has expired. Next speaker, please.
Our next speaker is Genevieve Claverel. Please state the agenda items you will address, and if you will address general public comment, you may begin.
Yes, I will speak, Dr. Genevieve Claverel. I will speak to item S1, 12, 21, and 37A. On S1 and all items relating to the COVID vaccine is a lot of misinformation, and that needs to change. I know you all are trying very hard to make it happen, but it's not happening. Many people volunteer to give the vaccination, and at no time we're called to do it. So I think that needs to change tremendously. And so I am in support of everything to accelerate the vaccine in a community and so on, and it's not happening. So also all the items having to do with item 12 having to do with keeping the forest under control is a great idea of Supervisor Barger, and I totally support that. So all the vaccine do your work, and that's important. I mean, I think people are trying, but it's not happening. And I'm not so sure some of the ideas are good anyway. Bye. Have a good day, and wish we have an open meeting again. I miss you all. Bye.
Thank you. Next speaker, please.
Next, we'll go to the line of Unisys Hernandez. Please state the agenda items you will address, and if you will address general public comment, you may begin.
Hi, good morning. My name is Eunices Hernandez. I'm the co-founder and co-executive director of La Defensa and a member of the Justice LA Coalition. I'm here to speak in support of item 11, 24, 26, 32, and general public comment, and agenda item 35. I think the collection of data specifically around the LGBTQ plus community is critically important, especially when we're looking at the traditional system of injustice, how it's hard to identify folks who are transgender, LGBTQ. I know that there's wings in certain jails, but this would really help in ensuring that we can develop the necessary resources for our community members that are part of that community. And just uplifting that we should also recognize and add in Two-Spirit people as often as they are left out of that conversation. And we have Two-Spirit people who are not only a part of our Measure J implementation, but we're a part of the ATI space. I'm also in support of the Restorative Justice Village Master Plan. This falls in line with all the effort and work that we've been doing around reimagining what we could build instead of jails. This would, lead to potentially the construction of housing and other vital services that, the Chinatown community and other community members would need. So I'm really excited to see the community engagement process being incorporated in here, and we would love to support that to make sure that whatever gets built meets their needs. And that community is very vocal, as we saw during the jail construction plan, where they were extremely against it and spoke that no one had connected with them about what was going to be built in their community. On item 26, I think that the report on the Comprehensive Public Safety Reinvestment Plan is important. It's necessary. I can tell you that from being in many of these spaces around closing MCJ, AB 109, Measure J, that there's not a conversation happening about, okay, once we move forward, what do we do with savings? And under Measure R, there was a line around figuring out what to do with savings or how to calculate that. And so I don't think that what was supposed to happen under Measure R is currently happening at the fullest with all of our efforts. So Measure R does need to be implemented, and resources need to be put in COC so that their staff can actually do this report and assessment. The report regarding the removal.
Thank you. You now have 1 minute to speak on general public comment.
Great, thank you. Supervisor Hahn is very familiar with the power of impeachment being from the federal level before coming to the board. And so we've seen how, impactful that could be in removing someone who is volatile. And, we vote the Board of Supervisors into power, so it would be great if they would listen to the community and removing not only this sheriff, but making an appointed position, because he's not the only person who's been volatile in that role. You can look back and it's systemic. And just last thing I want to list is no one is doing anything about the courts. Over 445 court staffers have gotten COVID. 3 have died in the last month. What can we do to close courts for non-urgent matters? I know that they're regulated by the state, but we need to do something here. Also right now in downtown, the courthouses are running with no hot or cold water. No hot water, no HVAC, and no ventilation. And also just want to list that the court is asking to be put in the front of the vaccination list, meaning that other communities will not get access to it. And I don't believe that's the right way to go. Since
Thank you. Your time has expired. May we have the next speaker, please?
Our next speaker is Edward Olmos. Please state the agenda items you will address, and if you will address general public comment, you may begin.
Yes, I'll be commenting on item 21, and I will use general public comment also. Like was stated, I'm James Olmos. I spoke in front of you a little over a year ago on the homeless situation, and I was grateful for the results. I am 73 years old. I'll be 74 in less than a month. And I received the vaccine, and it was very difficult to get. I was very lucky that my daughter-in-law went online and by chance, just literally chance, got to go on. I want to thank Supervisor Solis, the chair of the board, for issuing an executive order to expand access to COVID-19 vaccine for the residents 65 and older. I'm one of 1.3 million people 65 and older in the county. You all know this. You know everything I'm talking about because basically we've been talking about this for a year. And we're among the groups that most benefits from the vaccine. And we deserve it not because of who we are, but because we're the ones who get...
Thank you. You now have 1 minute to speak on general public comment.
The single biggest risk factor for us is hospitalization and then dying. Now, with access to this vaccine, we can keep ourselves and our families safer. I just want to thank all of you for the work that you're doing every single day, but I really want to thank Supervisor Solis for protecting those of us who are most vulnerable with your executive order. May you all understand this, and may you all be blessed without having any of your family attacked by this. I've lost 2 first cousins, primos hermanos. I almost lost my sister, and I almost lost my niece. And yesterday we lost the mother of a good friend of mine. And we really have to implement this. So thank you, all of you, but especially Supervisor Solis for presenting item 21. Thank you.
Thank you. May we have the next speaker, please?
Our next speaker is Lynn Lyman. Please state the agenda items you will address, and if you will address general public comment, you may begin.
Items 10, 26, and general public comment. Good morning, honorable supervisors, and thank you for your hard work and service during this challenging time. My name is Lynn Lyman, a resident, mother, and business owner in beautiful Van Nuys in the 3rd District. As the former California director of the Drug Policy Alliance and former co-director of Yes on Measure R, I joined today to speak in favor of both motions. First, on item 10, I want to thank Supervisors Kuhl and Solis for advancing this motion to add LA County to the pilot overdose prevention program proposed under Senate Bill 57. We all know that fatal overdoses and drug-related hospitalizations have been increasing drastically over the past decade, and we know that those hardest hit are our poor and unhoused residents. And we all know what to do about it. real drug education about mixing opioids and other sedatives, for example, free and widespread drug testing to determine when drug batches have dangerous adulterants in them, and safe, clean places for people to use their drugs. And of course, ending the war on drugs through legalization of all drugs, as we did with alcohol in 1933, is the most effective way to reduce both the harms of drug misuse and the devastation of the criminalization of drug users and sellers. I'm happy to see at least the provision of safe consumption sites moving forward under SB 57. We were pushing for this legislation many years ago when I was still at DPA, and thousands of lives would have been saved if we had acted then. On item 26, the report on Measure R, I merely want to urge the supervisors to follow the law as passed by 73% of the voters. Measure R specifically calls for the assessing of savings from reducing the jail population and for developing a plan for the reinvestment of those savings. While numerous other county bodies, most of which I participate on, are working on strategies to reduce the jail population and expand community-based care, none of them are tasked specifically with assessing and reinvesting the savings. Further, we know that other priorities may arise, or new supervisors may be elected, and the county's current focus on dismantling the largest jail
Thank you.
system
You
in the
now have
world
1 minute
may
to
get
speak on
restricted.
general public comment.
The county's current focus on dismantling the largest jail system in the world may get relegated to the dusty shelves where other jail reduction efforts have gone to die. But Measure R is the people's mandate, and the county is legally obligated to implement it exactly as written and voted in by 1,334,277 Angelinos. I yield my time.
Thank you. May we have the next speaker, please?
Our next speaker is Sullen K. Please state the agenda items you will address, and if you will address general public comment, you may begin.
Hi, I would like to address item S1, and I would also like to address general public comment. Thank you for taking my comment. I would like to urge the LA County Board of Supervisors to reconsider reopening outdoor dining, private gatherings, and personal care salons. If the projections for ICU capacity are as rosy as the public health officers have said for the next 3 weeks, why not wait until we actually hit those metrics? As we speak right now, ICU capacity is closer to 0 than it is 15%. So why not wait until we actually hit those metrics before we even consider reopening outdoor dining, personal care services, and private gatherings? It is only in the best interest of the public to do so. While I understand businesses are hurting, it makes absolutely no sense for people to be doing things that exacerbate the spread.
Thank you. You now have 1 minute to speak on general public comment.
Yes, and it is very important that we make sure that people understand the spread of this virus. If you open up outdoor dining and personal care services, you are setting an example that it is okay to do these things and it is okay to spread the virus. People must understand that for the sake of humanity and for the sake of the city and the county, if we want to live to eat at restaurants another day, we have to stay closed now. And once we hit those metrics, once we have ICU capacity, then perhaps we can have a conversation about reopening dining. But until then, it makes absolutely no sense to do so. And we must maintain our humanity and understand that all the people working at these restaurants are exposing their families, and their families are exposing their families, and so on and so forth. Thank you.
Thank you. May we have the next speaker, please?
Our next speaker is Wendy Guerin. Please state the agenda items you will address, and if you will address general public comment, you may begin.
Yes, I'll be addressing item number 21 and general comment. First, I want to thank the Madam Supervisors. I'm thrilled to be able to say that. I'm 68 years old and signed up to receive the vaccine. It did require persistence in a couple of hours, but made it through Carbon Health and was able to make an appointment for myself and my husband. My husband is 67 and has end-stage kidney disease and is awaiting a transplant. We were both vaccinated at Dodger Stadium on Friday evening, and it couldn't have been easier. We were in and out in just over an hour. I'd like to add that we both felt just fine, nothing more than a sore arm like you'd experience with any other vaccine. I'm calling because I want to express really profound thanks to Supervisor Solis, Chairman of the Board, for issuing an executive order to expand access to the vaccine for residents 65 and older. The single biggest risk factor we know of being hospitalized or dying from COVID is
Thank you. You now have 1 minute to speak on general public comment.
Thank you. With access to this vaccine, we've been given a lot. We can keep ourselves and our families safer, stay out of hospitals, and make a real difference in our county's fight against COVID. Once again, I want to call out Supervisor Solis for her courageous leadership in protecting those of us who are most vulnerable with your executive order. Thank you very much.
Thank you. May we have the next speaker, please?
As a reminder, to address the board, if you have not done so already, please press 1 then 0 at this time. Do not press 1 and 0 a second time, or you will be removed from queue. Our next speaker is King Chung. Please state the agenda item you will address, and if you will address general public comment, you may begin.
Hi, I'd like to address item number 24 and also make a public comment. Good morning, Supervisors. My name is King Chung, a member of the Chinatown Community for Equitable Development. On behalf of myself and Mei Lau, President, and Ernest Lee, Vice President of the Chinese Consolidated Benevolent Association, Peter Ng, Executive Director of Chinatown Service Center, we want to thank Chair Hilda Solis for introducing the motion for the Restorative Justice Village Master Plan. We appreciate that the plan considers Chinatown's top priorities, and we always say affordable housing, cultural center, and economic activities such as food service market as top priorities. We are grateful for your support for our vision to use county-owned land such as Lot 45 for 100% low.
Thank you. You now have 1 minute to speak on general public comment.
We also respect Supervisor Solis for proposing a master plan that considers the most important needs of the unhoused and the formerly incarcerated populations. The Chinatown community is excited about this master plan, and we want to be a full partner in this venture, besides Homeboys and the California Endowment. Please do outreach to the monolingual, non-English speaking residents and businesses in Chinatown. Thank you very much.
Thank you. May we have the next speaker, please?
Our next speaker is Alex Cave. Please state the agenda items you will address, and if you will address general public comment, you may begin.
Yes, hi. I will be speaking on items 11, 24, 26, 32, 35, and general public comment. I'm not sure which agenda item is about restaurants reopening, but I do just want to say you can't operate a restaurant or run a business if you're dead from COVID. So for item 11, I think data transparency is so crucial to allocating help and funds to places where they are most needed. I want to emphasize focusing this data on the LGBTQ statistics on housing, mental health, and criminal justice, especially observing bias and where they are being underserved. And please also acknowledge our Indigenous community by including the Two-Spirit identity. For items 24, 26, and 35, LA County residents have asked for more investment in our communities and away from both incarceration and policies into policing, but putting them into systems of care. With Measure R and other community investment measures have shown that LA is asking for a change in how we operate. We can no longer be known for police brutality, racism, and homelessness, but a place where communities thrive and people are housed and healthy. This is what the people want, and it's your responsibility to make it happen. The fact that 2/3 of AB 109 funds have gone to LASD overtime that is typically used to harass peaceful protesters, families of those who have lost loved ones to police violence, and often communities of color, is shameful, and it needs to halt and stop now. LASD uses their power in traffic stops and hospitals to intimidate and harass members of our community. We know this because of Villanueva. He welcomes this behavior, and with the investigation into the sheriff's department, it is time to take away their blank checks and unnecessary power and invest it in the community, as any data you study shows that more police means more harm. I urge you to do what LA wants and give as much funding as you can into the Care First initiative. For item 32, with the AG now investigating the department, there is no question that LAFD is a corrupt and deadly institution of harm and a waste of our tax money. After listening to Villanueva in the Oversight Commission meetings the last 2 times, he lies, gaslights, and shows no empathy for anyone who lives in Los Angeles. He complains about funding and how he protects victims, but his officers spread COVID because they don't wear any masks. He creates more victims than the public ever.
Thank you. You now have 1 minute to speak on general public comment.
Thank you. He harasses those who have been system impacted by the judicial system. He impedes the judicial process. He hides information and talks poorly about members of LA's government who have the audacity to actually hold him accountable. He is in all definable ways a sociopath and feels no remorse or responsibility for what happens under his watch. It is horrifying that after our last sheriff was arrested and is literally serving jail time for his corruption, that we don't have more measures in place to hold him accountable or have the ability to remove him. I urge the supervisors to act on this now, not in a week from now, because our community is suffering at the hands of the sheriff's department on a daily basis. People are dying not only from that, but from COVID, which also there seems to be no urgency. We are the epicenter for COVID right now. It is absolutely disastrous. And we need to take more responsibility and protect the citizens of Los Angeles as we have asked you to do. Please listen to us. Please hear us. Please protect us. This is the least that you can do.
Thank you. Your time has expired. Next speaker, please.
Our next speaker is Tyron Moore. Please state the agenda item you will address, and if you will address general public comment. You may begin.
Hello, my name is Tyron Moore. I'll be addressing item number 32 and giving general public comment. First, I would like to acknowledge the board, all 5 Madam Supervisors. I would urge you to press forward with item 32 with the removal of the sheriff. As been stated by multiple previous callers, that he has no regard for a large majority of the population of LA County. The sheriff department has continued to harass our county and our residents for far too long. While we appreciate the board's efforts to uphold the law, to uphold law enforcement agents accountable to standards of integrity and community safety, while we are glad to see the county working with the Sheriff's Civilian Oversight Commission to hold...
Thank you. You now have 1 minute to speak on general public comment.
To hold this obstructionist, dictatorial sheriff accountable, we also urge the board to go further and continue to take measures to direct funding out of the sheriff department budget, as well as other related offices, such as probation and the DA's office, and instead redirect those funds to alternatives to incarceration and the building of infrastructure of care. Just as a personal note, I have personally heard the sheriff speak of on what he thinks about LA County residents, and it is shameful and not to be upheld of someone of his office. Thank you, and I yield the rest of my time.
Thank you. Next speaker, please.
Our next speaker is Luis Garcia. Please state the agenda items you will be addressing, and if you will address general public comment, you may begin.
Item 21. Buenos días. Mi nombre es Luis García. Quiero darle las gracias a la supervisora Hilda Solís por darnos la oportunidad de obtener la vacuna del COVID a las personas mayores de 65 años. Yo tengo 70 años y trabajo como parking attendant y soy miembro del sindicato TIMSA. Gracias a esa orden ejecutiva, mi esposa y yo pudimos fue una experiencia muy organizada y posible. Gracias a usted, Supervisora Solís. Siendo una persona mayor y de una categoría vulnerable, el poder obtener la vacuna es una bendición. Entiendo que todavía tenemos que tener mucho cuidado, pero da un poco más de tranquilidad que estamos un poco más protegidos. Gracias por protegernos y por darnos esta oportunidad con esta decisión. Gracias.
Thank you. Can I have the translator, please?
Good morning. My name is Luis Garcia. I'm speaking on item 21. First of all, I would like to thank Supervisor Hilda Solis. I was able to get the vaccine. I am 70 years old and I work as a parking attendant. Thanks to the executive order, my wife and I were able to get the vaccine. It was a coordinated and great effort at the vaccine site. The vaccine is a blessing, and we still need to take care of ourselves, but thank you very much for your leadership. That is all.
Thank you. May we have the next speaker, please?
Our next speaker is Suja Lowenthal. Please state the agenda items you will address, and if you will address general public comment, you may begin.
Good morning. The item is item 37A. Good morning, Honorable Chair and Honorable Board members. I am Suja Lowenthal, City Manager of the City of Hermosa Beach, speaking on behalf of the Hermosa Beach City Council in support of item 37A. Thank you, Supervisor Hahn, for directing the county's Office of Emergency Management to work with the Department of Public Health to put together a clear vaccine implementation plan for Phase 1B so all cities and other community partners can stay coordinated in the vaccine distribution effort. The South Bay cities are partnered with one another and look forward to joining the county in partnership to increase vaccine access for all of South Bay populations. This item would increase the flow of vaccines needed to ensure more of our communities receive the COVID-19 vaccine. On behalf of the City of Hermosa Beach City Council and the entire city staff, we thank you.
Thank you. May we have the next speaker, please?
Our next speaker is Gina Viola. Please state the agenda items you will address, and if you're addressing general public comment, you may begin.
I'd like to speak on items 26, 32, S1, and general public comment, please. For item 26, Measure R resoundingly passed in the county. 73% voted for this. I strongly recommend the board immediately take action to allocate funding to support the commission in hiring a full-time consultant and data research team so that it may comply with the requirements of the Measure R mandate. Another item in Measure R was granting subpoena power to the Sheriff Civilian Oversight Commission, which he promptly ignored. So bringing me to item 32, it is imperative that you look at ways to remove this sheriff. He told you more than 2 years ago that he doesn't answer to the Board of Supervisors. He only answers to the voters. So the voters passed Measure R, and we gave the Civilian Oversight Commission subpoena power. And then he decided he doesn't answer to the voters either. And he only complied and showed up after a judge ordered him to do so. He has only been on two total hours since the beginning of the pandemic of the Sheriff Civilian Oversight Commission, in addition to the 13 people that his department has murdered since the uprising of the George Floyd murder. It is imperative you take steps to do something about this now. This department is riddled with racism, and it's just every additional killing is on your hands when you don't do something. S1. I work in trade shows. In fact, I supply staff to work in trade shows. Do you hear me coming to these meetings or emailing you or calling you or showing up at your house to ask when trade shows will resume? No, you do not. Do you know why? Because I absolutely know that it is not safe for trade shows to resume until we have guaranteed health care for all. I started my business 24 years ago, and this pandemic has come at a great cost to me personally as a result. Yet again, you do not hear me clamoring to bring back trade shows. I know that it is not safe to do so. Your complete failure to properly close
Thank
things
you.
like
And I have
malls,
1 minute to speak
retail,
on general public comment.
Thank you. Your failure to properly close things like malls, retail, and the like are the reason COVID is raging out of control here in Los Angeles. In fact, what you've done is endanger the folks who truly are essential workers, our healthcare workers, our grocery store workers. You have put them at an unspeakable risk, and they have dearly, dearly paid the price for this. You want to continue opening at a pace that makes absolutely no sense with previous safety orders you've made. You are continuing to sacrifice the working class in this county, primarily folks of color. And you aren't just sacrificing the workers themselves, you are decimating their families for generations. Those folks are coming home and getting elders sick, and they are dying at alarming rates. The folks are going to work and leaving children at home alone to navigate Zoom school and be vulnerable to all that the internet exposes them to with potentially no supervision. This is genocide on the working class. Make no mistake about it. Your willingness to sacrifice lives show that you assign different values to different people.
Thank you. Your time has expired.
We already know you do this with the
please.
houseless residents.
Our next speaker is Eric Previn. Please state the agenda item you will address, and if you will address general public comment, you may begin.
Hello? Can you hear me?
Yes, please go ahead.
Okay. It's Eric Previn from Studio City calling, and I'm very worried about the endless fighting with the sheriff, and whereas I appreciate that he's been, out of line completely, it seems to me that trying to remove him by having Mr. Castro Silva look closely at the charter is not the answer, I hate to say. I think the answer is to meet with him regularly and overwhelm him with reason and budgetary constraints. So that's a better way to go. I also have to emphasize that you guys are in a very, very, very bad area with regard to these Board of Supervisor meetings. Austin Bootner, who runs the biggest school district in our region, was cut off unceremoniously after 59 seconds for no reason. We didn't get to hear him complete his thought. The mayor of Long Beach was interrupted by the moderator. We need to find a way to quit the bullshit and make it clear that the public is a priority and that 60 minutes...
Thank you. Your time has expired. May we have the next speaker, please?
General public comment.
Our next speaker is Andres Kwan. Please state the agenda item you'd like to address, and if you're addressing general public comment, you may begin.
Andres Kwan, ACLU, item 32 in general public comments. We may have a new day in our country, but not in our county. We have a new president, but we still have the same sheriff. Let's not forget that. For 2 years, we sounded the alarm about Villanueva, whom the LA Times has dubbed the Trump of LA. Along with BLM and our labor partners to check the sheriff, we demanded his resignation for being a clear and present danger to civil liberties, since the COC passed a unanimous resolution doing the same. Last Friday, AG Becerra launched a wide-ranging investigation into the sheriff. This came after months of our urging him to do so. These investigations are extremely rare and dead serious. They also take years, but we don't have time. As you've heard, LA Sheriff's deputies are targeting, stopping, brutalizing Black and Brown Antolinos right now. They're killing our people right now. LA sheriffs have killed more than 13 people, mostly black men, in the months since the murder of George Floyd. The John Kesey in South LA riding his bike. Andres Guardado shot in the back execution style by a deputy who was alleged to be being initiated into the executioner's gang in the Consul station. And the crisis of white supremacist deputy gangs has gone
Thank you. You now have 1 minute to speak on general public comment.
And nowhere else. So no, it is not a new day in LA. In fact, we're in the thick of the night right now. Why? Because there's no real checks and balances. And the Trump of LA has revealed this quite clearly. So what we need is for you, supervisors, to step up. You have the duty to supervise the sheriffs. You cannot wait for the AG to do something 4 years from now. You have the tools to check the sheriff right now. And you should waste no time in proposing to the voters a charter amendment to allow for the impeachment and removal of the sheriff. Not just this sheriff, but any sheriff. So the sheriffs don't engage in widespread corruption and obstruction of oversight. So they at least think twice before bullying and personal attacks, for example, calling a supervisor La Malinche. Until we eradicate deputy gangs and meaningfully check the sheriff and create alternatives to the sheriff and to incarceration, there is no chance for a new day in LA.
Thank you. May we have the next speaker, please?
Our next speaker is David Green. Please state the agenda items you wish to address, and if you will address general public comment, you may begin.
Good morning. I'm speaking on item 18 in general public comment. My name is David Green, and I'm the treasurer for SEIU Local 721, which represents 95,000 public sector workers. Also a proud children's social worker for DCFS. I speak in support of Chair Solis and Supervisor Mitchell's item 18. I strongly support the expansion of the upfront family finding program to all regional DCFS offices. I spent my first 7 years at DCFS as an adoption social worker and saw firsthand how expanding the upfront family finding program will produce more stable placements and a better future for the children in our system. Designed to provide foster children with an alternative to living in foster homes with people that they don't know or in group home care facilities, the UFF program employs part-time and previously retired children's social workers to seek out and recruit family members to care for children within their first 90 days of foster care. The UFF program was piloted in 10 out of 20 Department of Children and Family Services regional offices with outstanding results. Our children's social workers have to juggle so many responsibilities in the first weeks after a child is removed from their parents.
Thank you. You now have 1 minute to speak on general public comment.
And recruit relatives. With the UFF program, specialized teams focus on recruiting placement opportunities with kin, and the results are very impressive. The UFF program reduces the dislocation caused by moving children multiple times to different short-term placements. Over time, it will help reduce the disproportional share of Black and Latino children placed in out-of-home care. A wide body of research shows that children in foster care suffer less trauma, maintain better emotional health and stability when they're placed with relatives, and able to maintain connections with siblings. Research also shows children placed with relatives are more likely to find permanent homes through adoption or guardianship when they cannot be returned to their parents. I urge you to support and pass this board motion to support the children we care for and hope to protect. Thank you.
Thank you. May we have the next speaker, please?
Our next speaker is Andrew Chow. Please state the agenda items you wish to address, and if you will address general public comment, you may begin.
Thank you. This is Andrew Chow, Council Member, City of Diamond Bar. I'm calling in support of item 37A and making public comment. It is the motion for Phase 1B vaccine distribution plan. I want to thank Supervisor Hahn for her leadership in directing the county's Office of Emergency Management to work with the Department of Public Health to put together a clear vaccine implementation plan for Phase 1B for all cities and other community partners. And Diamond Bar is deeply appreciative. We'll look forward to further partnership with the county, and hopefully we can set up a testing or vaccination site in and around our city of Diamond Bar as well. Thank you so much.
Thank you. May we have the next speaker, please?
Our next speaker is Heather Corrado. Please state the agenda items you will address, and if you will address general public comment, you may begin.
Hi. I wish to testify on agenda item S1 about the public health order and general public comment. I'd like to start with everyone is essential. Calling people non-essential is discriminatory and wrong. Creating two classes of people is against the California Constitution, Section 7B. Everyone is essential, and their job is essential to them. We all want to save lives, but business shutdowns do not save lives. The Stanford study from last week shows that business shutdowns and stay-home orders don't slow the spread any better than just voluntary encouragements. It was a good try, but shutdowns just don't work. They backfire. But shutdowns have created unemployment and despair, leading to spikes in suicide, people falling back into addiction and dying via overdosing, increases in domestic violence and homicide, and massive poverty. Local suicides here where I live have gone up, and people are in despair over the shutdown.
Thank you. You now have 1 minute to speak on general public comment.
Thank you. My neighbors and friends have been deeply hurt by the shutdowns, and most of them actually have lost their jobs and are struggling to find new jobs as well as new homes because they can't afford the homes they were in before. We need win-win solutions that save lives, jobs, and liberties in the real world of Los Angeles County. Other states are calling for indoor dining to open so that people can congregate in a way that is safer than massive underground parties That is pragmatism and reassessment. We need a win-win solution. Let everyone work if they need to, or go to school, or volunteer at the hospital, and then encourage everyone to limit their activities to what they personally believe is most essential and let them do it safely. That diffuses the anger of not being allowed to work or exercise our rights, but still encourages safe behavior. Shutdown mandates do not save lives. Shutdowns only backfire in the real world. People need to have the right to work and to actively help others. My husband and I are also facing the loss of our
Thank you. Your time has ended.
Thank you.
Are there any further speakers?
There are no further speakers.
Thank you. Our time for... Yes.
Madam Chair, this is Supervisor Hunt. I mean, there are more speakers. We do know that there are more people on the queue. Would it be appropriate, since we didn't meet a lot this month, that we extend public comment?
No, because I'm sorry, but everything has been set. We have so many hearing items up and people in the queue there, so they can submit their comments, as you know, and we had over 3,300 that were submitted, so we would...
Right, I just think we should admit there are more speakers on the queue. I know for a fact.
Yeah, absolutely. Okay. We know that. Yeah, thank you. Okay. So our time for public speakers is ended. Thank you all that called in. And as a reminder, if you were unable to provide comments, you may submit written comments as indicated on the agenda, and we'll continue to accept all your written comments that come in during this meeting, which will all become part of the record. At this time, I wanted to recognize Sheriff Villanueva, who requested to address the board on item 32. Sheriff will have 3 minutes. He can begin.
The sheriff is not on the line.
Okay, the sheriff is not on the line. We did accommodate him, and we're clear that he had 3 minutes to address the board. Okay, very good. Let's move on then. Madam Executive Officer, please indicate the agenda item numbers. Oh, excuse me. Oh, okay. Sheriff Villanueva, are you present?
Yeah, I'm trying to unmute myself here. All right.
Okay. We can hear you. Go ahead. Thank you.
All right. Sorry, I'm on the road here.
Okay.
Well, real quick, LA County is facing not one but two life-threatening epidemics. One is a silent killer, having claimed more than 15,000 residents and infected more than 1 million. The pain and suffering of those who lost their lives in COVID-19 is amplified by those who have lost a loved one to gun violence. Homicide rates in Los Angeles County shot up 36% in 2020, and for the first 3 weeks of 2021, rose an astonishing 162%. This is almost one life lost every day to violence in our communities, and the challenges faced by my department are unheard of in past administrations. The well-funded and coordinated national effort to delegitimize the entire profession of law enforcement only adds fuel to the fire of the rising violence seen in our communities. All those who jump at the opportunity to condemn deadly uses of force without knowing the facts only serve to increase the likelihood of violent encounters between armed suspects and deputies in the field, as we witnessed in the Compton ambush last year. In spite of the worn-out accusations of being against transparency and accountability, I can say being sheriff is all about doing both while preserving the rights of all. It is a delicate balance between public demands for transparency and the need to protect integrity of investigations that often are in their infancy. Okay, now, compromise the integrity of an investigation, such as deadly use of force, will come back to haunt the very people who clamor for justice to be served. It will also damage both the ability of prosecutors to succeed in their case in court and the ability of the county to defend itself against lawsuits. When I announced a new policy addressing deputy conflicts and subgroups, I fully expected the Inspector General and the Oversight Commission to acknowledge this as we enforce it moving forward. All previous sheriffs took a pass at this problem, which has always been long on perception and preciously short on supporting facts. Now, moving forward, we're working on improving our investigative protocols in critical incidents and affirming our unwavering support for victims of crime. We are reaching out to the governor's office to seek authorization to use our paramedics and EMTs and create a robust plan to vaccinate the homeless population. I want to thank all the supervisors who met with me over the last few months, and in particular Supervisor Mitchell. She has the distinction of being the very first supervisor from the 2nd District who has agreed to meet with me since I took office in 2018. In closing, I will say that President's inaugural speech made a very important point in driving home the need to work together towards a common cause. He spoke of defeating lies and defending the truth. I am here to do both, as is every member of the Sheriff's Department. At the end of the day, we voters will want to know how we spend our time and energy. People are tired of political attacks and spin. It doesn't make their lives any safer. They will be more encouraged to see us work together to defeat the twin pandemics of COVID-19 and violence. File item 32 where it belongs, and come join me for the challenges awaiting our leadership. Thank you.
Thank you very much, Sheriff. We appreciate your joining us. Now we will turn on to item number 5. Madam Executive Officer, please indicate the agenda item numbers on which we will be voting.
The items before you are items 1D through 2D, 1P, 8, 10, 12, 14 through 23, 25, 27, 29 through 31, 33 through 36, 37A, 37B as amended, 37D through 37F, 40 through 42.
Moved by Supervisor Kuehl, seconded by Supervisor Mitchell to approve these items. Madam Executive Officer, please call the roll.
Supervisor Mitchell?
Aye.
Supervisor Mitchell, aye. Supervisor Kuehl?
Aye.
Supervisor Kuehl, aye. Supervisor Hahn?
Aye.
Supervisor Hahn, aye. Supervisor Barger?
Aye.
Supervisor Barger, aye. Supervisor Solis?
Aye.
Supervisor Solis, aye. Motion carries 5-0.
Thank you, members. Now we'll turn to item number 6, public hearings, summaries, and departmental statements. Before we take up public comment on the public hearing items, the Executive Officer will read the short titles of each public hearing item. For the appeal hearing, item 7 will also hear from the appellant and applicant. Madam Executive Officer, please swear in those who plan to testify before the board on the public hearing items.
In the testimony you may give before this board, you solemnly swear to tell the truth, the whole truth, and nothing but the truth, to help you God. Item 1 is a hearing on annexation of a single lot numbers 042-2018 and 092-2018 in the city of Carson. A written departmental statement was provided and no correspondence was received. Item 2 is a hearing on the annexation of petition numbers 46-616, unincorporated Azusa, 47-616, and 28-617 in Valinda, and 35-416 in East Rancho Dominguez. A written departmental statement was provided and no correspondence was received. Item 3 is a hearing on the detachment of Zone 81 Deer Lake Ranch from County Landscape Maintenance District Landscaping and Lighting Act District 4. A written departmental statement was provided and no correspondence was received. Item 4 is a hearing on the detachment and transfer of Zone 28 Vista Grande from the County's Landscaping and Lighting Act District 2 to Vista Grande Townhomes Owners Association. A written departmental statement was provided and no correspondence was received. Item 5 is a hearing on ordinance for adoption to grant a proprietary water pipeline franchise to Northwood Grumman Systems Corporation to construct and operate facilities in connection with groundwater remediation project for 15 years in the unincorporated area of Avocado Heights, Fassett, and North Whittier. There is no departmental statement and no correspondence was received. Item 6 is a hearing on resolution updating the developer fee program to approve the development fee fire station plan, the district developer fee funds, the 2019-20 fiscal year end report, and the 2020 developer fee updated fee calculation summary to increase the development fee rates in the unincorporated Santa Clarita Valley, effective April 1st, 2021, from 1.2831 to $1.3120 per square feet. There is no departmental statement and no correspondence was received. Item 7 is a hearing on appeal of project number 2018-003928-5 to authorize the conversion of existing single-family residential structure into a child care center located at 2121 North Thornhill Avenue in the unincorporated community of Altadena within the Altadena Zone District. A written departmental statement was provided and correspondence was received.
Yes, thank you. The appellant, Dan Alderman, will be given 2 minutes. Mr. Alderman, please begin.
Yes, thank you. I'm speaking on behalf of the appellant, Mary Kazemi. Numerous correspondence has been submitted on the objections to this project, including statements from Steve Lamb and Dorothy Wong, who both have some specific expertise on the traffic and building issues. We previously had a telephone conversation in November with Anish Saraya to express specific concerns about the project. He acknowledged some of the issues and said he would work in making recommendations to address our concerns. We have not had the opportunity to see what he has come up with in terms of solutions. We therefore request a continuance of this hearing until we've had an opportunity to see what he has concluded to determine if they alleviate some of our concerns. The objections to the project focus on traffic issues, noise issues, and safety issues. Without addressing these concerns, this project will not only be a detriment to adjacent homeowners, but also a danger to the students and to the community at large. These concerns that are not properly addressed will most likely lead to future litigation and liability exposure on all entities involved in the approval of the project. This is a single-family house that is being turned into a school with multiple staff members and an unknown amount of students present at one time. The proposal that states the number of children will increase from 14 that are currently present to 49. However, the 49 is the alleged maximum in actual class at one time, but the number could be far greater for kids coming and going who are not in class. This is basically a single-family home daycare that is being turned into a business in a residential community. The home has only 1.5 bathrooms and has not been properly retrofitted for earthquakes and does not seem compliant with ADA and other required standards. It is not a structure that is meant for a large school. Ms. Kazemi's property is directly adjacent to the school. Their property will be adversely affected by having a large, noisy school right next door to it in a residential neighborhood. There would have to be a minimum adequate soundproofing and an 8-foot concrete wall, not the vinyl wall of 6 feet proposed, to minimize...
Thank you. Your time has expired.
Thank you. The applicant, Lucy Trapea Baruman, will be given 2 minutes. Ms. Baruman, please begin.
Yes, can you hear me?
Yes.
All righty. Good morning, honorable members of the Board of Supervisors. My name is Lucy Trapea Baruman. I'm here today to ask for your support of an extremely worthwhile project. We are seeking to convert a single-family residence into a child care center with up to 49 children. This child care center, however, is not your typical center. It is Rayuela, the only Spanish immersion child care center in the area, and it will fulfill the community's need for quality child care, develop an indirect partnership with Pasadena Unified School District by preparing children to enter PUSD's dual language Spanish immersion program, and it is aligned with the state of California's vision of 21st century education. Proposition 58 passed in 2016 by 73% of California voters, also known as the California Education for a Global Economy Initiative, promotes multiple pathways and opportunities, including language immersion programs for any student to become proficient in 2 or more languages. After Proposition 58, that led to Global California 2030. Global California 2030 is a call to action. One of its goals is that by 2030, half of all K through 12th grade students participate in programs leading to proficiency in 2 or more languages. It is clear that the voters of the state of California affirm multilingualism is a priority in our state, that we must cultivate language skills, and that these skills and expectations build a successful global economy. All of these points fall in place with Rayuela's vision and mission. Rayuela will fulfill the needs of our families, provide an excellent foundation for our public school district, and will align with California's educational initiatives. This is a project of passion, purpose, and possibility. We respectfully...
Thank you. Your time has expired.
Thank you very much to the speakers. Now we will take public comment on the public hearing items 1 through 7. Madam Executive Officer, please read the call-in information that was also provided on the agenda and explain the speaking rules to those members of the public who are calling in to address the board.
Thank you, Madam Chair. As indicated on the agenda, members of the public wishing to offer public comment on items 1 through 7 should call 844-767-5651 and use participant code number 1003836. To repeat, please call 844-767-5651 and use participant code number 1003836. Do not call the number if you only want to listen to the meeting. To listen only, please call 877-873-8017 and follow the instructions. To members of the public calling in, when it's your turn to speak, please state your name and which public hearing items you wish to speak on. Each person will have 1 minute for all of the public hearing items. We will allocate up to 60 minutes for the public comment on all the public hearing items. If there are no speakers waiting before 60 minutes have lapsed, we will close public comment. We will continue to accept all written comments that come in during the meeting, which will become part of the record. When speaking on the public hearing item, you must be on topic. Our goal is to get through as many speakers as we can. If you're not speaking on topic, or if we cannot tell if you're speaking on a public hearing item, you will get 1 warning from County Council or the Chair. If you do not immediately or clearly get on topic, or if you stray off topic again, you will forfeit the rest of your time and the Chair will move to the next speaker. Please note that if you're also listening to the board meeting on a computer or speakerphone, you will need to turn down the volume on those devices as soon as the moderator calls on you. If you do not turn down the volume, there will be an echo. Moderator, may we have the first speaker, please?
Please press 1, then 0 at this time. Do not press 1, then 0 a second time, or you will be removed from queue. Our first speaker is Liliana, I apologize, it's Colleen Hampton. Please state you have 1 minute to begin, Ms. Hampton. Please state the public hearing agenda item you'll be addressing today. You may begin.
Hi, can you hear me? Hello?
Yes, we can hear you. Please go ahead.
Thank you so much. I'm speaking on agenda item number 7 and general comment. Thank you so much for the opportunity to speak today. My family lives less than a block away from Rayuela's preschool, and there is nothing more we love than being able to walk our 4-year-old to school each and every day. In this trying time, the feeling of community and a neighborhood is a highlight of our day. Waving at neighbors and noticing small changes on our walk builds such a sense of community. This is worlds away from driving to a preschool in an nondescript building for drop-off and pickup as we did with our older child. As an active member on the Nextdoor app, I'm extremely excited by the new families and the old families in our neighborhood interested in a walkable community pre-K. The expansion of Rayuela and the approval and support of a conditional use permit.
Thank you. Your time has expired. May we have the next speaker, please?
Our next speaker is Maria Fernanda Garcia. Please state the public hearing agenda items you're addressing today. You may begin. 1 moment.
Hello?
Ms. Garcia, you may begin.
Yes, thank you. My name is Maria Fernanda Garcia, and I am the director of Rayuela Uno, and I've been leading the technical development of this process. I will translate a letter from our neighbors, Miss Maria Escalante and Medardo Monge. They are the neighbors in property 290 East Woodbury Road, next to our school. So they ask us, because they don't speak English, to translate it. It says, we hereby express our support for the Rayuela School expansion project. From the moment we arrived at this house more than 17 years ago, the adjacent lot of our property where today the school is located, it has been a source of problems due to the fact that everyone throws its trash like a garbage dump and parks their abandoned cars. For example, since we moved here, there is an abandoned...
Thank you. Your time has expired. May we have the next speaker, please?
Our next speaker is Jenny Collins. Please state which public hearing agenda item you will be addressing. You may begin.
Hi, members of the board. Thank you for your time. My name is Jenny Collins. I'm calling in support of hearing item number 7. I have full confidence in the directors of this school that they will not implement this expansion too rapidly or in any way that is disrespectful to its community. In these last 10 months, everyone is talking about the importance of our teachers, schools, and childcare facilities in our society. They're now better recognized as playing an important role in supporting our economy and, of course, in educating our future citizens. This is a moment when I hope you will help us support these educators and promote the survival of this small women-run business. Schools in our community are great for our property values. I live near a school in Altadena that my kids will not attend, and it's a pleasure. I cannot wait until I get to go, or until those kids get to go back to school and I can hear those voices on their playground. The Rayuela team has addressed and planned for their parking and drop-off situation meticulously, thoughtfully, extensively, with much respect for their neighbors. Finally, I would like to mention...
Thank you. Your time has expired. Next speaker, please.
Our next speaker will be Ashley Jeffrey. You have 1 minute. Please state the public hearing agenda item you are addressing today. You may begin.
Yes, hi, it's Ashley from Los Angeles. S1, the public health order for COVID-19 and the status on the COVID-19 vaccine. First of all, guys, you know, people are talking about this vaccine, but it's really...
I'm sorry, we're on the public hearing items right now. You may address items number 1 through 7.
Yeah, I'm doing S1 right now. Hello?
No, I'm sorry. S1 has ended already.
Well, that's why I called up.
I'm sorry, we're on public hearing items right now.
So I can't talk about S1?
You can submit a written comment through the website. Thank you. Next speaker, please.
Our next speaker is Eric Previn. You have 1 minute. Please state the public hearing agenda item you are addressing today. You may begin.
Yeah, I'd like to give a little comment on all the public hearings because I'm a public hearing enthusiast. And, you know, the one I'm looking at right in front of me now has to do with updated developer fees for the Consolidated Fire Protection District in the County of LA, in the 3rd District, where I live, and the 5th District. Now, they want to increase the fee from 1.28 to 1.31 per square foot of new development. You know, it sounds modest, but given that we're in a pandemic, is now the time to do that? Everybody has been taking a lot of heat, and I must say, with the previous caller talking about the pandemic as well in S1, I don't understand why Supervisor Hahn is not being respected, Supervisor Solis, and the people are not being respected. Wow. Because these public hearings are about the public weighing in on issues like the developer fee. And
thank you. Your time has expired. May we have the next speaker, please?
Our next speaker is Robert Matthew. You have 1 minute. Please state the public hearing agenda items you will address today. You may begin.
Agenda in Altadena. In the ensuing and unprecedented 10-plus months since we made our last statement at the hearing on March 11th, the arguments against this expansion project certainly don't seem to have changed much and definitely don't seem to have gotten any less weak, whereas the arguments in favor have gained considerable strength. Most notably, as our communities move toward a post-pandemic reality, we will see an even greater need for daycare providers and preschools, as the pandemic has ravaged the child care industry to the extent that a large number of such providers have gone permanently out of business. For a high-quality program like Rayuela to not only survive the pandemic, but to be able to emerge with greater capacity will be critical to allowing our local economy to rise back to its pre-pandemic levels and thrive further. Now is the time when it is even more important for programs like Rayuela to be allowed to expand as planned. I'll close by imploring the committee to confirm the previous decision and grant final and unequivocal approval for this project at this time without further delays, or risk becoming complicit in the killing of this project that has become even more vital over the last
Thank you. Your time has expired. May we have the next speaker, please?
Madam Chair, there are no other speakers in the queue to address the board.
Thank you very much. Our time for public speakers on the public hearings has ended. I want to thank all of you that called in to speak, and if you were unable to provide your comments, you may still submit written comments as indicated on the agenda, and we will continue to accept all of those written comments that come in during the meeting, which will become a part of the record. Today, we will begin with public hearing items 1 through 7, followed by the set item S1, then item 37C, followed by items 11, 24, and 26, and finishing with item 32. We will now go to item 1, hearing on annexation and levying of assessments for county lighting districts in the city of Carson. Public hearing on annexation and levying assessments in the city of Carson. Are there any supervisors that would like to make remarks? If so, please unmute your mic and begin speaking. Seeing none, it would be appropriate to close the public hearing, direct the tabulation of the ballots, and table this item until later in the meeting for tabulation results and action by the board. That will be the order. We will now take up public hearing item 2, hearing on annexation and levying of assessments in the unincorporated areas of Azusa, Melinda, and East Rancho Dominguez. Are there any supervisors that would like to make remarks? If so, please unmute your mic and begin speaking. Seeing none, it would be appropriate to close the public hearing, direct the tabulation of the ballots, and table the item until later in the meeting for tabulation results and action by the board. That will be the order. Now we will take up the public hearing item number 3, hearing on the detachment of Zone 81, Gare Lake Ranch. Are there any supervisors that would like to make remarks? If so, please unmute your mic and begin speaking. Seeing none, it would be appropriate to close the public hearing and vote on this item. Item 3 is before us, moved by Supervisor Barger, seconded by me to approve the item. Madam Executive Officer, please call the roll.
Item 3 is before you. Supervisor Mitchell.
Aye.
Supervisor Mitchell, aye. Supervisor Kuehl.
Aye.
Supervisor Kuehl, aye. Supervisor Hahn.
Aye.
Supervisor Hahn, aye. Supervisor Barger.
Aye.
Supervisor Barger, aye. Supervisor Solis.
Aye.
Supervisor Solis, aye. Motion carries 5-0.
Okay, that item is approved. We will now take up the public hearing item number 4, hearing on the detachment of Zone 28, Vista Grande. Are there any other supervisors that would like to make remarks? If so, please unmute your mic and begin speaking. Seeing none, it would be appropriate to close the public hearing and vote on this item. Item 4 is before us. I will move, seconded by Supervisor Mitchell, to approve the item. Madam Executive Officer, please call the roll.
Item 4 is before you. Supervisor Mitchell.
Aye.
Supervisor Mitchell, aye. Supervisor Kuehl.
Aye.
Supervisor Kuehl, aye. Supervisor Hahn.
Aye.
Supervisor Hahn, aye. Supervisor Barger.
Aye.
Supervisor Barger, aye. Supervisor Solis.
Aye.
Supervisor Solis, aye. Motion carries 5-0.
Thank you. That item's approved. We will now take up public hearing item number 5, hearing to grant a proprietary water pipeline franchise to Northrop Grumman Systems Corporation. Are there any other supervisors that would like to make remarks? If so, please unmute your mic and begin speaking. Seeing none, it would be appropriate to close the public hearing and vote on this item. Item 5 is before us. I will move, seconded by Supervisor Kuehl, to approve the item. Madam Executive Officer, please call the roll.
Item 5 is before you. Supervisor Mitchell.
Aye.
Supervisor Mitchell, aye. Supervisor Kuehl.
Aye.
Supervisor Kuehl, aye. Supervisor Hahn.
Aye.
Supervisor Hahn, aye. Supervisor Barger.
Aye.
Supervisor Barger, aye. Supervisor Solis.
Aye.
Supervisor Solis, aye. Motion carries 5-0.
We'll now take up public hearing item number 6, hearing on fiscal year-end report and updated developer fee. Are there any supervisors that would like to make remarks? If so, please unmute your mic and begin speaking. Seeing none, it would be appropriate to close the public hearing and vote on this item. Item 6 is before us, moved by Supervisor Kuehl and seconded by Supervisor Barger to approve the item. Madam Executive Officer, please call the roll.
Item 6 is before you. Supervisor Mitchell. Aye. Supervisor Mitchell, aye. Supervisor Kuehl.
Aye.
Supervisor Kuehl, aye. Supervisor Hahn.
Aye.
Supervisor Hahn, aye. Supervisor Barger.
Aye.
Supervisor Barger, aye. Supervisor Solis.
Aye.
Supervisor Solis, aye. Motion carries 5-0.
We'll now take up the public hearing item number 7, hearing on an appeal of project number 2018-003928-5 in the unincorporated community of Altadena. Supervisor Barger, would you like to make remarks?
Yes, I'm going to read a motion regarding this item. This project would authorize the conversion of an existing single-family residence in Altadena into a child care center with up to 49 children and 5 full-time employees. The project proponent, the Rayuela School, has successfully operated a child care center in the community for several years, and this new location would allow for increased enrollment in its unique and valuable Spanish immersion program. However, this new location could result in impacts to the surrounding neighborhood, which must be addressed through operational controls and street improvements. Prior to the Regional Planning Commission's hearing regarding this project, the Departments of Regional Planning and Public Works worked closely with the proponent to develop a comprehensive list of conditions that would apply to the project, and the Altadena Town Council expressed support. During the Commission's hearing, which occurred over 3 separate dates, neighbors and community members expressed concerns, and in response, the Commission directed Regional Planning and Public Works to modify some of the proposed conditions and to add others. For example, the size of the proposed on-site pickup, drop-off, and parking area was expanded to accommodate additional vehicles, reducing potential traffic queuing impacts on Woodbury Road. The Commission approved this project on June 24, 2020. However, the decision was appealed, and some neighbors and community members remain concerned about potential impacts, especially those related to traffic, parking, and bicyclist and pedestrian safety. The Board of Supervisors has an opportunity to further modify the proposed conditions to address these concerns while allowing this project to move forward. I propose an additional condition related to a potential preferential parking district in the neighborhood. If the board adopts a preferential parking district in the future, the project proponent shall be responsible for paying the initial permit fee assessed to owners of properties located on the blocks of Alta Pasa Drive and Garfield Avenue adjacent to the child care center. I also propose a modified condition related to reconstructing the existing curb at the southwest corner of Woodbury Drive and Garfield Avenue. The condition currently requires that the existing curb ramp be reconstructed to meet Americans with Disabilities Act guidelines. The modified condition shall require the existing curb be reconstructed and expanded into a bulb-out configuration as approved by Department of Public Works after review of design alternatives, with a curb ramp that meets Americans with Disabilities Act guidelines. Additionally, during ongoing discussions with the community, residents expressed concerns about the general traffic condition along Woodbury Road. I therefore move that the Board of Supervisors, 1, indicate its intent to determine that the project is categorically exempt pursuant to Section 15303 of the California Environmental Quality Act guidelines, Class 3, new construction or conversion of small structures categorical exemption, indicate its intent to deny the appeal, and 2, instruct County Council to prepare the necessary findings to affirm the Commission's approval of conditional use permit number RPP L201-800-6181 with the modified conditions described in this motion. I further move that the Board of Supervisors direct the Department of Public Works to work with the Altadena Town Council and community stakeholders to identify and implement additional traffic safety improvements along Woodbury Road between Fair Oaks Avenue and Los Robles Avenue. Madam Chair, that is my motion.
Thank you, Supervisor Barger. Are there any other supervisors that would like to make any remarks on this item? If so, unmute your mic. Seeing none, it would be appropriate to close the public hearing and vote on this item. Item 7 is before us as amended, moved by Supervisor Barger and seconded by Supervisor Hahn to approve the item. Madam Executive Officer, please call the roll.
Item 7, as amended, is before you. Supervisor Mitchell.
Aye.
Supervisor Mitchell, aye. Supervisor Kuehl. Aye. Supervisor Hill, aye. Supervisor Hahn.
Aye.
Supervisor Hahn, aye. Supervisor Barger.
Aye.
Supervisor Barger, aye. Supervisor Solis.
Aye.
Supervisor Solis, aye. Motion carries 5-0.
This item is approved. Sorry. We don't have the tabulation. Okay. So we don't have the final tabs on item number 1, so we'll keep that as a tabled item. Now we'll return to item number. We don't have those. We don't have that item either. Number 2. Okay. So then we will go on to our set item S1, our public health order, and we will move to hear discussion on the closures and pandemic trends. We have Dr. Ferrer and Dr. Galley in the queue, so we'll begin by hearing from our respective directors, and then we can open it up to hear comments from the board. Dr. Barbara Ferrer.
Thanks, Supervisors. I wanted to try to do a couple of things today. Provide an update, obviously, on the metrics for LA County. I wanted to talk a little bit about the health officer order that was issued yesterday and the one that will be issued on Friday. I want to provide an update on vaccinations, and then in that update, provide a little bit more information about what we have seen in terms of who's been getting vaccinated amongst our healthcare workers and where our expansive network of vaccination sites is at this moment in the county, and what our plans are as we move forward over the upcoming weeks. But I'll start with just an update on our metrics. As everybody knows, we're encouraged particularly by the significant reduction at this point in the number of daily cases. We've gone from an average of 15,000 new cases a day to this past week an average of 7,000 new cases a day, and today we're reporting on slightly under 6,000 new cases. The same trend line can be seen, obviously not as steep a decrease, but a decrease nonetheless that's significant in the number of people that are hospitalized. So we've gone from over 8,000 people hospitalized each day at the beginning of the month to now about 6,000 people on average hospitalized each day. And that's really good news for all of us. Our death rate, unfortunately, remains very high. Last week, we averaged about 213 people passed away each day. I believe because, as we've noted before, deaths is what we call a lagging indicator. First, our cases go up, then our hospitalizations go up a short while later, and then a short while after that, our deaths go up, that we're still going to see high numbers of deaths for a couple of weeks to come. But I am hoping that once we get into the month of February, our death rates will also come down significantly. We are, because the news is encouraging, not just here, but across the state has rescinded, as you all know, the Safer at Home order that they had issued, and we have therefore put into place the order that was in place on November 25th prior to having a stay-at-home order issued for the entire region. As folks have noted, with the order that is now currently in effect, it really aligns with many of the reopenings that are permitted for counties that are in the purple tier. When we left the regional stay-at-home order, we reverted, as did everybody else in the state, to following the safety modifications that are required of a county depending on the tier that you end up in. We, like most of the state as a county, are in the most restrictive tier, the purple tier, and because of that, we will continue to have limitations that are placed by the state on what can be opened here. And then when those sectors are open, they're often done with a lot of requirements for safety modifications. When we reverted to the November 25th health officer order, the following changes immediately went in effect from the stay-at-home order. All outdoor activities at family entertainment centers, museums, zoos, and aquariums, miniature golf, go-karts, batting cages are now allowed to reopen and operate at 50% occupancy. All of our card rooms are also able to reopen, again, outdoors only at 50% occupancy. Personal care, including nail salons and hair salons, can open indoors, but at a much reduced capacity, 25% capacity. And hotels and motels are now open again for in tourism and individual travel. I think the other change that went into effect is those private gatherings are once again allowed. They're limited to 3 households and a total of 15 people, and they have to be outdoors at all times. People are required to social distance, and they're required to keep their face coverings on unless they're eating or drinking. As has been noted, there are 2 restrictions that remain in effect until the end of this week. Outdoor dining is still not permitted, and we still have the restrictions in place that all non-essential businesses need to close between the hours of 10 p.m. and 5 a.m. We will be working to issue a new health officer order that will retain much of what we just talked about in terms of the sectors that are reopened and the safety modifications that they're required to make. But we will add by Friday the reopening of our restaurants, and this includes our breweries and our wineries for outdoor dining only. Again, there will be some additional safety modifications that will be in place for restaurants that are open for outdoor dining. We will be holding briefings with both the restaurant operators and managers, as well as with the union representatives of some of the workers at the restaurants tomorrow to review with them the proposed additional safety measures that should be in place when restaurants reopen for outdoor dining. We'll also lift on Friday the restrictions on hours of operation for non-essential workers. And that will be done, as I said, by Friday. I do want to say that while these current trends are encouraging, and we're pleased and we're grateful for all the work people have done to make sure that we get here, particularly because it's reducing some of the dangerous situations at our healthcare facilities, our hospitals in particular. We do need to move through the next few weeks with a lot of caution. All of us know that at many other points where we've been reopening our sectors, we in fact have seen a bump up in our cases. We can't really afford that. So I'm going to ask everybody to be extra diligent this time around, because our case numbers are still much higher than they've ever been before, except for the month of December and January. When we're back down to about 6,000 cases, as I reported for today, that's still twice as high as our case numbers were back in July during that earlier surge. So we have to stay committed to seeing a continued decline in our cases in order for us to feel comfortable that we're slowing the spread. We also are going to all need to worry about the variants, and will they in fact become dominant? And if they become dominant, will that make it easier for more people to become infected and lead to an additional surge later in the spring? We need to do everything possible to avoid that. The very same protections that we take for the virus that currently is dominant are the protections we're going to need to take if we have a more infectious, mutated variant that's more present here in LA County. So this would not be the time for people to think, because we're reopening, things are looking rosy here in LA County. We still have a lot of people in our hospitals. We still have a lot of people passing infections from themselves to others. Many of them are asymptomatic. And unfortunately, we'll see a lot more people die over the next few weeks. So we're going to have to ask everyone to really stay with this program. For those sectors that are reopening, compliance will be key. Our health inspectors will be out and about trying to make sure that everyone is doing their part to protect workers and customers. And we'll be swiftly moving to issue citations at those locations where the rules aren't being followed. We just don't have any leeway here to make a lot of mistakes. We have to really stay very focused on doing this right as we're doing the reopenings. I do want to note that although the pace of us being able to vaccinate folks here in LA County is going slowly because we have very limited supply, it is encouraging news that we do have 2 vaccines here, that they're highly effective, and that many people are showing up to get vaccinated. I'll take the next slide. You can see here, and I'm going to talk a little bit about the lag time here, that in the week of January 12th, we had received about 685,000 doses. We used those doses so that by the end of the week, 526,000 people had been vaccinated. That's about 77% of those doses being administered fairly quickly. Every week, we receive a new allocation from the state. We received an allocation on January 18th for another 168,575 doses. Those vaccines were used this past week this week that we're in to vaccinate people here in LA County, not just our healthcare workers now, but we're also vaccinating people 65 and older. You can see if you look at the weekly doses that are arriving, we average between 110,000 and 160,000 doses come every week. You can easily see how hard it is to be able to vaccinate at this point the 2 million plus people that are eligible to be vaccinated, all of our healthcare workers, everyone who lives in long-term care facilities, and all of the people who are 65 and older. So patience is going to be required because we just don't have enough doses. And as a reminder, this vaccine, in order for it to be effective at the 95% level, people need to get that second dose. So it's really important that people come for their second dose, but it's equally important that we make sure when it's time for people to get their second dose, that they're able to both get an appointment for that second dose and that we have allocated vaccine for that second dose. So the first thing we do with any allocation that we get for the following week is we work with everybody who's a vaccination site to identify how many people are going to need to have appointments to come back for their second doses. And then we make sure that everybody is guaranteed at those vaccination sites those second doses. What's left over after we distribute those second doses goes to new appointments for people who are getting their first dose. So just as an example, this past week, with 168,000 doses that we received, 89,000 of those doses, well, actually for this week that we're in, about 2/3 of the doses that we get on any given week, we actually end up using for people who need their second vaccine and their second dose of the vaccine. So we're really constrained with supply right now. This is an issue at the federal level. The new administration has promised to both be more transparent, but also to quickly beef up production so that we'll be able to get more supply here in the county. And I'll go on to the next slide, which really just shows the sort of vast network of places that people can go to get vaccinated, obviously with an appointment only, all throughout our county. There's actually, this week that we're in right now, there's actually 189 sites that are open, some with that are doing small numbers of vaccines every day, some which are large capacity vaccination sites, the 5 that are run by the county, 1 that's run by the city at Dodger Stadium. there's lots more vaccine doses, vaccinations that are happening at those sites. But this is a network that's made up of hospitals, healthcare clinics, federally qualified health centers, pharmacies, and appointments are listed on our Vaccinate LA website. You can link to making appointments at all of these sites, with the exception, I think all of these sites you can link and make your appointments through that website. We are working with every site to make sure that people are being scheduled for their second doses. It's obviously easiest for people to go back to the place where they received their first dose to get their second dose. At all of the county sites, that's the 5 large capacity sites and the 2 smaller community sites that we have, people are given their second appointment when they receive their first vaccine, and then they're sent a reminder notice confirming that appointment. But we're working with all the other sites to make sure that there are systems in place. We also do set aside at all of our large capacity sites and our community sites appointments for people who need second doses and weren't able to get back to the place where they got their first dose. So that is another opportunity for folks who may feel like they couldn't get an appointment back at one of the smaller sites where they received their first dose to again try us to see if in those set aside sites for second doses you're able to get in. I do want to note that we have a new platform for patient registrations. It's called My Turn. It seems to be working better. We're piloting this along with San Diego. It will be the new state system. And we're anxious for us to be able to implement it across all of our sites. Right now, it's just being implemented at the county-run sites. But next week, we should start transitioning to some of the other sites where people are getting vaccinated so that everybody could be on the same patient registration system. And it's an easier system for folks to manage. We also do have the call center. It is overwhelmed all of the time with large numbers of people calling in, thousands and thousands of people. We continue to try to add capacity there, but we're hoping with an easier to use online system that many people won't be as frustrated with the online system and need to use the call center. I do want to note, however, that the appointments are limited in number because we don't get a lot of vaccine here, and people are going to need some patience. You can sign up on the website in order to be able to get notified, both when appointments open back up and also we'll notify you when your group becomes a group that's eligible to get vaccinated. I want to flip to the next slide and just give a little bit of information on what we know about the healthcare workers who have been vaccinated. So again, these are from folks who were vaccinated through the end of December and the beginning of January. They were all healthcare workers. And you can see, if you look, the darker shaded areas on the map are where there were higher numbers of people in those communities that were vaccinated. And the lighter colors show where there were smaller numbers of people in our community that were vaccinated. I do want to note that you'll see some gaps here. Again, these are just healthcare workers. Many of them were vaccinated at the site where they work, but this is where they live. We're particularly concerned about South Central LA, and next week we'll be opening up 6 more vaccination sites in South Central LA. I want to thank the Department of Health Services. They will be opening up vaccinations, again, for eligible people, either healthcare workers or people 65 and older, at the outpatient center at MLK. The MLK Community Hospital will also begin vaccinating residents 65 and older. We have 3 Rite Aid pharmacies in South Central that will be opening up for vaccinations next week. And St. John's, which is one of our wonderful federally qualified health centers, is opening up a site as well, a new site as well in South Central LA. So it's really helpful when we do this mapping. There may be many issues that contribute to the lower vaccination rates that we're seeing in some communities, but the one issue that we don't want to have accounting for lower vaccination rates is that there wasn't good access to places for people to get vaccinated. So we're going to be tracking this very, very carefully and trying to fill in the gaps as we see them as quickly as we can, relying heavily on our many partners in the healthcare community. Again, getting vaccinated, it is a medical treatment that people get. It needs to be done with all the wise knowledge that our medical providers have. And we're going to rely heavily on them to help us be able to quickly fill in gaps so that there's plenty of opportunity for people to get vaccinated. And we'll continue to work hard to make sure that the supply issues get addressed as quickly again as they can, in partnership obviously with the state and the federal government, to make sure that we in fact are able to increase our capacity to vaccinate. We have over 350 registered sites that can be vaccination sites for people to go and get vaccinated. We just don't have enough vaccine to distribute to all of those sites right now. So supply is our biggest problem at the moment. I do want to also flip to just closing with a couple of highlights on the next slide about our partnership with schools. This is particularly important because one of the prioritized groups that will be opening up soon is making sure that we're able to vaccinate folks who work in both childcare settings and our schools. So we've been working since early December with multiple school districts. I want to really thank the LA County Office of Education. They have been our strong partner on all of this work. We've been meeting regularly with superintendents, and there's about 20 school districts that have been working intentionally with our staff because they're interested in setting up school-based points of dispensing. We provide a lot of technical assistance. One of the models that works the best is districts are partnering with hospitals, clinics, and other healthcare providers to help them do their planning and then be prepared for administering vaccines to all of their staff and their teachers. There are some schools, I want to really thank LAUSD for their partnership with us. I believe they have identified 11 sites that until eligibility opens for teachers and staff at their schools, they're willing to set up these sites so that they'd be able to vaccinate people 65 and older, and they're using their resources and their staff to help make that possible. So I want to acknowledge and thank LAUSD. They do have a very well thought out plan for opening up an additional, I think, 48 sites to make sure that they're able to, when we have enough vaccine and when teachers and staff are eligible to get vaccinated, that they'll be ready to go and help with vaccinating folks at their sites. They also are forward thinking and acknowledge that it will be very easy to transition at these sites, depending on the priority groups, to other members in the community who could come to these sites that are located in many places in our communities to get their vaccinations when those groups are eligible to get vaccinated. So, in closing, I really just want to acknowledge and thank so many of the partners that are making this possible. The county family, obviously working so hard with us, the Office of Emergency Management, LA County Fire Department, and the Inspectional Services Department. Also, we have a great partnership with the City of LA, and I want to thank the mayor and all of his staff that are working to set up sites throughout LA City. And then we have partnerships with many other cities across the county and with many school districts, hospitals, federally qualified health centers. None of this is possible. Having a vaccination program that's this extensive without all these partnerships, and I'm extraordinarily grateful for all the people who are stepping up. I also want to thank all the people who are volunteering to help out at the large capacity sites. We have thousands of folks who have signed up to help us at these sites. Particularly grateful for the clinicians that are helping us with the vaccinations. Obviously, at these larger sites, we run thousands of people a day at each site getting vaccinated, and so grateful for all of that support that's been really just pouring out in terms of people's ability to be part of this effort and their willingness to be helpful. So I want to thank you. I know we will improve the system by which people can sign up to get vaccinated, particularly the call center issues as we move forward, but extraordinarily grateful for the partnerships here in the county and obviously with our partners at the state as well. With that, I'll close. I'm happy to take any questions.
Thank you. Let's, before we take questions, let's hear from Dr. Christina Galley, Director of Health Services.
Yeah, hi, good morning, supervisors. I'll keep my comments very brief today and then happy to take questions, anything you may have. So in terms of the daily number of hospital admissions countywide, they are down significantly, having dropped over a third from their peak at where they were in mid-January. And new daily hospital admissions among patients with COVID will fall faster than the total hospitalization that you see every day being reported through the Department of Public Health. So those total hospitalizations is only declined by about 20% versus, again, over a third, nearly 40% for the new daily admissions. And that's because there's always some individuals who will have a long length of stay. There's a lagging presence in the hospital among a large number of individuals who will take a very long time in the hospital with a long length of stay before they hopefully recover or sadly pass away. And as Dr. Ferrer mentioned, mortality is even more of a lagging indicator than hospitalizations are. And we are continuing to model in our hospital bed demand model that the high death rates that we're experiencing from patients passing away from COVID across the county will continue for at least another week or two before it will finally peak and then decline. As for the 4 DHS hospitals, we're seeing a decline in our COVID numbers just as every other hospital is, and we're down to 400 patients even this morning, and that's down from our peak, which was at about 565 or 570. We continue to rely on a very large number of staff that are redeployed from outpatient clinics, including also staff brought in from contract agencies and registry sent by the state, also federal staff, including the DoD staff, as well as staff that we're able to obtain from local registries. On a countywide basis, the EMS agency keeps working very closely with the Department of Public Health and the California Department of Public Health to troubleshoot any issues that the hospitals are having. And the state did open up a week or two ago 2 surge hospitals in the LA area, the Pacifica Hospital of the Valley in Sun Valley, which has 155 beds, and Pacific Gardens Medical Center in Hawaiian Gardens, which has just over 100 beds. The admission criteria to those hospitals is coordinated through IMS, but it's based on strict prioritization among all hospitals in the county so that those hospitals that are the most severely impacted, they don't have available beds, they're having trouble offloading ambulances or other factors, get prioritization for transferring patients to those beds. And it's fully funded by the state. On a countywide basis, there are no hospitals across the county that are currently on internal disaster, and still no hospitals to date have had to declare crisis standards of care. We're also seeing an improvement in the EMS system. I know I had spoken at previous board meetings and in other venues about the high number of hospitals that were on diversion for ambulances, and those numbers have dropped significantly. So before, it was that virtually all hospitals at some point in the day were on diversion in early January, mid-January, and now fewer than half are on any given day and closer to a third. And similarly, the total amount of time that hospitals are spending on diversion has also dropped precipitously. So at the peak of the surge, we were looking at about 3/4 of all of the time throughout the day hospitals were on diversion, causing a lot of challenges for the EMS system. And that number is now down pretty consistently under 20% over the past week. Just very briefly on testing, and then I'll close. DHS has worked to expand testing access at our community testing sites since January. We've added 8,000 tests per day, in addition to some mobile and pop-up sites. We're trying to balance walk-up access as well as drive-up access across these sites. There is capacity at all testing sites, and there are slots that are available, and the demand for testing has declined again since the peak in the surge. DHS also has extended and continues to offer the home test collection option for people, and we really would encourage people to use this option if it might work for them. And it's also now available for individuals who are notified as being a contact of someone that tested positive through the digital contact tracing option. So if someone tested positive at a county or city testing site, they get their notification of their positive result if they were positive, and then they're given an option of entering any contacts or people they came into close contact with or that they might have exposed. Those contacts then get a message with information on testing and safety and resources, but they can also then request in that same process to have a test kit mailed to their home. So they can stay in quarantine, they don't need to leave their home, they can have the test kit mailed to their home and then either return it through a FedEx shipment drop site or have someone return it for them. Currently, we're seeing about 2,500 home test collection kits being requested every day. And I would really ask that the public use this option, but also if you use it, please do use the test immediately, collect the specimen and then send it back right away. It's not intended to be stored at home. Over the next 1 to 2 weeks, we will keep ramping up additional capacity to be able to maintain good access to people for COVID testing. We will add another 4,000 tests per day over the next week or two, and then ramp up to another 16,000 tests over the next 4 weeks to be able to meet whatever demand there might be and be able to maintain access to that resource. And with that, I'll close, but happy to take questions.
Thank you both, Dr. Ferrer and Dr. Galley. I want to open it up. I'm going to start first, and so far I have Supervisor Barger. If other members can just send me a note on my phone, I'll recognize you. But I want to begin, first of all, by thanking everybody that's been involved in the vaccine rollout. And in particular, I want to thank you, Dr. Ferrer and your department, the Public Health Office, and also the Office of Emergency Management, and to our fire department, our internal services, ISD, and obviously indebted to the Department of Health Services and all of our nurses and our clinicians and our volunteers and our doctors, everyone. You've been incredible. 24/7 is so much appreciated by all our staff. Indeed, you are making history, and this is, I believe, a defining moment for Los Angeles County. And I want to take this opportunity to explain the need for the executive order, which we voted to ratify earlier, to expand eligibility of the COVID vaccine to people ages 65 and older. It's pretty clear that older adults have been disproportionately impacted by COVID-19. And to me, it's about equity. After both the CDC and California Department of Public Health recommended that people 65 and older should be vaccinated against COVID sooner, it became pretty clear that Los Angeles County had to follow suit. As we heard from members of the public, the single biggest risk factor for increased morbidity and mortality due to COVID-19 infection is advanced age. Our data has shown this from the very beginning. And to date, more than 10,500 residents, 65 and older, have died out of over 15,300 total to this date. By protecting our elderly population, we hope to see a significant decrease in hospitalization rates and deaths due to the COVID infection. When a resource such as scarce as this vaccine is made available, we know that it is very important to be able to provide it to those that are at serious risk and illness. And those, in fact, are people who are over 65 years and older. And although we don't have enough doses, that may be an understatement for everyone, every adult in LA County at this time. My hope is that with the new federal administration, this will happen a lot sooner than we thought. And we're making our first big attempt toward vaccinating everyone in the general population. And this is something that we should be celebrating. On Friday, 101 health service patients 65 years of age and older received their first dose of vaccine at LAC USC Medical Center. I happened to be there and to witness such moments that were really, for me, moving in so many ways. I met several residents who live not just in my district, but from the 2nd and 3rd and other parts that came out to travel to LACUSC from as far as Bell, Southgate, West Covina, Belinda, and other parts of the county. And many had hitched a ride with family members, traveling some on 3 or 4 buses just to get immunized. I met an 82-year-old woman in line pushing her son who uses a wheelchair, who is disabled, and I was just so in awe of her resilience. I was also grateful to meet many people, 67 years and older, and one gentleman that I met was a cook, 67 years of age, worked in a local small business, and shared that he took 3 buses from Southgate just to get his vaccine, and then had to take 3 buses back to go to work in Downey at a restaurant. And I asked him, why did you come? And he said, because it's a matter of my life and also providing for my family. So I kept hearing repeated stories of this nature, and I was very moved. And I just want to tell everyone how important it is that we get that vaccine into the arms as many people as we can. And obviously, I think that the support of the board is demonstrating that. I do have a couple of questions for Dr. Ferrer, if she might, and this is regarding the COVID-19 vaccine, because again, I am also very concerned with the equitable distribution. And I know you passed out a chart to us indicating some demographic challenges that we have with respect to certain populations. One being that's very stark is the African American Black community, and also obviously the number of people that fit into other categories. We see American Indian, Alaskan Native American, those numbers are very low. For the Latino Hispanic population, it's about 27.6%. And with the white population, it's about 28%. And I know that there's large numbers of other populations that are getting the vaccine at higher rates than others. And I would just ask, what are we going to do to make sure that we really address the multiple testing sites and vaccine sites that are needed, especially in those hard to serve areas that don't have pharmacies as readily available, and perhaps we may be able to use more of our schools, as was mentioned earlier. That is very important, because that to me indicates that there is a desert. Just like we have a food desert in many of our communities, we have a pharmacy desert in terms of the name brand pharmacies that populate certain parts of the county and escape from not being in hard-hit areas like the first district and unincorporated areas like East LA. So I'd like to hear what you have to say about that, Dr. Ferrer, and also just for those seniors that are homebound. I've gotten many calls of seniors that live in facilities and say operated housing facilities that the county runs, and aren't able, because of their limitation in terms of transportation, to get to a testing site. How are we going to begin to engage and make sure that those individuals definitely are addressed? So those are my 2 questions for you, Dr. Ferrer, Dr. Galley.
Yeah, thank you so much, Supervisor. Can you hear me?
Yes, I can.
Okay, perfect. Yeah, those are such important questions, and thanks so much for making sure that we're focused on the equity issues. I do want to note that you're absolutely right. We need to really look hard at what makes the most sense in some of the communities that are hardest hit, which we also know are some of the communities that historically have the least amount of healthcare services embedded in their communities, and making sure that those are good places where we use our schools or other community partners to step up and help us make sure that there's capacity in those communities for us to be able to vaccinate residents, particularly at this point where we're really trying to reach people who are older. We are also looking at working intentionally with the independent pharmacists. So, you're right, many of those large chains did not go into communities that are again, with much less resources available. But there are also a lot of independent pharmacists who have really asked us if we can help them. figure out a way for them to also play their part. They're anxious to be partners, so we'll look at them. And I want to thank all of our federally qualified health centers because also there, some of them have needed support and will need support in order to be able to open community vaccination sites. But I want to acknowledge that's our number one priority right now is to look at these maps. The numbers that we're giving right now are really just reflect the healthcare workers that we're getting vaccinated, and they don't reflect the older people, the people who are 65 and older who just started getting vaccinated this past week. But we're going to be tracking this on a weekly basis, and we'll be sharing that information with you. Homebound seniors is a group we're really concerned about. We've done a really good job with residents and staff at our skilled nursing facilities where over 70% of those folks have been vaccinated. The federal pharmacy partnership is starting to be more active in the other long-term care facilities. But you're absolutely right, Supervisor. There are many seniors that are living independently but may be in housing developments and may in fact have limited mobility. We have talked about using the same team of folks that we've had going out to the skilled nursing facilities. They're kind of a mobile team and being able to use them to get to some of the developments, the housing developments where they're either senior housing developments or housing developments where there are large numbers of seniors that are living that may in fact not have an easy time getting around. So that we can go and do a clinic there. These really are like pop-up clinics at a specific site. In many ways, they're closed points of dispensing. We just would do it for the residents there that are 65 and older. But we're working on that model and bringing in some partners to help us. I hope to have more on that next week that I can share with everybody about the number of teams that we're going to have and our ability to get out and what we think that time frame will look like. Again, we need to get more doses of vaccine as well to help with this. But I agree with you. We've been looking at a partnership with the rideshare businesses as well so that they could offer free transportation, again, to seniors who will have a hard time, just like you said, taking 3 buses. We'd really love to avoid that, both by having more sites that are specific in neighborhoods, but also by having the ability for people to have free transportation, low-cost transportation to get to the vaccination site so that they can get their vaccines as well. We're anxious to work with board offices about other ideas that you may have as well that our team could be looking at and trying to make sure we allocate the resources for that. So thank you for those suggestions.
Anything you want to add, Dr. Galley, on this? No?
Sorry, I was on mute still. No, I think the question is great, and we all want to focus on equity. DHS has clinics that are located in several vulnerable regions, and we're doing a lot of work to reach out to our patients. We have 450,000 patients that are impaneled to primary care across our network. And according to the prioritization that's put forward by the public health authorities, we are really excited to work to get that vaccine out as quickly as possible to those patients who often live in very vulnerable areas and are at risk of serious outcomes of the disease. So very happy to partner on this moving forward.
Very good. Thank you so much. So this will be the order of board members that will be recognized: Catherine Barger, Sheila Kuehl, Janice Hahn, and Holly Mitchell. Catherine?
Thank you, and thank you, Dr. Ferrer, and I also want to thank Kevin McGowan for your work to constantly improve the vaccine rollout process in LA County. I went up to Magic Mountain and got to witness firsthand how this was all being put into play, and I was very impressed, and I think what impressed me the most is that each day with County Fire and ISD, they're looking at how they can better streamline and make sure that people are getting in and out of there in a timely fashion and getting the vaccine. I know I have a friend who said they were having a hard time getting appointments online, and I'm an early riser, so I was actually up at 3 this morning online, and I still am a little frustrated with the site, and I know you talked about that, Dr. Ferrer, but I think that is something that I'm continuing to hear in my office, and it says that you can make an appointment at these sites, and then when you pop onto it, it says no more appointments, and then it says, but you can only go to the 27th, but then when you tap on the 27th, you get nothing. And so I think that we have to refine that, and the opportunity may be, I know the governor announced yesterday that the state is now going to look at doing vaccinations by age group versus occupation. So can you tell us a little bit about that and what that's going to look like in LA County?
Thanks so much, Supervisor. We haven't gotten a lot of the details on it, but this is what we have been told. Seniors people 65 and older are in what's called Phase 1B Tier 1. In Tier 1 are also 3 categories of essential workers. The first is people who are working in education and childcare. The second is people who are working in food and agriculture. And the third is people who are working in public safety. And what the governor has indicated to us is that we will move forward with vaccinating as we are now, people who are 65 and older, and then including teachers and staff at our educational facilities and our childcare facilities. And then, and also opening up for food and agricultural workers and our public safety workers. When we have done a significant number of folks that are eligible in those priority groups, instead of, I don't know if you remember when the state first laid out all the tiers, there was Tier 1, there was 1B, Phase 1B, Tier 2, then there was Phase 1C, and all of that was tiered, and then you got to Phase 2. And what the governor has indicated is once we are done with Phase 1B, Tier 1, those groups that I just mentioned, we will then move to prioritizing people to get vaccinated by their age groups. But we haven't really heard what those age groups are going to be yet. And we also haven't heard from the state how long they anticipate it might take us to be able to do significant numbers of people who are in, Phase 1B, Tier 1. I can tell you, we have 1.4 million people who are age 65 and older, and we probably have close to another 1.5 million people. It may be, we can pull up the numbers of folks who are in those are essential workers in those 3 categories that would be eligible for getting vaccinated. It's going to be well over 2.5 million people here in LA County. So we're going to need to work with the state and with the federal government to get a lot of vaccine supply in. But I think after that, they are going to dispense with the tiering and move to prioritization by age groups, which will be so much simpler, as many people have noted, to administer.
Got it. I mean, I think that, one of the things, and I know I've talked to Supervisor Hahn about this, clarity is probably the most important thing for us to get out to people as it relates to how this is all rolling out. And I think that's one thing that we need to work on collectively in the county is clarity in terms of how people access, who is eligible, and really a realistic timeline in terms of how we're going to roll this out. And I know that, and I want to thank publicly Ana Garcia at Magic Mountain, who's on your staff, Dr. Ferrer, who is phenomenal. And when I was talking to her, she said that when people come in for their first shot, they're given a date, I guess it's Pfizer, so I think it's 3 weeks later, 21 days. Mm-hmm. 21 days later, they're told to come back 21 days later at the exact same time for their second dose. But when I talked to Steve Lopez, went to Downey and had incredible things to say about the people volunteering there and the whole process in general. But the one thing they didn't do is tell them when a second shot was going to be. And so I'm wondering, do we have a uniform process as to when people come back for their second dose?
Yes, and I'm actually surprised. I'm hoping that he went on the first day and not any later days. Everyone is instructed to actually not only tell people when their next appointment is, but you get a vaccination card at all of our sites, and to write it on the vaccination card, they write the name of the dose you got. So if you got Pfizer, which is at all of our big sites, they write down it's Pfizer, They give you the date, and they give you the location of your next appointment. And then we send we register them ourselves so that they don't have to go back into the system. And then they're sent a confirmation notice. So I will go check. I know at the site, I worked at the Laco site on Saturday, and everybody there was receiving their notifications. I was in the observation group, so we would check that everyone had their appointments, and they all had been given appointments. But I'm going to check and make sure, because there are instructions. There's a standard set of instructions that need to be followed at every site. But as you noted, while we have about 200 DPH staff at every site every day, there are people coming in and out for shifts, and we rely a lot on our volunteers. So the messaging, as you're absolutely right about that, it just has to be uniform, and everyone has to feel secure when they leave the site, that they know when they're getting their second dose and where they're getting their second dose.
Perfect. And then one thing I learned at Magic Mountain, and I just want you to comment on it, because I think there's some communication, not even miscommunication. There's rumors out there that the extra doses are going to waste and being disposed of, but actually at Magic Mountain, that's not the case. And so can you explain the process at vaccination sites as it relates to extra doses that are being used and don't go to waste?
Yeah, I mean, there should be very few extra doses. In other words, the syringes are getting drawn after people have cleared registration, so that we're actually drawing the right number of we're drawing into syringes the doses that we're going to need based on the number of people that actually are showing up. There is, at the end of the day, because, these are coming out of vials, and you have to, once you open a vial, you have to use the whole vial. So there is the opportunity for there to be, a dozen or maybe 2 dozen doses that need to be used that day. But I want to say a couple of things about that. One is that folks who are working at vaccination sites at the end, they can't get vaccinated early, but if at the end there's enough vaccine doses that are left, those folks that are working a vaccination site would be eligible to get vaccinated. And at all the sites I've been at, there's never been a problem at the end of the day for us to have sort of these leftover doses. People are being super careful about filling the syringes so that we don't end up with 50 syringes that have been filled when we don't have 50 people there already that are going to be vaccinated. And that's the best way to control this. All those folks, I don't know if you had a chance to go in the space where everybody's drawing those, opening up the vials and putting them into the syringes. They're working super hard to make sure that we're not ending up with these extra doses. But we don't throw away a single dose at the end of the day.
That's what I want people to know. I want people to know that there is a process, and I saw it at the Magic, and I'm sure. I know Supervisor Hahn was in Downey, and I know, my colleagues have been to the different sites. Holly was at the forum and seen how it's working. So I just want to make sure there's misinformation out there, and we recognize how important and valuable this vaccine is, and we want to make sure that everyone has an opportunity that does not go to waste.
Yeah, I totally agree with you. And one advantage we have with the appointment system is we slightly overschedule at the sites because we know some people may not show up, and we also know that sometimes we have people, unfortunately, who scheduled an appointment but they're not eligible, and they won't be vaccinated even if they have an appointment. So we actually fill more slots to account for that every day, but we don't fill those syringes until we have people that are there on site ready to get vaccinated.
Great. So let me just say, I just want to thank you for the quick response and update on the State Safer at Home update that you gave us. And I want to emphasize that harm reduction is still is and should be first and foremost on everyone's mind. So as restaurants are allowed to reopen, or nail salons, if you are in a high-risk category, you've not been vaccinated, you need to continue to take all precautions, especially knowing that the numbers are still somewhat high, and that we're not out of the woods. And I think that's an important message for people. We cannot let our guard down, and the vaccination is only one component to controlling the coronavirus in our communities. And to get the numbers down, harm reduction is going to be what is going to get us through this, and that includes wearing a mask, social distancing, limiting your contact with large crowds. And so I just really hope that we continue to emphasize that until we get the vaccine and get herd immunity, we're not going to be out of the woods, and this is going to be something that should be first and foremost on everybody's mind as it relates to controlling the virus out in the community. So I just want to thank you for that, and look forward to working with you as it relates to any other issues that may come up from the state. So thank you.
Yeah, thank you so much for your support, Supervisor.
Thank you, Catherine. I also want to mention that I did visit Fairplex myself last week and was just in awe of the thousands of people that were in line in their cars waiting, and from various age groups. It was quite remarkable to see how all of that came together and how well organized it was. So thanks to the staff on all that. Next, we'll recognize Supervisor Kuehl.
Thank you, Madam Chair, very much. I want to underscore a couple of things that you and Supervisor Barger indicated, amplify them a bit. But also one new thing, I think that this may be for FESIA as well. The dashboard that you started the presentation with that showed the number of doses that became available to us and were put out, as well as other things. I think it might be good to have the ability to find that right on the county's main page.
Oh, sure.
Because that is, that's where people go often first, and it is kind of like the biggest game in town, I have to say. I don't know that a lot of people are looking for other kinds of things. So that would be great.
Oh, absolutely. Happy to
thank
do that.
you. The second thing is what was said about housing developments, and your answer really made me feel very hopeful. And I understand this is a rollout, not a this will happen tomorrow kind of thing. But there are a number of areas that we've all heard about where our seniors, especially those older than 75, do have trouble getting out and around. And even, they don't have the money for Uber. They don't all have people to drive them around. It would be great if there was the kind of thing that we developed for the mobile testing, as you've indicated, to visit some of these places. There are also sort of nursing homes. I heard from one in my district through an advocate, not from them. The Sisters of St. Joseph of Carondelet have a retirement and nursing home, and they're not, in the list of the official nursing homes, and we're wondering how they might be able to get a visit. So I was very happy to hear it, and also think that in terms of the motion concerning a plan for Phase 1B, since 1B includes people over 65, which has been sort of elevated to the top of the phase, maybe that plan can also reflect how we might be looking at getting this out to the seniors that are not able to get to us. The third thing is, I should have texted Catherine at 3 this morning, because I was up doing the same thing, trying to see, because so many people are asking, is it just me, or am I doing this wrong? I can't seem to get any answer about appointments for January or February. So I wonder if you might tell people like me up at 3 in the morning looking for appointments, if you would, Dr. Ferrer, sort of realistically, what it might look like. I understand you can't say exactly, I'll know tomorrow, but as you see it, because people are worried now that there are no appointments and they don't know if there will ever be appointments, you know how people are. I wonder if you might indicate what you see in the future a little bit.
Yeah, it's such a good question. And, here again, I'm going to apologize because we have so much unevenness in how many doses we get a week, what our allocation looks like for the county. Nobody is willing to really schedule out past a week. So, that's the tragedy of sort of the system that was set up under the previous administration was there's A, no transparency, and B, you're not told like, okay, for the month of January, you should anticipate getting 150,000 doses a week. Then you could book appointments for the full months, knowing that you had the doses there and figuring out how many of those needed to be second doses. But with what we're getting now, there's so much variability that we only book appointments 1 week in advance. And we really usually open them up like a Saturday or Sunday for the next week, and then we stop. Sometimes like this week, we're not sure we had enough to go through the whole week. So we're probably looking at what's been used around the county and then trying to open up for Saturday and Sunday, hopefully by tomorrow, because we weren't able to put those appointments up yet. But it's so dependent on how many doses we have and then trying to reallocate doses that aren't getting used. But I hear you. We will go ahead and actually craft a new message. I'll send it by to all the board offices, trying again to explain to people why this appointment system is problematic in terms of sort of people being able to plan ahead and try to be reassured that they will get an appointment. We're going to do our very best, obviously. Also I want to just sort of segue into the second issue. We do have to get to people who are older and absolutely cannot get out to a testing site. Obviously one of our strategies is to make it easy for them to go to their own provider at some point and get vaccinated there, since many of them will visit their healthcare providers at some point, or to go to their own local pharmacy. But we are going to go ahead with these mobile teams. We just haven't been able to start them yet because they're still doing the second doses at the skilled nursing facilities. And I will make sure that the plan is updated for 1B to reflect those new strategies that are coming on board now. And then we're happy. We'll go ahead and make sure that Lenny has the vaccination dashboard. It gets updated once a week, so we'll make sure she gets those updates right away. I think that's a great suggestion to make sure it's on the county's website as well.
Would it be fair to say that we do expect that we will continue to get more vaccine?
Yes.
Because, you know what, I think you've done a great job. This was not a complaint about not being able to get an appointment, but really a sort of trying to work together to let people know that they will likely be able to get vaccinated. It's just that there's, if they see the doses that arrive each week, and perhaps we can also indicate priority for second shots.
Yes.
That, it's a slower rollout than people would like. But if they keep checking, I don't know, something. But the good news is here's how we've gotten allocations every week so far. Yep. We expect that we will continue to get allocations. The federal government assures us we will, or the state, or whatever.
Mm-hmm. Yep.
Just so people can say, okay, I get it. I wish I had it right now, but I get it.
I totally agree with you. And again, I think these next 2 weeks are going to be a little bit rocky because, the new administration just started and obviously they're trying to figure things out. But I do think February will be much more predictable and we'll actually be able to plan, more than 1 week at a time. I think that would be really helpful for folks as well. I know some of the pharmacies have really tried to make their supplies last for 2 weeks so that they can, in fact, let people know, you've got an appointment. But the state is really not encouraging that. The state would really like people to use all of their allocations the week that we get it. So it's a little bit of a tension here. But I do think you're absolutely right that I think it will only get better for multiple reasons. I mean, first of all, there's another vaccine that's pretty close to finishing up their phase 3 trials and will probably go to the FDA early in February. Hopefully there'll be another emergency use authorization. That's the Johnson & Johnson vaccine. That's a 1-dose vaccine that will be a lot easier. It's also less expensive to produce that vaccine, so I think there can be more production of it. Once we start getting a third vaccine here, that automatically will increase supply.
Well, I'm very, very grateful for your work and all the people who have really stepped up in the county, in the city of LA, our own staff in the county that are volunteering. Everyone has really gone, beyond actually what was expected in a pretty horrible time. So thank you for your work. Thank you, Madam Chair. Those are all my questions.
Thank you.
Thank you very much, Supervisor Kuehl. We'll recognize now Supervisor Janice Hahn.
Thank you, Madam Chair. I was going to ask some questions on the vaccines, and then I was going to ask a couple questions afterwards to Christina and Barbara about the health order. But I'll stick with vaccines since that's what we're on. I think, first of all, Dr. Ferrer, you know that I actually did get my first dose in Downey on Saturday and was really impressed with that organization. It was so clearly marked, cones, volunteers. You were out there wearing your fashionable poncho. At times on Saturday, it was pouring rain, as you told me, and yet every one of these volunteers remained with their ponchos on, directing traffic, making it really a easy experience. It took me about an hour from the time I drove in till I drove out. And again, thanks to LA County Fire, to our DPH staff. You told me your staff was working 10-hour shifts. I don't know if a lot of people realize that your staff is actually out there at these sites working it, but the planning and work that went into these mega sites was really impressive. In fact, I'm sure I share most of my colleagues' experiences. Most of our calls and complaints have not been about people who actually got the appointment and got their first shot. Most of the frustration, I think is people who are still trying to get appointments. When I was there on Saturday, we had started the new protocol where I was handed a card in my card saying my second appointment had already been scheduled. Such a brilliant move on our part to move towards that. My question is, for everybody that showed up before we started implementing that, how are we making sure that they're getting their second dose? I've heard of people who are really anxious. They got their first dose. Now they're spending hours trying to get that second dose and have not gotten it scheduled yet. So wondering, how's the second dose being handled?
Yeah, thanks so much, Supervisor. So for everybody who went to one of the county 5 large capacity vaccination sites, the day that we missed was that very first day we opened. I think that was a Tuesday. All of those folks will get scheduled for their second dose 21 days from the day they showed up, and we will be notifying them all that they have their appointments. They do not need to try to register to get that second appointment.
And so when will they when will they get that notification? Because there's the urban legend that people will get notified 5 days before the appointment, and that's just not easing anxiety out there. When do they get that email because the first time you make your appointment, your email dings like within seconds, and you know that you were confirmed for your appointment.
Yeah, I want to just verify with my staff the process. They have to enter in all those names from the first day and into our new system, our Your Turn system, to make those appointments. But I'm hoping by the end of this week, everybody who came, this would be last Tuesday, will have their notice for their second appointment.
So how much control do we have over the other sites, the Ralph's, the El Camino, because that's also where I'm hearing people are they're just beyond anxious. They're so afraid that, we'll have wasted that first dose. They haven't gotten their second dose, and they're approaching, that 3 weeks, and they're really worried about this. How much control do we have over those folks in helping the second dose to happen?
Yeah, I want to say that nobody who got a first dose should feel insecure that they're not going to get their second dose. I want to qualify that a little bit by saying, if you've had Pfizer, it's 21 days. It could be a few days later. That's not a big deal at all. As a matter of fact, CDC has said it could be 2 weeks later for your second dose, and there would be no problem with that. So I just want to let people be reassured. It doesn't have to, some people think it has to be exactly on day 21.
Right, I know. I heard that too. In fact, it's like a booster shot, and they're even saying. But I think the issue here is just being notified. Like, I think even if you notify them and said, it's not going to be 3 weeks, it's going to be 4 weeks, I think that gives them the peace of mind. They're just really worried because they cannot make that second appointment.
Yeah, we are working with all of those other, 100 plus sites to let them know that they need to schedule the second appointments. And the easiest way to do that is to schedule them when people are actually vaccinated. It's hard to do it before people actually get vaccinated. But once they're at your site, you should take responsibility for making sure they have their appointment for their second dose before they leave. That's the easiest way to do that.
Yes, I agree. They're not doing that, but that's the brilliant way to do it.
Right. And so we're working on pushing that out to all the sites now. And, I want to say it's a very strong recommendation at this point that you need to take responsibility for making the appointments for the second doses. We are trying to see also if there's any way for people who receive their first dose to easily go into the system. They'd be in a separate, sort of a separate area of the appointment booking and go ahead and get that scheduled as well with our new system. But that hasn't happened yet. So in the meantime, we are telling all the sites, you really need to book the second site for the second vaccination appointment for people. Because just like you said, it's creating so much anxiety. And you can imagine, hardly anybody feels like they can get into the site and get their appointment at this point. So that also is causing so much volume at the call center because people don't go through they can't find an appointment on the website, so then they're on the call center to explain their problem. Hey, I need a second dose.
Right. Yeah, and you're right, once the system has all their information, that's just a logistical thing of just and giving them their little card.
Exactly.
Yeah, I agree. That's brilliant.
So that's what we're working on. And I will keep the board posted this week as we make progress on resolving the issues around the second doses. I really want everybody to know that we guarantee all the sites their second doses. So no site should ever say, I can't give you the second dose because I didn't get the second dose.
Right.
Because we actually take off the top of the weekly allocations and we survey everybody. How many doses do you need? We're not shorting anybody on the second doses, and we know how anxious this is making people feel.
Right. So you mentioned the call centers in your report of being just overwhelmed. Just wondering, are you confident that we're getting more people to answer the phones? The other complaint I think we've gotten in our office is, I guess there's a push one to get a call back as opposed to waiting on the line, and they're not getting called back.
Yeah, I have to look into that because this isn't the first time I'm hearing that we created that option, but then we're not calling people back. We are trying to do two things. One is call people, hire more people to work.
Mm-hmm.
We have a contract with 211. We've asked them to increase their numbers. We also have staff here that are taking what's called excess calls, so that trying to get through the calls. But, sometimes the volume is like over 1,000 calls an hour. As people get more anxious, they're going to go to that call center. We're also trying to put more options on the phone so that people don't stay on hold if what they're trying to do is just get information as opposed to schedule an appointment. We're also trying to instruct folks to please, if they're trying to schedule an appointment and they have a website and they have computer access, to go to the website It's not faster if you go, it's not like we hold appointments for people at the call centers. They're using the same website to make the appointments. So we just try to say, like, some people think there's an advantage if you talk to a human being. I'm one of those people who would
I'm one of those people too.
I'm going to call the call center. I don't know if people saw, I guess Jimmy Kimmel was trying to make an appointment for his father to get vaccinated here, and the whole riff on the call center. So
and to be honest with you, it's hard to believe, but there really is, if we want to talk about inequities, there are a lot of people that to this day do not have computers and just aren't or are not at all savvy in terms of navigating a website. I was wondering if we could look at the possibility, and this is technology, if this is ISD or whatever, but not a wait list for extra doses, but a wait list, like once you sign up, then we'll notify you when you have when there's an appointment available, as opposed to people who are just asked to check back, or all said like, we have more doses, check back. It reminds me of the Cabbage Patch Dolls craze, in the 80s, where, this store has more dolls, rush over there. That's what this feels like, right? All of a sudden we have more doses, more appointments, and then people start crashing. That just seems a little crazy, wondering if there was a way to, once you call in, you've left your whatever on the website, then you're just notified when there's an appointment available, as opposed to just check back in 5 hours.
I love that suggestion, and let me take it to the team. I think
just see if that's logistically, technologically available. I think it is for other appointments that we all make, and I think that would probably help this. So can you tell me what we're doing and what we could do more of as a board or as a county to advocate for more vaccines from the federal government?
I think it's always helpful when the board communicates, even with a new administration, of sort of the uniqueness of LA County. We're one of the counties that was hit the hardest. We're also one of the counties that really, I think, has special populations that really we need to make sure we're figuring out ways to be of service. We have a lot of people here who are without their papers. And again, maybe frightened to go to like the larger sites. So we have to have resources that are embedded in their communities. I think, pointing out the uniqueness of, sort of the local setting, so that solutions aren't, it's not one size fits all.
Right. But I think a lot of our troubles, you would admit, are because we don't have enough vaccines. Right. I mean, and some of the things, I'd like you to touch on, I know you're going to say, is we don't have enough vaccines. We heard from the mayor of Long Beach, and we've heard from LAUSD, they would like an allotment of our vaccines so that, and Long Beach has done such an excellent job. They're already to their teachers. They went through all their groups. They're very efficient. They were getting out 100% of the vaccines they got. Signal Hill, which is one of my cities, said, can we just have Long Beach vaccinate us? Catalina's like, we'll take Long Beach. And I know you're going to say we don't have enough, but do you see long-term, Barbara, allocating some of our doses to a little more to Long Beach? Maybe they can do the dock workers, or to LAUSD and for their vaccination sites. How do you see that working long-term? And is that just dependent on us getting more vaccines? Like right now, we're kind of holding all of ours close, and we don't really want to create more partners out there, because that would mean letting go of some of our doses? Or how do you see that?
Yeah, one of the things we've been encouraging everybody is, if you got the capacity to vaccinate, you should be signing up right now, registering and getting approved by the state, so that we can, when we have more vaccine, distribute it. So we're not a gatekeeper on this. If you get signed up and registered and we have vaccine, particularly if you're working in our hardest hit communities, we're going to go ahead and try to do everything we can to facilitate getting those doses out. And obviously, we're always happy to partner both with, Long Beach and with Pasadena. Obviously, we started this with, probably close to 700,000 healthcare workers that were just in that first group, way more than any other place. A lot of our healthcare workers don't live in LA County, but they need to get vaccinated in LA County. So I think, our road forward is more complicated just by the sheer numbers of people that are here that need to get vaccinated in every single group. No matter how you cut this, we have the most people 65 and older, and it does make it harder. But we are so anxious to work with folks who want to partner with us. We think that that's the best model. We particularly are anxious to partner with any of the healthcare providers that are willing at this point to open up their doors and be vaccination sites, because they know how to vaccinate and they can actually sign up the easiest because they're licensed to vaccinate.
Right.
So can't really vaccinate.
Yeah, right.
A healthcare provider.
Right. So just on the schools, and I had another item, 37C, but I don't know if you have any more to say under that than you sort of already have talked about with your chart on vaccination partnership with schools. But I'm just thinking that elementary school campuses would be good sites, because to me that sort of checks off the
Janice, can I break in here? I'm sorry, but we will be taking up 37C, and that is something that you will hear. Okay, we want to move along. We still have to hear from.
Right, I was going to release 37C if Barbara said she didn't really have more information to give me under 37C.
I mean, I always vote on it, though. Yeah, I'm always happy to give more details. I can actually give a fuller report if you want.
Okay. Well, then we'll take up 37C. Okay, my last. Then Christina, could I ask you? Are you comfortable with the governor lifting the stay-at-home order and us moving forward here in LA County, reopening some of our sectors? Are you still comfortable? Our cases are down, our hospitalizations down. We do seem like we're going in the right direction. Are you feeling like we'll be okay as we carefully and strategically reopen certain parts of our economy?
Yes, Supervisor, I do. And I think the key word, as you mentioned it, is carefully and strategically. All of the things you mentioned are true. The case numbers are down and the hospitalizations are down. As I mentioned, that's going to take a little bit of time for all of those census numbers to decline definitively, but they are absolutely heading in the right direction. And the new admissions, which is the number that we really watch to see what's happening with new patients going into the hospital, that's the number that's fallen by over a third. And that's very reassuring. So I do think that it's appropriate at this point to start loosening the restrictions, as has been discussed. But people need to be careful and still be responsible with their behavior, still wear a mask, still try to limit their interactions with others, wash their hands, and just realize that we could enter another surge again if people loosen up too much on all of those public health practices that are really the core element of keeping everyone safe.
Thank you, Dr. Gall. I appreciate that. And I know, Dr. Farrar, we're going to put extra safety protocols on the restaurants, and I'm anxious to see what those are going to look like. But I think you're right. We're moving into a harm reduction strategy for LA County. We know it's been very difficult for the public to, stay under these stay-at-home orders, and I hope people don't go crazy this weekend by doing everything possible, nails, hair, eating out. But I think we should do it carefully. We should keep reminding people that it is still a scary time to be in the public because of this virus. Thank you, Madam Chair.
Thank you so much, Supervisor Hahn. Now we will hear from Supervisor Holly Mitchell.
Thank you very much, Madam Chair. I appreciate that. Appreciate the presentation. I think the fact that we made the decision to follow the state about prioritizing 65 and older residents, who we know mostly died from COVID, as well as healthcare workers, that was an important thing for us to do because it was the right thing to do. But those decisions don't address what is really necessary to deliver a really equitable and ethical vaccine program. When we look at communities that are being disproportionately hit by the virus. Latinx residents are 3 times more so than their white counterparts to die of COVID. And the mortality rate in areas that have the highest concentration of poverty in LA County are almost 4 times that of the wealthier areas and double the overall county rate. So the same factors that keep these most vulnerable residents from accessing the necessary resources they need to survive COVID are also keeping them from accessing the vaccines. You know, if our ultimate goal is to reduce infections, hospitalizations, and mortality rates, we've got to figure out how to target those who are truly at most risk. You know, I know the state developed the tiering system, but I'm wondering if the state is going to then adjust their tiering system as they make adjustments to their own protocols, i.e. the decision to allow restaurants to reopen outside service. You know, will the state then elevate restaurant workers on the vaccine list to make sure that if we're going to reopen restaurants, that the workers in those restaurants are protected from this virus? Couple questions. I was very relieved, Dr. Ferrer, to hear that from your perspective, February will be a little more predictable, where you'll be able to plan out beyond a week. I think that's great news. I'm relieved to hear about the expansion of additional vaccine sites into South LA, given the data you've collected, the demographics you've shared in terms of, while we're seeing reductions in hospitalizations, that's not an equitable reduction really across the entire county. So I'm thankful to hear that you're going to expand access to vaccines in areas that have traditionally been underserved. I'm also relieved to learn, as you shared, about the new online system. You know, I thought it was quite ironic for the state to strongly encourage us to go to 65 and older, and in the same day their system crashed. Our system was further overburdened. Our phone systems were further overburdened. While we rely on technology, sometimes technology itself can be overwhelmed. So I'm really relieved to hear that there'll be a new streamlined system that will hopefully help. I am clear that the takeaway of the day, as we fight urban legends and fight people having misinformation, I am clear that the one takeaway that everyone should be clear about is the answer to all of our ills is more vaccine, more from the state, and perhaps even a more equitable allocation, more from the federal government, and perhaps a more equitable allocation even from the state. Since we have, as you stated, 350 registered sites, we want to make sure that all of our partners are getting their fair share. And so my question is, given the reality of how you receive vaccine, the 1 week allotment at the time, which I'm clear is all less than ideal, how are you prioritizing which sites get vaccine? I think there's an impression out there in the general public that once the mega sites came online this past Tuesday, that perhaps that pulls vaccine from FQHCs or the pharmacies. I'm also glad to hear that you've told the pharmacies not to truly spin down their allotment and do what everyone else is doing. Use your allocation on a week-by-week basis and don't hold back. But how are you prioritizing what groups of, what categories, if you will, of vaccine sites are getting vaccine?
Yeah. Thank you so much, Supervisor Mitchell. It's an excellent question. You know, our priority at the moment is to make sure that in the hardest hit communities, there's excellent access to vaccine. And remember, in some of those communities, those are also the densest communities. So they also have many more people living in those communities. And they may have as well fewer partners that can actually stand up vaccination clinics. But one commitment we've made is to the federally qualified health centers. We like to think about them as our partners. They're generally located in communities that have less resources than other communities. And for the most part, they too provide services to some of the residents that have been the hardest hit by COVID-19. We're also working closely with the Department of Health Services, and I want to really thank Dr. Galley and her team, because she too has a patient population that really often lives in various communities that don't have a lot of services, but also tend to be vulnerable as well. She has a large number of people who are here who don't have their documentation as part of her patient population, and will also find it more difficult to get vaccinated. So we've really relied on the partners that we think are trusted in the communities that have been the hardest hit to be able to get the allocations that they're requesting. And I know that folks have said, well, but now you've got these large sites, and they're not all necessarily in the communities where our folks, they're not necessarily located in places our folks are going to get to. I want to say I think a lot of folks are getting to those sites, and certainly it's a diverse group of folks that are going to the sites. But I also want to say we cut back the number of appointments at our large sites because we didn't get as much allocation for this week that we're in, so that we could in fact open up more federally qualified health centers, and so that they could get more allocations. And those are the kinds of adjustments that we're all going to need to make, is to make sure that in those communities that need to have easy access to vaccines, we're not making it harder because it's a time of scarcity. But I want to acknowledge it still is a time of scarcity, and it's still hard to divide a pie that's way too small. So while we remain deeply committed, it's not like we have adequate doses for the communities that have been hardest hit as well.
I appreciate that. I heard also, this was perhaps for Dr. Galley, that Black DHS staff didn't request vaccines at the same rates or at comparable rates to their counterparts. And that's concerning, given, generally speaking, the communities in which those county employees also live, the communities that we were talking about being disproportionately impacted. And so what's our plan? How can we better give information? Do we have a sense of why they opted not to be vaccinated? We knew that there would be certain populations, our immigrant brothers and sisters, communities of color who have a checkered history and past generally with the healthcare delivery system. What's our plan in terms of working to change that paradigm, particularly since these are the same communities that are disproportionately impacted by the by the virus itself?
Hi, Supervisor. Thanks for raising that. And you're correct. We have unfortunately seen that the acceptance rate among DHS staff is much lower among staff that identify as Black or African American than it is among staff of any other racial or ethnic group. And it's significantly lower. This is something that we are working to address, and I'm happy to share data in the future about the degree to which we're able to close that gap. I know that it's also something that many other hospitals and communities and providers are also seeing. I don't believe that this trend is unique to DHS. And I think there's a lot of reasons behind it. What we've heard from staff as we work to talk to them and understand their reasons for not wanting to be vaccinated, there's just a lot of concerns about the nature of this being a new vaccine, about it having only EUA approval and not full FDA approval, about safety and efficacy questions related to the vaccine, and just a lot of concerns. And I think that concern is understandable, and we want to be able to answer people's questions and work with them through it. We are working, we have staffed up our employee health services units with a broad and diverse set of clinical staff who can do more conversations and outreach to staff who have not yet agreed to receive a vaccination. We're working on putting forward some more trusted messengers and messaging campaigns with the Department of Health Services, and I know the Department of Public Health is working on this as well, to be able to get messages to a diverse set of communities about whatever it is that they might have concerns about the vaccine. And again, mainly it really is questions about safety and efficacy. People may wonder whether this is a live virus vaccine. It is not. It cannot cause infection. It cannot cause COVID. People have questions about whether or not some of their pre-existing medical conditions might interact with the virus. It does not. The CDC has recommended that anybody, regardless of their underlying medical conditions, can receive the vaccine. The only contraindication to the vaccine is people with a very focused, specific set of allergies to one of the components of the vaccine. But there's no medical condition, underlying medical condition, that would prevent someone from getting the vaccine. So a lot of it is also just getting accurate information out there. We do know, sadly, as one of the consequences of really racism in our society is that there are more medical conditions and underlying health conditions that are found in certain patient populations, and that underlies some of the differences in morbidity and mortality among different racial and ethnic groups. But the degree to which then people believe that because of those underlying medical conditions they can't or should not get a vaccine, then that just really accentuates those same disparities that we are seeking to alleviate. So we are working hard to address this. Happy to partner with the Department of Public Health and certainly keep you updated.
I would just add that one of the strategies that we've been really, like from the beginning, trying to use during this pandemic is understanding that there are a lot of trusted leaders in different communities that people have more confidence in than they might in, us as a health department or even a provider, and that we really need to constantly stay in touch with those trusted leaders in the different communities so that they have good information and they feel like they're comfortable promoting a message about the vaccine safety. But we've also been very respectful about the fact that this is a new vaccine. People are right to ask a lot of questions. People are right to want a lot of information, and people are right to want to make their own decisions. And that our job is to really make sure that people feel comfortable, that they can get that good information, that they can talk to people who are trusted by them to help them sort through what their concerns are. Because I think at the end of the day, we have a long history in this country and in other countries that make it difficult for people to trust some of the medical advances that we're promoting. And I think Dr. Galley is absolutely right. It is a vaccine that was authorized with emergency use authorization. The study time was short. We do feel very confident that the data at hand says it's very safe and very effective, or else we wouldn't be out there asking people to get vaccinated and getting vaccinated ourselves. But I think we have to listen to people, understand their concerns, try to address them respectfully. And one thing I've really been promoting is, it's okay for people to wait a little bit if they don't feel like ready at the moment that's being offered. If they feel like they want to see how their friends do or other people. And then it's our job to be ready to vaccinate when they're ready to get vaccinated as well. It's going to take us months to get everyone vaccinated. And I know some people have told me, I just want to wait a little while. I just want to see how it's going. I want to see, what happens. And I've said to folks like, that's okay. Just know that when you're ready, we're ready to vaccinate you. We're anxious for people to feel comfortable about this. And I think we need to do a good job listening to what the concerns are so we can do a better job addressing the concerns.
Thank you for those thoughtful responses. I just have, one more question, Madam Chair, and then one final statement. And given how important, because you are collecting data in terms of DHS employees, that sheds light, and we know what groups are stepping up, which aren't. So I think it's also going to be important that we keep data and to allow us to then conduct targeted outreach to those communities who aren't accessing the vaccine. So are we keeping demographic and geographic data of those residents who are currently getting vaccinated?
Yes, I shared with your team. We gave them some demographic data on healthcare workers that had been vaccinated, not just the healthcare workers at DHS, but healthcare workers I think it was, the sample size may have been, I think it was about 400,000 healthcare workers. So we do get some demographic information from the patient registration system. It does take us a while to clean it, but I did share with all of the board offices the data, which really mirrors a bit what Dr. Galley was saying is, again, hard to know the denominator here because we don't know the proportion of healthcare workers that fall into each of our racial and ethnic groups. But African Americans, Black healthcare workers had much lower rates of vaccination than we saw, that we would think are proportional to their numbers in the general population.
But now that we've expanded to 65 and older, are we collecting similar data on that population as well?
Yes, we collected. It's all with the patient registration system. So yes.
Excellent. Thank you for that. And then I would just say that again, I said it in my opening that I hope that through you that the message can be communicated to the state administration, the State Department of Public Health, that as they have, quite frankly, signaled a change, they've pivoted a bit with the issuance of the governor's new order this week. I'm curious as to whether that will impact the tiering and phasing system that they developed. If they are now saying that it's okay statewide to reopen, if you will, between restaurants and personal care services, how are the workers in those environments going to now be protected? And if indeed their tiering system will reflect this pivot in terms of what aspects of our society will reopen. And finally, I just want to join with all of my other colleagues to commend the two of you, your departments. I'm new to the county family, but I've been very proud to join a workforce of committed people. I have been to the Forum mega site in my district now twice. The first day we launched on Tuesday, I was there Saturday morning in that downpour, saw those 200 plus county workers, many volunteers there for their orientation, seen them dispersed, have received any number of email and text messages from constituents who are so complimentary about the efficiency of that site, 40 minutes or less, how it's managed. So I want to tip my hat again. And really just, I think, encourage that we have the opportunity to set the example of how we all need to rise and be our better selves. I think Supervisor Hahn said, don't everybody rush out and just get all your services in the first weekend. It's much like the run on toilet paper at the top of this pandemic. That if everyone acknowledges that there are certain populations who, based on their vulnerability, must get vaccinated first, and everybody else stands down and waits, if everyone, doesn't rush to, that we exercise patience, that if you have the computer system, you use that, acknowledging that there are far more LA County residents than one might assume who don't have access to the internet or devices that allow them to use the internet to schedule appointments, and they're relying on a call center. I think if we all just rise to our better and become our best selves, we'll get through this quicker and in a more humane way. And again, Dr. Galley and Dr. Ferrer, my takeaway today, as it has been the last several weeks from you two, is more vaccine. I'm clear that we have the infrastructure in our 350 plus sites and more that will be coming online with schools and other municipalities that want to set up vaccine sites. We will have the capacity to administer the vaccines. We just need more vaccines. And so I echo that and support you in our shared quest to get more on behalf of the county. Thank you, Madam Chair.
Thank you.
Very well said. Thank you. Members, this is a receive and file, so if there are no objections, then that will be the order. And thank you, both Dr. Ferrer and Dr. Galley and all the stakeholders and everyone that has been helping us get to this point. It's really incredible. Thank you so much. Members, very quickly, I want to go back to the two tabled items that we put off because we were waiting for voting results. So if we could now return back to item number 1, this was for our hearing on annexation and leveling of assessments for county lighting districts in the city of Carson. Madam Executive Officer, please report on the ballot tabulation results.
Thank you, Madam Chair. Madam Chair, members of the board, after tabulating the ballots, a determination has been made that no majority protest exists against the proposed annexation and levy of assessments for single lots L042-2018 and L-L092-2018 proposed for annexation to County Lighting Maintenance District 1697 and County Lighting District Landscaping and Lighting Act 1 Carson Zone. As a result, it would be appropriate for the board to adopt the resolution ordering the annexation and levying of assessments and the joint resolution accepting the negotiated exchange of property tax revenues resulting from the annexation of the single lot territories.
So with that, members, item 1 is before us. This item is moved by Supervisor Mitchell, seconded by Supervisor Kuehl to approve the item. Madam Executive Officer, please call the roll.
Item 1 is before you. Supervisor Mitchell?
Aye.
Supervisor Mitchell, aye. Supervisor Kuehl?
Aye.
Supervisor Kuehl, aye. Supervisor Hahn?
Aye.
Supervisor Hahn, aye. Supervisor Barker?
Aye.
Supervisor Barker, aye. Supervisor Solis?
Aye.
Supervisor Solis, aye. Motion carries 5-0.
Thank you. Now we'll return to item number 2. This was a hearing on annexation, leveling of assessments for the county lighting districts in the unincorporated areas of Azusa, Valinda, and East Rancho Dominguez. Madam Executive Officer, please report on the ballot tabulation results.
Madam Chair, members of the board, after tabulating the ballots, the determination has been made that no majority protest exists against the proposed annexation and levy of assessment for petition numbers 46-616, 47-616, 28-617, and 35-416 in the unincorporated areas of Azusa, Valinda, and East Rancho Dominguez proposed for annexation to County Lighting Maintenance District 1687 and County Lighting District Landscaping and Lighting Act 1 unincorporated zone. As a result, it would be appropriate for the board to adopt the resolution ordering the annexation and levy of assessments and the joint resolution accepting the negotiated exchange of property tax revenues resulting from the annexation of petition territories.
Item 2 is before us. I will move, seconded by Supervisor Mitchell, to approve the item. Madam Executive Officer, please call the roll.
Item 2 is before you. Supervisor Mitchell?
Aye.
Supervisor Mitchell, aye. Supervisor Kuehl?
Aye.
Supervisor Kuehl, aye. Supervisor Hahn?
Aye.
Supervisor Hahn, aye. Supervisor Barker?
Aye.
Supervisor Barker, aye. Supervisor Solis?
Aye.
Supervisor Solis, aye. Motion carries 5-0.
Thank you. This item is adopted. Now, members, we'll turn back to item number 37C. And this was a request for the Director of Public Health to provide an update today on the plan to partner with school districts to use schools as vaccination sites. We will first vote to hear this report. Item 37C is before us to approve the item to hear the report, moved by Supervisor Hahn, seconded by Solis. To approve this item with no objection, that will be the order. This item was held by Supervisor Hahn. Supervisor Hahn, please unmute your mic and please begin to speak.
Thank you, Madam Chair. So back in November, I wrote a motion that asked the Department of Public Health to explore partnering with school districts to use schools as vaccination sites. We know that many times it's your local school that is a trustworthy space within our local communities. Families feel safe, kids feel safe. There is a level of trust and accountability with our schools. And now that we've begun this vaccination process in LA County, I know LA Unified has stepped up and said they're ready to go and want to partner with us to use their school campuses as vaccination sites. They've said they have 600 nurses and the infrastructure to administer the vaccines, and their schools are centrally located in many neighborhoods, which I think checks that box of equity as well as accessibility, especially for people who may not have transportation to some of our larger sites. Almost everybody can walk to their local elementary school campus. Since they've made that request, I know my office, I don't know about my colleagues, we've gotten a lot of letters of support from community members, local businesses, and nonprofits who like that idea. Dr. Farr, you did say last week that you've been working with schools to start planning for this type of partnership, and you brought that up today in your PowerPoint to us. So I'd like to have an update on where you are long-term in maybe creating campuses as additional vaccination sites. I know what you're going to say is we don't have enough doses right now to take on extra sites, but we do know, and we certainly hope that with the Biden administration, we're going to be, manufacturing more vaccines. We are going to get more doses. Today, as Austin Butner said, the amount of doses is the problem. Tomorrow, that might not be our problem. It might be more about how quickly we can get this into our communities. So I think we should have a plan, and we should have already built these partnerships now, even before we have enough vaccines to do that. So I'd love to hear, and again, I know you've been working on this, just for the public's perspective, can you give us an update on where we are in long-term actually creating vaccination sites on our school campuses? Thank you.
Yeah, thank you so much, Supervisor Hahn, and for your support with this motion that we really need to partner effectively with our schools. As I noted earlier, our team that's headed by Dr. Rubin, Dr. Yagnane, and Dr. Gilchek, they've been meeting since you passed the earlier motion in November. Since early in December, they've been partnering with the LA County Office of Education and Dr. Eduardo, engaging superintendents from all of the public schools and the school districts. And we actually surveyed everybody back in December regarding their interest and their capacity for hosting school district, what we call based points of dispensing. We call them these pods. There were 20 or so school districts that responded that said that they had the capacity to distribute vaccines. They were given additional support from us and a logistics team that's able to work with them to go over. There's a 5 to 6 member logistics team that's actually working with those schools that want to be able to set up the pods. So I think just like you said, I mean, we're not going to wait to do all of this planning until we get the vaccine. The time to get everybody ready is now, get people signed up. A lot of the school districts in that group of 20 are partnering with either a hospital, a clinic, or a federally qualified health center to create those vaccine opportunities. Many of them are very focused on making sure their staff can get vaccinated. But there are a few, including LAUSD, that are interested right now in being able to open up as well for folks in the priority groups, especially for people 65 and older. 2 weeks ago, there was another large meeting that LA County Office of Education hosted. We had 300 participants at that meeting. We talked through the details about how you establish these school-based pods. We talked about the timeline for vaccine dispensing, and we answered their questions. Many of them are really very anxious to use their sites to vaccinate all of their staff and their teachers, and we're encouraging that as well. We're also reached out to the head of the California Association of Independent Schools to discuss the vaccine strategy, and we're meeting with leaders from the parochial schools later this week as well. We're urging for many of the folks who have small private schools that they partner. We're encouraging a partnership with the school district in which they're located, since it's not going to be feasible for most of them to run their own pod to vaccinate teachers and staff. They're also welcome to use the community sites, but we're talking with them about trying to get a partnership with the school district that is going to, in fact, run their own pod for their teachers and their staff. I'll come back in a minute and talk about the work at LAUSD, but I also want to note that we're also working with Deborah Coleman, who's the director of the Office of Advancement of Early Childhood Care and Education. We've had several meetings with that group to talk about the rollout for vaccinating. There's nearly 100,000 staff that work in the various early education programs, early care education programs across the county. And we need to make sure that we're also able to have places for those staff and teachers to get vaccinated through these, through these conversations that we're having with school districts. Also asking if they're able to partner with some of the school districts. So for those school districts that are going to have capacity to vaccinate their staff, especially the larger districts, we are going to try to fold in some of the private schools and also some of the early care centers so that their staff would have an easy place to go and not have to travel to one of the larger community pods or to a different site. And I think that will go fairly well. Again, you were right. We need to get enough vaccine. Obviously, schools are going to want to vaccinate their teachers and their staff first before extending that out. We also want to note that we have a separate team that's been working with LAUSD. They have identified 11 sites that they want to really think about opening fairly quickly to help us vaccinate people 65 and older. And as you noted, Supervisor, they are willing partners to actually use some of their staff or many of their staff to be able to operate these points of dispensing at their schools. I think they've also identified an additional 31 sites that might be expansion sites as we get to being able to vaccinate teachers and staff. The 11 initial sites that they've identified are geographically dispersed, and as you noted, many of them are, again, in our hardest hit communities. So we welcome the partnership with LAUSD and anxious to be supportive. There are really, if you think about it, there are, 3 different ways we've been helping the school districts. We've really helped those that want to set up their own pods. There are those that are happy to have their sites used but need a healthcare provider to be their partner. So we've tried to connect them with hospitals, health clinics, or federally qualified health centers to be their partners. And then there are those that are small and don't really have access or the ability to set up their own pods. And we want to make sure that we have sites in their communities where they'll be able to go so that they'll be able to use some of the other community sites that are available. And we've been working to just get that information out and to provide a lot of technical assistance to those that are trying to move forward with setting up the pods. But I think the team has, made a lot of progress. And as you noted, we're so grateful for the willingness of the school districts to step up and offer their sites and, in many cases, their staff to support vaccination efforts. This will be really important when we're trying to vaccinate the hundreds of thousands of educators that are working across LA County. Happy to take any questions.
Thank you so much, Barbara, for that. I really appreciate that. I think we would all probably hope that, we'd have some kind of a target date when we got more vaccines that you could say, yeah, these 11 sites that LAUSD wants to open, we think we'll be able to open them, I don't know, March or something. I think people are still kind of wanting a little more, meat on the bones on a plan, just so they know, and so our offices can stop being lobbied, because we all think it's a good plan. I just think we need a little more surety. And it was my understanding that LAUSD didn't want to just vaccinate their teachers, right? They actually wanted to help us vaccinate their neighborhood. Yeah. So do you think that
11 sites? We hope that once they're they need to be operational, but we're excited to put them into the the weekly allocation formula because especially in
Okay.
communities. So they won't be waiting till March.
Okay. Good. I didn't hear that.
We're talking about a couple of weeks.
Oh, okay.
Sites that are ready to come up, and where people have the resources to do this, and they're in these hardest hit communities, we're going to encourage them to get up and running and be functional, be registered. They still have to finish their registration.
Yeah, because I think the mega sites are great and well organized, as I experienced. But I do like the idea of decentralizing this vaccine distribution and getting it more into people's neighborhoods. And one more thing, so you actually surveyed all these school districts through LACO. So we shouldn't worry about school districts contacting you. You feel like pretty much you've already talked to all of them and seen who's interested and who's not interested.
Yeah, and we also, we have a weekly call with the superintendents of all the districts on Thursday morning. And we have every other week, we have a telebriefing with various constituent groups that are working at the schools. So we have a lot of opportunity to hear from the schools as well. And those, the schools, because we created a school team for them, they also know who to contact here if they change their minds about what they want to do.
Okay. Thank you, Madam Chair.
Thank you. Before I recognize other members, I just want to add thank you for bringing this forward to our attention, Supervisor Hahn. I am wholeheartedly in support of allowing LA Unified School District to receive the authorization so they can be vaccine sites. And I agree totally that just about every low-income community I know in my district has a local school based there, and they're more readily accessible, they're trusted, they're places that people are very familiar with. So I can see us moving in that direction right away. And I've had some good conversations with our board members that represent us, Jackie Goldberg and also Superintendent Buechner. So I'm very pleased with the direction we're going and can't wait to see when we can get these up and moving and also expanding to other school districts. We have Pomona Unified School District in my district, as well as Baldwin Park and El Monte Union High School District. They're pretty large, and many of those communities have been heavily impacted by the COVID-19 and certainly want to make clear that we can address the equity issue through that lens. So thank you very much. With that, I'll recognize Supervisor Holly Mitchell.
Thank you very much, Madam Chair. Again, like you, I have heard from school board members, Ms. Goldberg and Dr. McKenna, as well as a number of nonprofit organizations in my district who aren't directly involved in education, but certainly get the value. Everyone from the Brotherhood Crusade to National Council of Negro Women, the West Athens Westmont Task Force, and of course St. John's Well Child and Family Center, who partnered with LAUSD on a number of sites, and I hope we'll continue that partnership in the vaccine rollout. So yes, everyone feels that schools are our neighborhood hubs and trusted community partners, and as we heard earlier, engaging trusted community partners is really important as we work collectively to combat kind of urban legend and fear, quite frankly, around these vaccines. Keeping that in mind, I've got two quick questions. For households with very young children, their local early care and education and child care centers are also trusted hubs for them. And some of these centers, I'm hoping can serve as vaccine sites as well. I'm thinking specifically, just given the space allocation that's needed to be a healthy space for vaccine distribution. I'm thinking about the child care centers on community college campuses, for example, that have ample parking and plenty of outdoor space for staff and volunteers, and vaccine recipients to remain socially distanced. Are those sites being considered through the community college boards themselves?
We haven't explored using those sites just for child care center workers, but I love the suggestion. We have looked at a lot of the community colleges as sites for community pods, but not, we hadn't really focused on them being appropriate sites for child care centers, but I will take that back. I'll also work with Kevin McGowan on that because he's been so helpful on really sort of identifying sites that are suitable locations. But I love that suggestion. You're absolutely right. We need a lot of space wherever we run a site. We're still in the middle of a pandemic, so all that social distancing and trying to be outside and not inside with folks becomes really important as we open up these smaller pods. But I
and I didn't mean to infer for child care workers. I just meant additional sites. Just as we're looking at schools as community hubs, these child care centers on community college campuses have the same kind of, communal feeling. They tend to be kind of on the perimeter of the community colleges. So, we're not asking people to navigate the complexity of a community college. They tend to have parking in very close proximity. So parents, student parents, and community college staff can get to the child care center. So just thinking about other community hubs that could be viable options. So I just want to put that on the table. The last quick question I have is, if we are successful in developing and maintaining these kind of partnerships, could they be more permanent partnerships and perhaps places in which, on an annual basis, flu vaccines and pneumonia vaccines could be administered, on a go-forward basis?
I think that's an excellent suggestion. We really love the partnerships that are being formed with community-based organizations, whether that's a school or another community-based organization in the area, and the healthcare providers. So much of sort of routine, important primary care happens best at a medical home. But again, given how hard it is sometimes for people to get appointments in a timely way or at a convenient location, I love this suggestion because people do go to schools a lot. People go to other community sites, and it makes it a lot easier for parents to both get themselves vaccinated and their children vaccinated in a place that you're already going to go on a regular basis. So I love that suggestion, and I think it's something we should be striving for. So thank you so much.
Thank you, Madam Chair. That's all for me.
Very good. I'll now recognize Supervisor Barger.
Thank you. I'll be very short. I just want to echo what my colleagues have said about, I talked with Austin and as well as Jackie Goldberg about using LA Unified, and I know in my district there are schools, elementary schools that are located in communities that would be more than happy not only to provide the facility, but also in LA Unified's situation, they've got LVNs, they've got nurses, they've got all the staff to actually ramp it up. And so I think that's an exciting opportunity for us to really capitalize on that. I guess my question, really short question, Dr. Ferrer, is at what level of vaccination would we need to have coming in order to get vaccinations into the community versus the pods that we're doing right now? Because my understanding is doing it central based on the amount of vaccine we've got coming in is a smarter way to do it. What would the threshold be where we would be able to kind of decentralize and move it out?
Yeah, thanks so much, Supervisor Barger. We do have a pretty decentralized system because we have 190 sites right now that get vaccine. And we'd like to obviously expand that to many more places, particularly because we have probably over 300 folks that are registered to be vaccination sites at the moment. And, a good 100 plus of them are not yet getting their allocations. And so we agree with you, we need to build a fairly large and flexible vaccination program for LA County. And I think the issue really is what would be the ideal number of allocations of vaccine that we should get every week if we want to be somewhat aggressive. What could we handle with this decentralized system, building in the schools that are willing to come on board, as well as we have a lot of other pharmacies willing to come on board. I think easily LA County could handle within a week or two, easily 500,000 doses a week, easily. The problem we have is that we start having to do a lot of second doses. So you need to get increasing numbers of doses in the weeks ahead so that you can do second doses, every 3 weeks again. So if you gave 500,000 doses out to people for their first appointments this week, 4 weeks, in the fourth week, if all you're getting is the same number of doses, they're all going to go for second doses. So you have to have the capacity not just to stay steady with the number of doses right now, but to actually see some increase over time. But we have a lot of capacity in the county. I think even just right now, we could easily go to 300, double the doses we're getting, easily go to 300,000 doses a week and get that, into people's arms within a week of receiving the vaccine here.
Is that in addition to keeping the pods open, or is that collapsing the pods and putting...
I'm figuring that we will keep some capacity at these large capacity vaccination sites. They do work for some people. Whenever you shut one down, you're absolutely right. Like, you can shut some of them down if, like, you look around and you say, oh, we don't really need this because in this neighborhood, so we're doing 4,000 doses a day, let's say at Magic Mountain. But now in Magic Mountain, like in very convenient locations, same area, we've got enough sites. We've got 10 sites that come up, and they're going to do those 4,000 doses a day. That would be, a moment to think, do we really need to still have a megapod, or can we just go to a distribution that uses smaller community sites?
Okay, thank you.
So much. Next, I'll recognize Supervisor Kuehl.
Thank you, Madam Chair. Very quickly, thank you very much for this consideration, and thank you, Supervisor Hahn. Like the rest of you, I've been hearing a lot from constituents and people all around the county about using the schools, and I think the idea is popular because they feel it's a kind of democratization of how we get it out, although I believe that it's still important to pay deep attention to the issues of equity. But for instance, in my district, over the entire county, the two highest communities in the last 2 weeks in terms of the average of numbers of cases compared to population were Pacoima and San Fernando in the East Valley for the whole county. Not to say that it makes it more important, but I know that they're familiar with their schools and would probably feel, well, I know where that is, I can go there, and that would also recommend it. So anything we can do, I think, across the systems to help would be very important. And again, I think everyone has a great idea, and they're all different ideas. So I thank you, Dr. Ferrer and Dr. Galley, for the work you're doing to try to organize these ideas into one system. And the work that you've done so far is really deeply appreciated. And I know we're all anxious to get to the next allocations. And again, so thank you. Thank you, Madam Chair.
Great. Thank you so much. If there are no other comments, this report is received and filed. Hearing no objection, that will be the order. Moving on, members, now to item number 11. Expansion and standardization of sexual orientation and gender identity data collection in Los Angeles County, which was held by Supervisor Kuehl. Supervisor Kuehl, please unmute your mic and please make your remarks.
Thank you very much, Madam Chair. We paid a lot of attention, appropriately so, to issues around the pandemic, and interestingly enough, this motion actually comes out of one earlier that related to the pandemic, but I'm very, very glad to bring the motion forward today, and grateful to my co-author, Supervisor Mitchell, because the ways in which we think about and practice data collection matters in a lot of different ways. We know there are health disparities, economic disparities. How do we know that? Because we ask relevant questions and we look at the data. Demographic information like race and ethnicity is crucial in helping us understand the experiences of our various communities and the needs of those communities. So the collection of data concerning sexual orientation and gender identity is a very important piece of the data picture that's actually historically been kind of absent from our view. So with this motion, we would like to build on the great work that has started in the county, led by our Chief Information Office, to make more visible these fundamental aspects of personal identity in order to develop more meaningful and complete representations of all of our residents. In September of last year, SB 932 went into effect, which mandated the collection of this data for COVID-19 patients because we wanted to understand if there were hotspots, if there were various transmission issues. And it was an important step. But it is equally important that this data be collected routinely, not only during a public health crisis. Instead of being done piecemeal, we're also interested in ensuring that this data is being systematically collected, as we know the significance, as I said, of obtaining that information. You know, it's been clear over the past couple of decades that the LGBTQ community has often been overlooked when it comes to data collection. People have said, well, I don't know how to ask these questions, or, you know, it's something that people have to admit to. Unlike race, as my friends will tell you, you don't have to announce yourself or come out. But the LGBTQ community needs to understand and be seen, because this data has real material impacts. You can't do something about what you can't see. So in an effort to move toward greater visibility, we want to acknowledge the importance of this information and support the standardization of its collection in our county. So I ask my colleagues to look affirmatively on this motion for equity and visibility. And thank you very much.
Thank you. Does Supervisor Mitchell want to be recognized as co-author?
Yes, thank you very much, Madam Chair. I'd just like to thank Supervisor Kuehl for bringing attention to this matter and allowing me to co-author. I would just say that gaps in data collection only further marginalize historically underrepresented segments of our community. And so data collection allows for transparency and allows for important checks and balances as we design public benefit programs to reflect the needs of every county resident. So as we talk about equity in LA County, it means equity in county institutions and equity in data collection. So this motion is a good first step towards investing in sexual orientation and gender identity data collection efforts. And I'm proud to co-author. Thank you.
Great. I just want to say that I wholeheartedly support this. I think it's very essential that we have appropriate data collection mechanisms in place to identify the distinctions between our ethnic and racial minorities that are impacted by so much of what we do. And this community is one that we know is always hard to count and collect data on. So I'm glad that we're doing it. It's about justice. So I applaud the author and the co-author. If there are no other members that want to be recognized, if there are none, then the motion is before us. This item is moved by Supervisor Kuehl, seconded by Supervisor Mitchell to approve the item. Madam Executive Officer, please call the roll.
Item 11 is before you. Supervisor Mitchell.
Aye.
Supervisor Mitchell, aye. Supervisor Kuehl.
Aye.
Supervisor Kuehl, aye. Supervisor Hahn.
Aye.
Supervisor Hahn, aye. Supervisor Barger.
Aye.
Supervisor Barger, aye. Supervisor Solis.
Aye.
Supervisor Solis, aye. Motion carries 5-0.
Great. Thank you, members. Moving on now to item number 24. This is on the Restorative Justice Village Master Plan, and I'm pleased to present this before the board. The motion actually builds on much of the work that we've done already around two major policy issues: alternatives to incarceration and gentrification and displacement. And we've, as you know, taken major steps towards reducing our jail population, and our voters, I believe, have made it very clear that they want to see more resources allocated and invested in our community. And as you may recall, last year the board voted to develop a plan to close the Men's Central Jail. The development of the plan, to me, signals significant progress among other county initiatives towards implementing the Care First Jail's last approach to criminal justice reform. But we know so much more has to be done. In a major step towards providing the critical housing units and services needed to support the work of the ATI initiative, the county has begun constructing the Bigness Housing Project less than a mile away from our offices. Once upon a time, the Bigness site was planned, as you know, as a supporting facility for the Mental Health Treatment Center. Now it will provide 232 units of people experiencing homelessness. The project, in my opinion, is an example of our commitment to allocating resources towards addressing housing insecurity, mental health, behavioral needs, for our most vulnerable residents. And the Big Miss project is taking place in our historic Chinatown community, which has been facing severe gentrification and displacement for many, many decades. Residents and businesses in the community have voiced their needs, and you heard them this morning as they called in. They're looking for affordable housing, workforce initiatives, economic development, cultural preservation, and access to healthy foods are among their top priorities. But this development of a restorative justice village master plan would allow us to continue to address the needs of the Chinatown community members while supporting our efforts toward Care First, Jails Last. So we will work with nearby property owners who share our vision, preserving Chinatown community and serving the most marginalized populations in the county to develop a comprehensive master plan. The California Endowment, Homeboys Industry, and others are ready to collaborate with the county and bring their resources and expertise. Both of these organizations are already working on their own separate efforts to expand their services and programs, including the City of LA, which owns property in the surrounding area. And we have been in discussions with Councilmember Gil Cedillo, who has previously engaged the county to jointly develop properties in Chinatown to help provide more affordable housing. The Restorative Justice Village Master Plan would also support our work at the LAC-USC campus, specifically the Restorative Village. The master plan would weave each of these efforts together into a comprehensive vision in the area. We would not be able to take on this partnership without the support of our a comprehensive participatory planning process. So we will engage Chinatown community members, social justice, criminal justice, reform advocates, working groups that are currently working on the county's Care First, Jail Last initiatives, and our county departments. I'm asking that a report will come back to us in 180 days, which allows time for the departments to incorporate results and recommendations to the alternatives to incarcerated related efforts of the LA County. The report back will form the basis for the scope of work and the task order to begin work on the master plan. I thank you, members, and I respectfully request your aye vote. Are there any questions from board members on this item? Nope. Seeing none, then I'd like to move this item, the Restorative Justice Village Master Plan item, and would ask that Supervisor Holly Mitchell second to approve the item. Madam Executive Officer, please call the roll.
Item 24 is before you. Supervisor Mitchell.
Aye.
Supervisor Mitchell, aye. Supervisor Kill.
Aye.
Supervisor Kill, aye. Supervisor Hahn.
Aye.
Supervisor Hahn, aye. Supervisor Barger.
Aye.
Supervisor Barger, aye. Supervisor Solis.
Aye.
Supervisor Solis, aye. Motion carries 5-0.
Thank you very much, members. Now we will go on to item number 26, a report on the Comprehensive Public Safety Reinvestment Plan. And before the presentation begins, members, I want to first thank the advocates and the voters who have long pushed for the accountability of law enforcement, specifically the Sheriff's Department, and alternatives to incarceration. It was through the voter-supported Measure R that the Civilian Oversight Commission was given subpoena power and supported by this board. Measure R, however, also called for the Civilian Oversight Commission to develop a comprehensive public safety reinvestment plan. The board has taken substantial action to reimagine public safety and justice from a Care First, Jail Last approach that has developed into many county initiatives like the Alternatives to Incarceration, Measure J, and the development of a plan to close Men's Central Jail, to create a robust system of care, but also to ensure that with investment in the community, people do not enter the legal system in the first place and are diverted and released out of jails or don't return to jail. I have asked Dr. Brian Williams, the Executive Director of the Sheriff's Civilian Oversight Commission, to provide a brief presentation with an update on the COC's plan. Brian, are you on? Okay.
I am here, and thank you, Madam Chair and members of the board. I'd like to briefly highlight just a few points from the memorandum we provided to you concerning the work of the COC on Measure R. As Supervisor Solis just indicated, in March of 2020, voters in LA County overwhelmingly passed Measure R, which granted subpoena power to the COC, but also required us to develop a comprehensive public safety reinvestment plan and a feasibility study. Now, both the plan and the study were to be completed within 7 months of the passage of the measure. We didn't hit that mark for any number of reasons, including the pandemic and a lack of internal resources, not excuses, but factors to indicate where we are. Despite this, I am pleased to point out that much of the work for Measure R is already in progress. As you indicated, Supervisor Solis, both on this motion and the previous motion, the board has been extremely proactive in moving toward Care First, Jail Last, evidenced by the creation of the ATI work groups and the ATI initiative, the Youth Justice Work Group, the MCJ Closure Work Group, voting to place Measure J on the ballot and the passage of Measure J, and work being done by ODR and the CEO's office, as well as many other county departments. Now, the people of LA County specifically directed the members of the commission to exercise our independent judgment with respect to the reform of the Sheriff's Department and reinvestment of public safety dollars in the county. And as such, the COC believes that we must play an important role in developing mechanisms to reduce the jail population and to support community-based community public safety initiatives. So with that, the commission plans to independently review and analyze each report produced by the current county bodies performing Measure R work. This includes ensuring that the work being done satisfies the requirements of Measure R, assisting in drafting and the plan and study that we're required to do, and assisting in making recommendations to the board. Now, the timeline for completion of these efforts is partly dependent upon the progress made by the various county departments engaged in these multiple efforts, as well as the adequate resources that we'll have to complete our Measure R report. So in conclusion, again, I want to point out that the board has invested substantial time and resources to reform the criminal justice system. Our efforts, and I really want to hit on this point, are not designed to compete with the efforts that are already made, but rather to enhance and better coordinate our collective efforts to build a better project. We will continue to closely coordinate with various county justice reinvestment initiatives and monitor and analyze their work. To assist us in this effort, the Commission will seek funding for a full-time consultant with significant criminal justice and data analysis experience. By doing so, we're going to explore grant funding and pro bono work from several large firms and seek funding as best as we can. And we believe that these additional resources will allow us to do the job that we are required to do under Measure R. Finally, we recognize the need for significant public comment and engagement in this process, and we intend to make sure that the public is engaged in what we're doing and have a general understanding of what the county efforts are in whole. So with that, I'd like to answer any questions you might have.
Thank you so much, Brian. I really appreciate the opportunity for you to present the report. The members have each received a copy of that report. And are there any members that would like to ask any questions? Seeing none, then I would move the item, and seconded by Supervisor Mitchell, to receive and file this report. Hearing no objections, that will be the order. Thank you. Thank you, Brian.
Thank you.
Very good. Moving on to item number 32 regarding the options for removing the sheriff. We'll now hear from Rodrigo Castro Silva, our county counsel.
Thank you, Supervisor, and good afternoon, everyone. This presentation is in response to your board's November 10, 2020 motion directed that I present on the various options that exist within the law to remove an elected official such as the sheriff and to address how the position of an elected sheriff could be changed to an appointed position. There are several options to remove an elected sheriff. First, the county's charter could be amended to allow for the removal of the sheriff. Second, the sheriff could be recalled. Third, the civil grand jury can present what's called an accusation against the sheriff for willful or corrupt misconduct in office. There would be a jury trial, and if convicted, the sheriff would be ordered removed from office. And fourth, the Attorney General or another party with the Attorney General's permission could file what's called a quo warranto action in court challenging the sheriff's right to continue to hold the office of sheriff. Let me discuss first the charter amendment option to remove the sheriff. The California Constitution allows a county charter to provide for the removal of an elected sheriff as well as other elected officers. And the Attorney General has given an opinion that a county charter may grant a Board of Supervisors the authority to remove a sheriff for cause by a 4/5 vote. San Bernardino County has such a charter provision, as well as an implementing ordinance that defines for cause. That ordinance and provision were upheld as valid by the California Court of Appeal. The court determined that San Bernardino County's ordinance was authorized by and consistent with the California Constitution and Government Code Section 25303. As such, amending the county's charter to allow for the removal of the sheriff or any other elected county officer for cause and by a 4/5 vote of your board is a viable option. A proposed county charter amendment would have to be voted on by the residents of the county, with a simple majority being sufficient to adopt such an amendment. To get a charter amendment on the ballot would require either the public proceeding by initiative or your board by motion and ordinance. The next option is a recall election. The California Elections Code establishes the specific procedures for placing on the ballot the recall of an elected official, including the sheriff. The procedures are that the proponents must first file with the registrar recorder and publish in a newspaper a notice of intention signed by at least 20 individuals identifying the officer to be recalled and a statement as to why that officer should be recalled. The officer then has an opportunity to answer the notice, and the proponents thereafter must file the recall petition and proof of publication with the registrar. The proponents would then have 160 days to gather a sufficient number of valid signatures to qualify the recall petition for the ballot. If the registrar verifies there are a sufficient number of signatures, the registrar must then certify the results. Within 14 days of certification, your board would then issue an order stating that a recall election be held. And then that election would have to be held between 88 and 125 days from that order. The next option, as I discussed earlier, is set forth in the government code and is for the civil grand jury to present an accusation in writing against the sheriff for willful or corrupt misconduct in office. The grand jury would have to deliver that accusation to the district attorney, who would serve a copy of the accusation on the sheriff. The sheriff would then have to appear before the court and answer the accusation. If the sheriff were to plead guilty or refuse to answer the accusation, the court would render judgment of conviction against him. If the sheriff denies the accusation, the court would then set the matter for a jury trial, which would be conducted in the same manner as the trial of an indictment. If the sheriff is ultimately convicted, the court would then state in the judgment that he would have to be removed from office. The code does not define what willful or corrupt misconduct in office is, but a crime committed in an officer's official capacity has been held to constitute willful or corrupt misconduct in office. Other conduct that doesn't rise to the level of a crime, but that could also qualify, includes willful malfeasance, misfeasance, or nonfeasance in office. However, mere negligence in the performance of official duties would not be enough, would not be sufficient. Under the quo warranto action, that can be used to force a public officer's removal from office after that officer has been convicted of certain qualifying crimes, including certain felonies such as bribery, as well as malfeasance in office and offenses involving a violation of official duties. Under this procedure, the Attorney General or a private party with the Attorney General's permission can file a legal action called quo warranto. And the procedures for filing such an action are governed by state statute and regulation. That after the filing of that quo warranto action, there would be a trial, and if the officer is found guilty of unlawfully holding office, the court would have to render a judgment excluding the officer from office. So those are the four ways in which the sheriff could be removed. Let me now discuss what would be needed to change the position of an elected sheriff to an appointed position. For that to happen, both the California Constitution and the county charter would have to be amended. Amending the California Constitution ultimately requires approval by a majority of voters in a statewide election. There are two paths to get a constitutional amendment on the ballot and before the voters: by an act of the legislature or through the initiative process. The legislature can approve a constitutional amendment to go before the voters with a 2/3 vote of each of the Senate and the Assembly. Alternatively, proponents can use the initiative process to place a constitutional amendment on the ballot. A successful petition for a constitutional amendment requires the signatures of 8% of the voters for all candidates for governor at the last gubernatorial election. And currently that's approximately 997,000 signatures. If the California Constitution was amended to no longer require elected sheriffs, the county charter would also need to be amended to make the sheriff an appointed county officer. Supervisors, that in sum are the various ways the sheriff could be removed from office and how the position of an elected sheriff could be changed to an appointed position. And that's my presentation for today. Thank you.
Thank you. Thank you so very much, County Council. I know this took a lot of hard work to put together for us. I will recognize at this point Supervisor Holly Mitchell.
Madam Chair, if you want to provide opening remarks first, I'm absolutely more than happy to speak after you.
Okay. Okay, very well. Then I'll go first. You will go second, then Sheila Q, I see, and then Catherine Barger, in that order so far. Okay, very good. I want to thank again the authors of the motion, and I also want to thank County Council and the Office of the Inspector General, the Civilian Oversight Commission, and all the justice advocates for their work on this very important report. There have been multiple attempts to ensure transparency of the sheriff's operation and to hold the department and the sheriff accountable for misconduct and even harassment of county colleagues like our former CEO and even myself. Much to my dismay, we have had false pretenses of collaboration and cooperation from the Sheriff's Department. I'm aware that Sheriff Villanueva attended the last two Civilian Oversight Commission meetings, which I remind you was required by law given the subpoena that was issued. But we have a long way to go in restoring or establishing the trust of community in the Sheriff's Department. That is the sheriff's responsibility, but it's also ours as a board. And I want to underscore some of the actions we have taken thus far and how much this board has done to ensure that accountability. Number one, we've sued the Sheriff's Department. We've also established restraints on the department's budget. We've established the Civilian Oversight Commission and the Office of the Inspector General. And we, importantly, the voters, extended subpoena power to these bodies, empowering them so that these are not just oversight bodies in name, but in action. Accountability and transparency are not matters that I believe we take lightly. Our communities deserve that. The report contains multiple options for the board to consider. It also offers mechanisms to address issues pertaining to transparency through litigation and changes either to our state constitution or county charter. It also reminds us that just as the voters went to the ballot box to vote for measures R and J, they can go to the ballot box to affirm or reject any candidate for public office. We've also heard last Friday that Attorney General Becerra will be launching an investigation into the Sheriff's Department on whether there is a pattern of practice of unconstitutional policing after hearing complaints and reviewing enough evidence of misconduct to move forward. I welcome this investigation as part of the board's continued effort to hold the department accountable for its actions and inactions against the residents of LA County. The board is committed to helping the Attorney General and the Department of Justice in their investigation. And I want to echo Attorney General's call for the Sheriff's Department, for the LA Sheriff's Department to be transparent, accountable, and to cooperate with this investigation. Accountability and transparency of law enforcement is part of public safety and justice. It ensures that no one, including the Sheriff of LA County, past, present, and future, is above the law. Thank you, members. With that, Supervisor Mitchell.
Thank you very much, Madam Chair, and I'd like to thank County Council for this information. It's my understanding prior to my joining the board that there was a motion asking for this information, and the point of today's presentation is a report back where information is really being shared in terms of what our legal, if you will, options are available to us. So I think it's important, based on comments we heard in public comment, that the public understand that today is a report back, and that in the process of the workings of the board, no specific action will be taken today, but we are all gleaning information. Like you, Madam Chair, the recent announcement from the California Attorney General with regard to his office initiating an investigation was alarming, to say the least. An embarrassment, quite frankly. To hear words uttered such as, quote, they will be determining if the Sheriff's Department has violated the law or the rights of the people of LA County, recognizing that the Sheriff and his department are taking oath to do the exact opposite, is really, it was very painful to read. Further, the Attorney General stated that there were serious concerns that accountability and adherence to legitimate policing practices have lapsed at the department. An inquiry into the potential pattern and practice of civil rights abuses to the residents of our county by the Sheriff's Department is serious and simply cannot be ignored. Complaints from the community regarding excessive use of force and deputy-involved gangs, which have plagued the department for decades, have increased in the wake of the fatal shootings of several well-known names here in LA County. Sheriff's Department accountability is a critical part of making our communities safe and upholding the rule of law, an essential feature of life in a democratic society. Its absence has contributed to the infringement of constitutional and basic human rights, a structural budget deficit, and diminished public trust and confidence, among other consequences. Our work in strengthening oversight and transparency is an important part of ensuring that accountability and ensuring that it extends beyond a 4-year election cycle. However, this will never be enough without good faith cooperation and collaboration from the sheriff. And in the absence of that, I believe we have a responsibility to act. While I appreciate the sheriff acknowledging when he presented today the fact that he and I did have a meeting, and I appreciated some of the statistics and some of the data the sheriff shared with me to brief me as a part of my onboarding process as a new member representing the 2nd District. It should not be assumed that my perspective of his performance was changed by a single meeting, nor do I think his perspective of my positions that I've made very public even prior to assuming this office. I don't believe his attitude changed at all either. But indeed, a meeting did take place. So let me be clear, there is no substitute for the department's critically necessary cooperation with the legally mandated work of the county's oversight entities. It's imperative that this department resume regularly sharing requested information with the Office of Inspector General and the COC so they can perform their duties, the duties that we expect of them as a board and the residents of LA County expect of them. In the absence of such cooperation only shows further distrust and diminishes the confidence of the public we all serve, and my confidence as well. So I look forward to the Attorney General's office's investigation. I'll be monitoring it closely, and hopefully we will then have an opportunity to revisit our options for ensuring a stronger, more permanent sense of department accountability once the Attorney General's investigation is completed. Thank you very much, Madam Chair.
Very much. Next, I'll recognize Supervisor Kuehl.
Thank you very much, Madam Chair. I echo many of the sentiments of my colleague from the 2nd District. And, we have had a number of frustrating experiences since, Madam Chair, you and I have assumed office with the current sheriff. And I thank County Council for meeting the challenge of the motion to identify the various choices that we have. Most of them look like a heavy lift to me, but that doesn't mean that they wouldn't be possible. I echo Supervisor Mitchell's comments to those who testified today in public comment as to their hopes that we would do something about this, that it is not possible to bring a motion right away today, having been presented with these options, because many of them really require us to fully digest, I think, what might be possible, and also the very large picture of a countywide election to change the charter, a statewide election to change whether all sheriffs in the state should be appointed or elected, or even giving a choice to each county. So there's much more really to think about. But the urgency is really there with this sheriff. Just last week, there was another incident where young men who were just shopping in a Target store in Westlake Village were rounded up by sheriff's deputies, naturally, young men of color, and because others were committing a crime in a different section of the store. And there is, quote, an investigation going on, but there was a post by their supervisor that they had acted appropriately, which was really posted about 5 minutes after the incident. So there wasn't any investigation. Post was taken down, but and I assume there's an investigation, but we hear that so often. And that's actually one of the reasons why we're having independent hearings about the deaths of various people allegedly caused by deputies, inquests, because the results of so many of those, quote, internal hearings really doesn't cut it. So there is a lot to be concerned about, I think. And I do believe, as Supervisor Mitchell indicated, it is one of the duties of an elected board of supervisors to look at the conduct of other electeds if and when they cross a line either of criminal activity or inappropriate activity or inappropriate supervision. So I will be looking very closely at these options to try to figure out what can be done. One thing that County Council didn't mention was an option of removing some law enforcement responsibilities from the sheriff. We couldn't do that in terms of the jails without state acquiescence, but you know, there is always the opportunity to have an independent police force for unincorporated areas, and I think that's another aspect, though expensive, that we will see in his report we can look at. So our thanks to County Council, and I look forward to further consideration and discussion of these matters. Thank you, Madam Chair.
Thank you very much, Supervisor Kuehl. Next, we'll recognize Supervisor Barker.
Thank you, and thank you, Rod, for the report. As my colleagues know, I remain opposed to taking action to unilaterally remove the sheriff or changing policies to instead have that position be appointed. We were each elected to collaborate as servants of the public, and it's not within our jurisdiction of this board to take voting power away from the people. Sheriff Villanueva was independently elected, and the power lies with the people of LA County to change that. There have been many sheriffs before him, and I'm sure there will be certainly many more who will follow. As I've stated before, we cannot make long-term policy decisions based on short-term personalities that be. The voters made their decision in 2018, and they will have another opportunity in 2022, unless there is a community-led effort to vacate that seat prior to the election. I continue to encourage the sheriff to be transparent and collaborative with our oversight bodies, and now with the Attorney General coming in, I would point out that the Attorney General has the ability to do an investigation, have it completed, and then take action if appropriate. So in fact, if there is any impropriety or illegal activities, the Attorney General can take swift and direct action once the investigation is completed. I think it's imperative for the well-functioning operation and the community that they are deserving of access to the information and answers that they seek from this current administration. So I'm opposed to moving forward with this, but I also recognize the fact that in some ways the sheriff's put us in this position to have to make a decision like this based on some of the conduct that's been put into play. And I would hope that moving forward, especially with the Attorney General, and if I believe what he has put out, that he welcomes this investigation and is going to cooperate, I think that is going to shed light on what is going on. So with that, while I appreciate, Rod, the hard work you put into it, and I think that it shows that there are options, I feel that it undermines the very principle of how we all got elected into this office, and I do not support it. Thank you, Madam Chair.
Thank you. Are there any other board members that want to be recognized at this time? Okay. Seeing none and hearing no other comments, item 32 is before us, moved by Supervisor Kuehl, seconded by Supervisor Mitchell to receive and file. Hearing no objections, that will be the order. Moving on now to item number 11. This is number 38. At this time, it would be appropriate to hear from supervisors on items not posted on the agenda to be presented or referred to staff or placed on a future agenda. And I do have a special that I do want to relay to the board at this time. Before we close, I want to read in a motion that will be before the board for consideration at the next regularly scheduled meeting. As I stated, I saw firsthand the transportation barriers to accessing the vaccine last week. And I know these are felt by many, many in our communities. For that reason, I'm bringing forward the following motion titled Equitable Access to the COVID-19 Vaccine. And it reads as follows. Los Angeles County has mobilized all its resources in response to COVID-19 pandemic and now the role of the COVID-19 vaccine. In a short period, the county launched 5 megapoints of dispensing, known as pods, and facilitated many other pods through healthcare and community partners. The mega pods are strategically located in part of a larger framework for other vaccination sites coming online, including pharmacies, hospitals, clinics, urgent care facilities, and schools. But until the COVID-19 vaccine is available in every neighborhood, there are significant inequities like access to transportation that have to be addressed. With inclement weather, limited appointment availability, and a limited but growing number of vaccine sites, the county has a responsibility to partner with transportation operators, authorities, and companies to ensure community members, particularly those 65 and older, can access our vaccination sites with ease. With the county of our size, offering transportation options to vaccine sites is integral. It's a matter of equity. Therefore, I move that the Board of Supervisors direct the County Emergency Operations Center to partner, coordinate, and execute necessary agreements with municipal and regional transit operators, authorities, and companies, and evaluate where possible, rerouting the county's own transit system services to provide direct access to vaccine pods, ensuring transportation is not a barrier to vaccine and access for our county residents. So I want to thank you, members. That concludes these specials for today. We are now going to turn to adjournments, and at this time it would be appropriate to hear adjournments, and we will begin with Supervisor Kuehl. Supervisor Kuehl.
Thank you very much, Madam Chair. Unfortunately, as you can see from the list posted, we had quite a few people pass in the third. So I move that when we adjourn today, we adjourn in memory of Marlene Bain, who just died actually yesterday. She was a beloved American Jewish Committee leader, pillar of the Los Angeles Jewish community, tireless champion of democratic values, a towering force for good. She actually was very inspiring to leaders across California to step up and work in public service. Trusted, confident counselor and friend to many, but of course most proud of being the matriarch of her beautiful family. The strength and vitality of AJC Los Angeles is due in large part to Marlene's own strength, determination, and vision. And last year, AJCLA established the Marlene Bain Distinguished Public Service Award in her honor. She is survived by her son Neil and her daughter Lisa. And I move that when we adjourn today, we adjourn in memory of Antonio Bernabe. He joined CHIRLA in 1997 as day laborer site coordinator and community organizer, and later became their director of organizing. At CHIRLA, Antonio helped open and run day laborer centers and create the National Day Laborer Organizing Network, an advocacy and grassroots organization that fights for the rights of day laborers. Some of his career achievements include helping create the Building a Community Leadership Development Program, advocating for AB 60, a California bill signed into law allowing undocumented immigrants to get driver's licenses in California, and he organized communities to support SB 54, the California Values Act, which limits collaboration between local police departments and federal immigration officers. Throughout his career, he helped immigrant workers collect millions of dollars in unpaid wages and worked with faith institutions, Mexican consulates, the U.S. Department of Labor Wage and Hour Division to create Empleo, a national hotline for immigrant workers to call when they were facing abuse. He trained thousands of grassroots leaders and organizers so they could have an active role in changing their lives and the lives of so many others. He's survived by his wife, Martha, and his children, Martha, Tony, Gabriela, and Valeria. And I move that when we adjourn today, we adjourn in memory of a longtime friend, Marguerite Chickie Byrne. Chickie, in addition to raising her family, was actively involved in many community, charitable, educational, and religious organizations, including St. Anne's, the Social Service Auxiliaries of the Sisters of Social Service, Good Shepherd Center for Homeless Women and Children, Christ the King Catholic Church, Cathedral Chapel School, Daniel Murphy High School, Loyola High School, Notre Dame Academy, and the Hancock Park Homeowners Association. She served on the school board of the Archdiocese of Los Angeles for 10 years. I first met Chickie and her husband Skip, the Honorable Skip Byrne, right after they were Unicamp counselors when I first came to UCLA, so you can imagine how long that friendship has been. She's survived by her husband Skip and their 6 children, Mark, Elizabeth, Matthew, John, Andy, and Joe. And I move that when we adjourn today, we adjourn in memory of Kellum DeForest. After graduating from Yale, moved to LA in '52 and established an independent business conducting legal and historic research for the nascent television industry. Over the next 40 years, Kellum became known as Hollywood's answer man, and his firm, DeForest Research, contributed to the verisimilitude of hundreds of motion pictures, from acclaimed classics like Chinatown and All the President's Men, as well as thousands of TV episodes beginning with The Untouchables and Profiles in Courage, and carrying on through several generations of Star Trek. He's survived by his children Anne, Carmeg, and Elizabeth. And I move that when we adjourn today, we adjourn in memory of Howard Friedman, attorney and Jewish leader who, at the end of the Korean War, served as a captain in the U.S. Air Force and JAG Corps. He moved to California to teach at Stanford Law School, spent his career at Loeb & Loeb, where he was managing partner and head of the litigation department, as well as a fellow of the American College of Trial Lawyers. All his life, Howard was a tireless Jewish leader. He served as the national president of the American Jewish Committee from 1985 to 1988. He was an emeritus governor of the Board of Overseers of Hebrew Union College. In 1996, he was one of the founders of the Skirball Cultural Center in Los Angeles and served as chairman of the board from 96 all the way until 2014. He was a fierce advocate for what he believed was right. In 1948, while a student at OU, he led on-campus protests in support of Ada Lois Sipua Fisher, a black student who had been denied admission to the law school on the basis of her race. In 1992, He joined the ACLU to appeal for a stay of execution for a convicted killer who suffered from fetal alcohol syndrome. A good man and a hero. He's survived by his wife Wilma, his daughters Leslie and Beth, and his son Harry. And I move that when we adjourn today, we adjourn in memory of Ben Halpern, who graduated from New York University Film School in 1945, was a member of their very first class. From 1949 to 52, he was a publicist at Paramount, where he created campaigns for feature films. He was then hired as vice president of television and investing by Universal, where he worked on movies of the week and TV shows including Duel, Murder, She Wrote, Magnum P.I., The Rockford Fellows, Miami Vice, Ironside, Columbo, and many others. He was a member of the Board of Governors of the Academy of TV Arts and Sciences and a founding member of the Television Publicity Executives Committee, as well as a founding board member of the LA County Interagency Council on Child Abuse and Neglect, ICANN Associates. Some of his proudest achievements involved issues of social justice. He was instrumental in realizing Blacklist, a monument on the campus of the University of Southern California in honor of those impacted by the Blacklist during the McCarthy era. He's survived by his wife Lois and his children Amy, Nancy, Andrew, and Nora. And I move that when we adjourn today, we adjourn in memory of the legendary talk show host, Larry King. It's a career that spanned half a century, and he became one of the most famous talk show hosts and opinion shapers in the world. Over the decades, an endless succession of celebrities, politicians, newsmakers, experts dutifully answered his questions. In addition to CNN's Larry King Live, which ran for over 25 years, King was the author of a number of best-selling books, wrote a long-time weekly column of random thoughts for USA Today, made more than 20 cameo appearances in movies, and in the midst of the pandemic, just last year, launched an hour-long pop culture podcast. A wonderful man, certainly a memorable man, survived by his children Larry Jr., Chance, and Cannon. And I move that when we adjourn today, we adjourn in memory of another unforgettable woman, Joan Dempsey Klein. I should say the Honorable Judge Joan Dempsey Klein. She was a celebrated champion of women's rights and the first woman to become presiding judge of a California appellate court. She co-founded the California Women Lawyers Association in 1974, was elected as a judge on the LA County Superior Court in 75, served 50 years as a judge in California, and wrote more than 500 judicial opinions. She fought for the rights of women to open bank accounts or buy stocks in their own name without having to ask their husbands or fathers for permission, as was required by law in earlier decades. The National Association for Women Judges, an organization she co-founded in 1979, described the late judge, who served 36 years in Division III of the 2nd District Court of Appeal, as a trailblazer, a giant, a mentor, a founding mother, and a pioneer in the struggle to achieve equal opportunity for women in the law. She is survived by her 5 children, including LA County Superior Court Judge Mark Dempsey Gross, Susan Bruin, Brad Gross, and Amy Millard, and her stepdaughter, Karen Klein. And I move that when we adjourn today, we adjourn in memory of Jess Margarito, who served in the U.S. Army in Germany from 66 to 68, was honorably discharged, was executive director for immigration services at Santa Rosa Church in the city of San Fernando. He was the first Latino appointed to serve as mayor for the city of San Fernando. It was historic, and he held that position from 1986 to 1990. He's survived by his wife, Cecilia, and his 3 children, Jess Jr., Yolanda, and Annalisa. And I move that when we adjourn today, we adjourn in memory of Frederick Moch, who enlisted in the Navy during World War II, stationed in the Philippines as a radar man. Shortly after returning from the war, Fred was offered an entry-level position with the William Morris Agency in New York City. After a few years at the William Morris Agency, Fred accepted a promotion in the agency's Beverly Hills office, where he spent the remainder of his 41-year career. During his dynamic career, he worked with such legendary talent as Jimmy Durante, Sammy Davis Jr., Elvis Presley, Debbie Reynolds, Jerry Lewis, Sonny and Cher, Don Rickles, Julio Iglesias, Diana Ross, Donna Summer, and Aretha Franklin, among many other famous acts of the time. He's survived by his wife Nancy and sons Jonathan and Jason. And I move that when we adjourn today, we adjourn in memory of Tony Morris, who, while attending Yale, discovered his passion for film. He produced the first student film at Yale to win acclaim, which helped him get into the University of Southern California and pursue cinema. Had the good fortune to study alongside cinematic greats like Francis Ford Coppola, John Milius, and George Lucas, and helped with some of the initial research for the acclaimed film Apocalypse Now. Later moved on to a career in architecture, was a persistent and dedicated advocate for fire safety and emergency preparedness, especially in his Topanga neighborhood, and organized what became the Aerial Fire Protection Associates. In 2004, he lobbied before Governor Schwarzenegger's Blue Ribbon Fire Commission and won the okay for what became the Wildfire Research Network, a nonprofit public safety research and education organization. He's survived by his wife Daniela and his son Sean. And I move that when we adjourn today, we adjourn in memory of Samuel Sapin, who died on January 10th. In 1955, he and his wife and his two young children moved to the San Fernando Valley, where he began working with the then small Southern California Kaiser Permanente Medical Group. He spent 45 years with Kaiser and retired in 2000. But he was instrumental in the growth of Kaiser into a huge and highly successful healthcare system. A sampling of his roles in the organization includes starting the nurse practitioner program, chief of pediatrics, regional director of education and research, associate director of clinical services, and 2 terms on the board of directors. He joined the clinical faculty of the UCLA Medical Center in 1956, retired from that position in 2000 as clinical professor of pediatrics. He was the primary author or co-author of 40 peer-reviewed medical publications between 1949 and 2005. He was a member of numerous regional and national professional organizations, serving terms as president of the California Society of Pediatric Cardiology and the Los Angeles Pediatric Society. He's survived by 2 children. And I move that when we adjourn today, we adjourn in memory of Siam Siam. She and her husband, Mustafa Siam, were a founding family of the Islamic Center of Southern California. Later became active in the Palestinian American Women's Association. Spent the majority of her working career as the lead morning cook at Valley Hospital Medical Center in Van Nuys, cooking breakfast and lunch for hundreds of patients each day. She's survived by her sons, Mazin, Murad, and Mickey. And finally, thank you for your patience, and sorry there are so many. I move that when we adjourn today, we adjourn in memory of a wonderful woman, Jane Zingali. She led a full life as a performance artist, a published short story writer, a super athlete, a marathon runner and swimmer, a nationally ranked speed skater, a yoga teacher for over 25 years, and a painter with a rich imagination. As a trendsetter, she always surpassed the ordinary, and she was well known and loved by many, many, many of us here in the Santa Monica community. She's survived by her sons, Christian and Aaron, both very proud of her for being outrageous and so politically progressive. Thank you, Madam Chair.
Very much, Supervisor Kuehl. Next, Supervisor Hahn.
Thank you, Madam Chair, and I too will ask for everybody's indulgence as I have a lot as well. The first one I would like to adjourn for, when we adjourn, I'd like to adjourn the memory of former Congressman Steve Kuykendall, who just passed away at his home in Long Beach. He was only 73 years old. Steve Kuykendall was such a proud American and a family man whose life was defined by service and his family. He was commissioned in the United States Marine Corps, and he served 2 tours in Vietnam. And as an elected official, he served as a councilman and mayor of Rancho Palos Verdes, and then he went on to serve as California State Assemblyman, and he later served as a member of the U.S. House of Representatives. I first got to know him pretty well when we were running against each other for Congress in 1998. Then Congresswoman Jane Harman was running for governor of California, so she stepped down, which left an open seat. I was drafted to run, and so was Steve. He ultimately beat me in that race. And while we might have had a bitter election campaign season, Steve always treated me with great dignity and respect whenever he ran into me, and I did the same for him. His volunteer and nonprofit work was a central part of his life. He served on the board of the Palos Verdes Peninsula Education Foundation and was a founding board member of Fisher House, Southern California, Inc. He was also a ruling elder in the Presbyterian Church, and he was ordained at St. Peter's Presbyterian Church. He's survived by his wife, Jan, their 3 children, Carrie, Brent, and Craig, and 7 grandchildren.
Janice, may I join you on that? It's Sheila.
Yes. Did you serve with him in Sacramento?
Yes, in the assembly.
Okay, right. Yes, of course. Thank you. Then I'd like to, when we adjourn, I'd like for us to adjourn the memory of Dawn Ramirez, who was a resident of Wilmington, and she was 49 when she passed away. She was a fighter through and through. She had a heart of gold and was an incredibly kind and generous person. Dawn was predeceased by her son, Michael. She's survived by her husband, Randy, her daughters, Cassandra and Alexandria, and her grandson, Chase. Then I'd like to move that when we adjourn today, we adjourn the memory of Frank Brown, who was a longtime resident of the Palos Verdes Peninsula. He was 88 when he just passed away. He was an officer in the United States Air Force and the consummate gentleman. He dedicated his life to family, to education, to travel. He loved living on the hill and was an active member of the community. He and his wife, Pat, were the society editors of the Palos Verdes Peninsula News for many years, and he served on the board of the PV Community Arts Center. He also organized the Norse Theater Festival, and he dedicated time to the Mary and Joseph Retreat Center. He leaves behind an incredible legacy of respect, optimism, integrity, and goodness. He was preceded in death by 2 of his daughters, Leslie and Louise, and he survived by his dear wife, Pat, his children, Francine, Nicole, Christine, James, 6 grandchildren. Those of us in San Pedro know James Brown, who is the proprietor of the San Pedro Brewing Company and just such a great member of our San Pedro community. And many of you might have remembered Christine. She was also a chef and owned Christine's up on the hill. So 2 of his kids ended up being chefs and restaurateurs. What a great family. We will miss Frank Brown tremendously. I also move that when we adjourn the memory of Gay Givens, who worked at the Center for the City of Lakewood for 30 years. She was the community services supervisor, overseeing operations and serving as the main point of contact. When Gay was not at work, she enjoyed planning theme parties, over-the-top weddings, and large family reunions. She was a member of Pathways, Volunteer Hospice, the National Council of Negro Women, her church, and the Lakewood Long Beach Seroptimus Club, where Gay was president when she passed away. Gay's work with the Seroptimus included overseeing their Live Your Dream Awards dinner and assisting with the annual Dream It, Be It event. Gay's favorite activities involved spending time with her 24-year-old twin daughters, and she got a big kick out of just being their mom. She will be deeply missed and is survived by her wife and 2 twin daughters. I move that when we adjourn today, we adjourn the memory of John Arnett, who was an LA legend who passed away at the age of 85. He was a star running back with USC Trojans and the LA Rams. And while playing for USC, he earned the nickname Jaguar John because of his incredible speed. He was named an All-American in 1955 and later inducted into the College Football Hall of Fame. He played 7 seasons with the Rams before he was traded to the Chicago Bears for his final 3 seasons in the NFL. I went to church with the Arnett family, with his parents and his brother Bill, but once John became famous, every time he showed up at church, it was quite a mob scene. He's survived by his wife, Jane, his son, Matt, his daughters, Kristen, Kimberly, and his brother, Bill. I move that when we adjourn today, we adjourn the memory of Juanita Zatarain, who was 91 when she passed away. She was a longtime resident of the city of Norwalk, and she passed away on January 18th. Juanita is also the mother of 2 of our county employees, Lupe Carrillo, who worked for my dad for 7 years and currently works at the Department of Public Works, and Adriana Rodriguez, who works for the Department of Parks and Recreation. Juanita is survived by her 5 children, Lupe, Adriana, Enrique, Patty, and Jose, and 7 grandchildren. She will be missed by all who knew her. My deepest sympathies go out to Lupe. I also move that when we adjourn today, we adjourn in the memory of Lily Brantley, who passed away at the age of 96. This is a story that lived in my family's life since the Watts riots in August of 1965. On the very first night of that riot, my dad had gotten a call from the undersheriff to say that there were reports of bricks being thrown at cars. So he immediately grabbed a staff member and drove to the area of Imperial Highway in Avalon. Nothing seemed out of place. So they were about to go home, but while they were stopped at a light, that's when several people came out from behind some bushes and began hurling bricks at all the stopped cars. One came through the passenger side where my dad was sitting, which caused glass to be shattered all over him, and he actually had some cuts on his face. They immediately drove to a residential section of Watts. I think it was like 2 a.m, and they just knocked on the door of the first house they saw, which was the Brantley residence. My father said, "Hi, I'm Supervisor Kenny Hahn. I've been attacked by a brick," and Lily and her husband immediately brought him in, providing him with a towel and a bandage for his bleeding face, and that launched a decades-long friendship where they continued to write each other letters. They were what you would call pen pals in those days. He wrote her a letter thanking her for that kindness, and she began writing him and even sent him a get well card after his heart surgery in 1975. In 2014, when I was a member of Congress, her family reached out to me to say that Lily was 90, and they wondered if I remembered her, and I was like, oh, of course. She was sort of an angel in our household, so I got to present her with a congressional commendation for her birthday. She's preceded in death by her husband Clarence, daughter Joyce, and she's survived by her daughter, 2 sons, 11 grandchildren, and 10 great children. She was a good Samaritan that night. I move that when we adjourn today, we adjourn the memory of Michael Wayne Robertson, who passed away at the age of 64. He was a dedicated police officer who proudly served the citizens of Los Angeles for 33 years. He began his career with the General Services Department, Security Services Division, which is now the LA Police Department Municipal Police Division. His unwavering commitment to protect and serve was highly admired by his peers and all who knew him. During his career, he was assigned as a dignitary protection to the offices of Councilmember Mark Ridley Thomas, Mayor Antonio Villaraigosa, and Mayor Eric Garcetti, which would be his final assignment. Officer Robertson was also an avid watch collector and car enthusiast. He was loved and deeply cherished by his daughters, his siblings, by his family, and his friends. And I also move that when we adjourn today, we adjourn in memory of Paul Westfall, who was 70 when he passed away. He was a native of Torrance. He was a basketball star at Aviation High School in Redondo Beach. Then he played at USC and was recognized as an All-American and as a junior and senior. He was selected as the 10th overall pick by the Boston Celtics in 1972 NBA draft. He won an NBA championship in 1974 with Boston before being traded to the Phoenix Suns the following season. He retired after 12 seasons and then coached for another 10 years. He was inducted in the Basketball Hall of Fame as a player in 2019. He is survived by his wife Cindy and daughter and son. I also move that when we adjourn today, we adjourn in memory of Rosario Legrande, who was a longtime resident of San Pedro and the grandmother of our city council member, Joe Buscaino. She was 100 when she passed away. Rosario was a member of the Anderson Senior Center in San Pedro and was one of the founding members of Mary Star of the Sea Church's St. Joseph's Table Society. Rosario, known to her grandchildren as Nona, was the proud grandmother of 20 grandchildren, 38 great-grandchildren, and 5 great-great-grandchildren. Rosario is preceded in death by her husband of over 60 years, Gaetano. We hope she rests in peace and know she was proud of all of her grandchildren, but most especially of Councilmember Joe Buscaino.
Can I on that one?
Okay.
Thank you.
Yes.
Thank you.
I move that when we adjourn today, we adjourn in memory of Ruben Hernandez Aguiar, who passed away at 88. He was born and raised in Wilmington, and he was a beloved member of the community. He's survived by his wife, Helen, 5 children, 8 grandchildren, and 3 great-grandchildren. Move that when we adjourn today, we adjourn in the memory of Sandra Hutchins, who was 66, and she was born in Monterey Park, raised in Long Beach. In 1978, she graduated from the LA County Sheriff's Academy and worked as a deputy at the Sybil Brand Women's Jail. She rose through the ranks and retired in 2008 as division chief to accept the appointment to serve in the 12th Orange County Sheriff. She made history as the agency's first female sheriff. She took office as the Orange County Sheriff's Department at a tumultuous time amid controversies and lawsuits. She's credited with stabilizing that department and restoring public trust. In November of 2012, Sheriff Hutchins was diagnosed with breast cancer. She courageously fought this disease while still leading the Orange County Sheriff Department. Her fight was successful for 8 years, and unfortunately the cancer returned. Sheriff Hutchins passed with her loved ones by her side. She's survived by her husband, Larry, a retired assistant chief with the Los Angeles Unified School District. Those are my adjournments. Supervisor Sleets, I hope you will let me say a few words about Tom LeBon, because I think we're going to adjourn for him. Thank you.
Sure. Okay. Supervisor Barger.
Thank you. I move that when we adjourn today, we do so in memory of Custody Assistant Richard Bowles of the Santa Clarita Valley Sheriff Station, who passed away on January 11th after suffering from ongoing medical issues throughout the past 2 years. Richard joined the LA County Sheriff's Department in 1997 and was assigned to North County Correctional Facility. While there, he worked a variety of assignments and was well respected by his peers and supervisors. In 2006, he transferred to Santa Clarita Valley Station as a station jailer, where he spent the next 14 years booking suspects and supporting patrol deputies in their duties. Richard was a jovial, warm person with whom his co-workers routinely shared a joke or fun story about his passions, which included country music, camping, and his beloved family. Richard is survived by his wife, Carrie, and their 2 children, Amy and Brandon, all who live in the Santa Clarita Valley. I also move that we adjourn today in memory of Ronald Conzaneri, better known as Corky, a longtime resident of San Marino, a restaurant owner, and former Tournament of Roses president who passed away on Thursday, January 21st. Known as Corky, he was born in Los Angeles and married his Alhambra High School sweetheart, Marilyn. They went on dates in the 1950s at the original The Hat restaurant in Alhambra. When Corky heard it was going to be torn down, he saved it in 1981 with his brother Joe. He went on to become chairman of C&J Food Company, which operates many of the Hat restaurants in the San Gabriel Valley. Corky was also a lifelong fan of the Rose Parade, where he and Marilyn camped out as 16-year-olds. He was a tournament member for many years, was elected executive committee in 2001, and eventually served as president from 2008 to 2009. As president, he oversaw the 120th Rose Parade with the theme Hats Off to Entertainment. Corky was also an active member and former president of the Pasadena Optimist Club, the San Manuel City Club, International Council of Shopping Centers, and the California Restaurant Association. He's survived by his wife, Marilyn, his 2 children, Jody and Joseph, their spouses, and 5 grandchildren. Also, that we adjourn in memory of Dr. Garbus Der Yagajian, a longtime resident of Laverne, who recently passed away at the age of 71. Born in Beirut, Lebanon, he began teaching at age 17 and then became school principal at the age of 22. Dr. Yagajian migrated to the United States in 1976 and went on to receive 2 doctoral degrees from Northwestern University and the University of Laverne. A lifelong educator and advocate for peace, he served in various capacities at numerous educational institutions, including the American Armenia International College, the University of Laverne, and Mashkat College in Glendale. He was recognized as an instrumental figure in promoting higher education amongst the Armenian Americans. An active community leader, he served on many nonprofit boards and committees, hosted 3 weekly live television programs, and was frequently featured in newspapers and magazines. He was a dedicated member of the Rotary Club, and the Garbus Der Yagajian Peace Institute was crafted in his honor by the Rotary International District 5300 at the 24th Anniversary Peace Conference of 2013. He was a recipient of numerous awards, recognitions, and honors from heads of states, government officials, universities, and community organizations. He's survived by his wife Angela and sons Jimmy and Johnny. Also, that we adjourn in memory of Evelyn Elizabeth Gunther, who passed away December 19, 2020 at the age of 94. She was active member and supporter of Zonda, an international organization making the world a better place by empowering women in a supportive community of like-minded professionals from diverse countries and cultures. Born March 20th, 1926 in Independence, Missouri, Evelyn liked and lived in Kansas City, Missouri until she was 17. She attended Graceland University and the Antelope Valley College. She was married for 71 years to Merrill Eugene Gunther from April 3rd, 1947 until his passing in December of 2018. Her career includes stints for the Pacific Telephone and Telegraph in Berkeley, Richmond, and Los Angeles. The family moved to Lancaster in 1960. Her community work included Cub Scout trainer, Little League baseball, and PTA offices at the local council and district levels. She formed the Antelope Valley College Archaeological Society, served as president of an early version of the Lancaster Museum of Art and History, and served on the advisory board at the Mira Loma Hospital. From 1969 until her retirement in 1988, Evelyn was employed by the Los Angeles County Department of Public Social Services, ultimately serving as Assistant Deputy Director of Food Stamp Operations. In 1984, she received Los Angeles County's Outstanding Employee Award. She served 2 terms as chairman of the LA County Employee Advisory Committee. Other awards included the Golden Key Award for Education from Lancaster Elementary Teachers Association, the First Sight Citizens Award to a female from Delta Kappa Gamma, honorary life membership from California Association of Secondary School Administrators, and the PTA Life membership. Also, that we adjourn in memory of the Honorable Gabriel A. Gutierrez. Judge Gabriel A. Gutierrez, a resident of South Pasadena, recently passed away at the age of 83. He was born in Los Angeles. He went on to attend Santa Clara University, where he received his Juris Doctorate degree in 1964. While at Santa Clara, he met his wife Gail, a public health nurse, and they were married in 1966 and had 5 sons. He joined the U.S. Attorney's Office in 1965, moved to Washington, D.C. in 1968 to serve as trial judge for the Department of Justice. He returned to Los Angeles in 1969 and began working in private practice. He was elected as Commissioner Judge Pro Tem for Los Angeles County, subsequently appointed by Governor Brown to the Municipal Court in 1977 and to the Superior Court in 1979. He continued serving as a judge in various capacities, supervising judge and presiding judge, from 1987 to 1997. He was assigned the civil trial calendar for Los Angeles Superior Court and the California State of Appeals for the 2nd District. In retirement, Judge Gutierrez remained active, providing arbitration and dispute resolution. He was awarded numerous recognitions, including Trial Judge of the Year from Consumer Attorneys Association of Los Angeles, Judge of the Year from the Pasadena Bar Association, Award of Honor from the LA County Board of Supervisors, and Judge of the Year from the Constitutional Rights Foundation. In his personal time, he was an active and loving father who is remembered as guiding and encouraging his children to pursue their goals. After the loss of his first wife, he was remarried in 2014 to his wife, Anna Marie. Judge Gutierrez was also an active parishioner of Holy Family Church in South Pass. He was also active in the Annandale Golf Club in Pasadena. He was a fan of many local sports teams, including the Dodgers, Rams, Lakers, and of course, Loyola High School Rams. As a community leader, he leaves a lasting legacy of support, mentorship, and empowerment of the next generation of leaders. Judge Gutierrez is survived by his wife, Anna Marie, sons Javier, Felipe, Andres, and Gabriel, 7 grandchildren, and many other loved ones. Also, Bruce Hendy, a longtime California horse trainer who most famous runner was champion sprinter Kona Gold, who died January 15th at the age of 86. Born in nearby Baldwin Park, Bruce was first introduced to racing at Santa Anita by his aunt at age 6. He met the love of his life, Osa, at the Golden Gate Fields in 1959 and married her in 1962 and was always quick to credit her for any successes he had. Bruce, who never graduated high school, became a licensed trainer at age 25. His first winner came to the LA County Fair with his first horse, Thorium, that he purchased for $500. A natural athlete, he rode as many as 10 to 15 of his own horses each morning at Santa Anita until about 10 years ago when his health issues interfered. Headley was most comfortable at Santa Anita, where he could often be found holding court at Clocker's Corner several mornings a week after training. He exercised his own horses into his 70s and had the same barn on the south side of the stable for decades. He's survived by his wife, Osa, daughter Karen, and son Gus. Also that we adjourn the member of Justin Lane, an Antelope Valley East Kern Water Agency board member who died tragically on January 1st in a truck crash at the age of 34. Justin was a fourth generation of the pioneering Lane family who resided at the Lane Ranch in Quartz Hill. He was vice president of Monte Vista Building Sites, Inc., and a partner in Lane Ranch and Company, which today supplies livestock and equipment to the motion picture industry. Justin was elected to the ABEC Water Board in 2016 and re-elected in November of 2020. Justin graduated from Parkwright High School in 2004. He competed in football, baseball, soccer, and track while also competing in rodeos at the same time. He graduated from California State University, Bakersfield in 2013. He began competing in professional rodeo cowboy association events in 2008. At one point, he was ranked 14th in the world. Continuing a lifelong family tradition, Justin drove a Wells Fargo stagecoach and horse team at events throughout the western United States, including the Tournament of Roses parade in Pasadena. Justin is survived by his wife, Jessica, son, Bronson, and grandparents, George, and Charlene Lane, and many, many friends in the Antelope Valley. Also that we adjourn the memory of Beverly Roman Morrissey, grandmother to my staff member Andrew Workman, who passed away on January 2nd at the age of 103. Born in Texas, she grew up in the Corpus Christi and then Dallas, and at an early age demonstrated a natural flair for drawing and design. The Great Depression hit her family hard and left Beverly with the grit and resolve to be independent and live life to its fullest. One night, while working as a fashion show model at the Christmas party, she impressed the president and founder of Neiman Marcus by winning a spontaneous gift wrapping competition. This chance encounter got her a job running the new gift wrapping department at Neiman Marcus' original Dallas location. She was only 19. In her 8 years at Neiman Marcus, Beverly designed many creative and popular gift parcels and packages, as well as suits, blouses, and toys. In 1946, she met and married Louis Talbot Roman, a successful and they moved to Los Angeles, raised 3 children, and were happily married until his death in 1975. In 1978, she married Mr. Chase Morsey, and they enjoyed 38 years of marriage until his death in 2016. Throughout these years, Beverly developed an artistic talent with beautiful oil paintings on large canvases, usually still lifes of flowers filled with vitality and color. She continued to paint until her last days. The vibrant hues of her paintings captured her remarkable confidence and great enthusiasm for life. She's survived by her 3 children, Carol, Mark, and Kelly, and her 5 grandchildren. Also, Robert Pernicki, resident of Lackawanna Footridge, who passed away peacefully on January 6. Known to his friends and family as Bob, he was born on Chicago's South Side and graduated from Northwestern University. In 1966, he answered a newspaper ad for an opportunity with a new hamburger franchise in California. 1 year later, he became the owner and operator of McDonald's restaurant in Rosemead, California. As his organization grew, his service and dedication to businesses earned him numerous awards, including being honored as a founding member of the Ronald McDonald Children's Charity of Southern California. Bob was a proud father and grandfather and enjoyed sharing his love of deep sea fishing, skiing, and golf with his family. Deeply devoted to his faith, he was a loyal supporter of Catholic charities and schools and served as a member of the Royal High School Board of Trustees. He's survived by his loving wife, Sally, their children, Julie, Michael, and Paul, and 11 grandchildren. Also, that we adjourn in memory of Ernest Perez Totemez Salas, chief spiritual leader and oldest living member of the Quiche, also known as the Gabrielino Band of Mission Indians, who passed away on January 19th, just 1 week after the death of his wife of 88 years, Virginia. Due to his efforts and leadership, the Gabrielino Tribal Council gained acknowledgement of its nonprofit status and recognition by the state of California in 1994. Chief Salas has resided in San Gabriel all of his life, and as a spiritual leader, he has selflessly served his people and worked to preserve the memory of his ancestors. He was greatly admired and an active member of his community and other neighboring communities. Chief Salas is survived by 6 children and several grandchildren and great-grandchildren. I know Supervisor Hahn, you wanted to be included on this adjournment, correct? Supervisor Hahn does.
Yes, thank you. I just wanted to add my comments. His legacy as a chief and the leader to Quiche, so important in many of my areas. The Quiche claim ancestral territory throughout LA County, but in my district, they're out in Hacienda Heights and Roland Heights and Catalina Island, and he was just such an influence out in particularly Hacienda Heights. I remember he led an invocation for one of our board meetings, and he was just so active in our local community. So I just wanted to join with you, extend my deepest condolences to his families and to the members of his tribe. Thank you.
Thank you. I would move that we adjourn in memory of Betty Sanford, who devoted herself to the city of Monrovia and died January 13th at the age of 94. She was known as an activist, mentor, and fighter for the underserved and was considered one of the pillars of the community. Always concerned about education, she served as a member of the Monrovia Unified School District Board of Education. She supported Monrovia Reads, the foundation dedicated to establishing 100% literacy in Monrovia. She even served as a founding secretary of the board of directors. She was also a founding member of the Monrovia Changemakers, a group working to celebrate the great ethnic diversity of Monrovia. Travel, adventure, and experiencing other cultures was a passion for Betty. She journeyed to every continent with the exception of the Antarctica. Betty became an avid runner in her late 40s, running the hills and streets of Monrovia and beyond. She won numerous races in her age category and maintained her fitness routine, working out with her trainer 3 days a week up until her death. Although her achievements and honors are many, Betty Sanford was first and foremost extraordinary in the roles of mother, grandmother, and great-grandmother. Betty survived by her children, Randy, Leslie, and Kevin, and 7 grandchildren. Also, that we adjourn in memory of Dorothy Smith, mother-in-law of my Antelope Valley Assistant Field Deputy Charles Boswick, who passed away on December 15th at the age of 84. Dorothy was born on June 28, 1936 in Cordova, Illinois, and grew up on a farm. After high school, she attended communication school in Omaha, Nebraska, and then worked in Washington, D.C. for the Department of the Navy, where she met Franklin R. Smith. Dorothy and Frank married in 1956, and in 63, they moved to the Antelope Valley, their home for the next 57 years. Dorothy worked at Parkletts High School for 6 years, traveled to 34 countries with her husband as a travel agent, and regularly attended the St. Junipero Parish and St. Mary's Parish. Dorothy survived by her husband, Frank Smith, their 4 children, Regina Boswick, Scott Smith, Natalie Muff, and Eric Smith, and their spouses, 11 grandchildren, 6 great-grandchildren, 2 brothers and 2 sisters. Also, that we adjourn in memory of Chuck Yeager, retired U.S. Air Force Brigadier General Charles Chuck Yeager, who was the first pilot to fly faster than the speed of sound, who died on December 7th at the age of 97. Piloting an X-1 rocket plane, Yeager broke the sound barrier over what is now Edwards Air Force Base in the Antelope Valley. Born February 13th in 1923 in the hills of West Virginia, Yeager joined the U.S. Army Air Corps after graduating from high school in 1941. While working as an airplane mechanic, he was selected for training as a pilot, though he didn't have a college diploma. During World War II, he shot down 13 enemy fighter planes over Europe. Shot down in early 1944 over France, he evaded capture with the help of the French resistance, escaped back to England, and resumed flying combat missions over Germany. Following the war, he piloted experimental aircraft at Edwards and then commanded flight bomb squadrons on bases in Europe. In 1962, he returned to Edwards to lead the school that trained prospective astronauts. When the Vietnam War arrived, he got back into the cockpit and flew 127 combat missions as commander of the 405th Fighter Wing. Later was vice commander of the 7th Air Force in Europe, U.S. Defense Representative of Pakistan, and Director of Aerospace Safety at the Air Force Inspection and Safety Center. Promoted to Brigadier General in 1969, Yeager retired from the Air Force in 1975. His name became legend with the author Tom Wolfe's 1979 book, The Right Step, which chronicles the daring achievements of the test pilots and astronauts in the early years of NASA's space program. Though he lived in Grass Valley in the Sierra Nevada foothills, Yeager remained a frequent visitor to Edwards in the 21st century. He was awarded the McKay Trophy in 1948, the Collier Trophy in 1948, and the Harmon International Trophy of 1954 for his aviation accomplishments. In 1985, he received the Presidential Medal of Freedom. His military decorations included 3 Distinguished Flying Crosses, 2 Silver Stars, a Bronze Star with V for Valor, and the Purple Heart. He's survived by his wife Victoria, 2 daughters, Susan Yeager and Sharon Yeager, Brick, and a son, Don. And last but certainly not least, I move that the Board of Supervisors adjourn in memory of the following individuals who were identified as indigent veterans by the Los Angeles County Medical Examiner and were subsequently buried with dignity and honor at Riverside National Cemetery in the last month. Elaine Rose Benton, Army; John County, Air Force; Ronald Roy Cully, Army; William Francis Downing, Air Force; Carl John Hobby, Army; Peter Joaquin May, Army; Michael Andrew O'Brien, Navy; Lee Donald Roberts, Army; Ronald Anthony Ross, Marine Corps; Duncan Jackson Scott, Army; Jerry Wayne Smith, Navy; Bobby Melvin Williams, Army. May their contributions and sacrifices in service to our country never be forgotten. Thank you, Madam Chair.
Catherine, shouldn't we all join in Chuck Yeager's
Absolutely.
adjournment?
Absolutely.
Great. So she'll give the order. Thank you.
Thank you.
Thank you. I will go next. I move today that we adjourn in memory of Margaret Sanchez. She was born on March the 3rd, 1928, and was raised in Los Angeles. Margaret was a stock model in her youth and always prided herself on being well-dressed and appropriate to the situation. She was a wise and cheerful soul and loved her family. She died January 9th at Hollenbeck Skilled Nursing Facility. She's survived by her daughter, Diana Araujo, who is my appointee to the County Small Business Commission, and by her 3 grandchildren, Richard, Marlene, and Alegria, and 6 great-grandchildren. She will be loved and will be missed by her Hollenbeck family. I move that when we adjourn today, we adjourn in memory of Gabriela Del Jaro Perez. She was born on August 30th, 1991, and passed away due to a senseless shooting on January 4th of this year at the young age of 29. She graduated from South Hills High School in West Covina in 2010. Gabriela then went on to complete studies in her fields of cosmetology, dental hygiene, and was on her way to becoming a registered nurse. She was a member of the Sacred Heart Church in West Covina and was an active volunteer at St. Thomas More Catholic School in Alhambra. She will be remembered for her smile and her contagious laugh. Those who knew her described her as kind, caring, smart, fun, and fierce. She's survived by her husband, Aaron Perez, her mother, Rosa Rios, her father, Carlo Delgado, her brother, Danny Delgado, her dog, Biggie, and a host of extended family members and friends who will miss her dearly. Lastly, I move that we adjourn in memory of Tom LaBonge. I know most, if not all of us, knew Tom well and was saddened to hear the news of his passing. Tom was born on October 6, 1953, and grew up in Silver Lake in the 1st District, where he lived all his life. He was a 39-year veteran of Los Angeles City Hall, serving as council member from 2001 to 2015, and earned his nickname of Mr. Los Angeles. It seemed like Tom knew every nook and cranny of the City of Angels. He took a personal interest in his constituents' lives and cared deeply about the daily municipal services that the city provides. Tom adored the City of Los Angeles and definitely left an indelible mark on its history. He is survived by his wife of 41 years, Bridget, his daughter, Mary Kate, his sons, Charles, and his brothers. May he rest in peace. I will now recognize my colleague, Supervisor Hahn, to add a few words to his adjournment.
Supervisor. Thank you. This one's still so hard for me. Because I know it is for you too. It's just hard for me to believe that Tom LaBonge is gone. We served together on the Los Angeles City Council. We actually sat next to each other, and you do it by alphabet in the City Council, so we were always sad when somebody with another last name got between us. Nobody loved the city more than Tom LaBonge. That's why he was known as Mr. Los Angeles. He was an ambassador for Los Angeles, but he cared so much, not only about just his constituents. He was famous for, renting a pickup truck and driving around and picking up people's bulky items himself instead of waiting for the sanitation department. But he loved international. He was an international friend as well. He loved the Sister City program in Los Angeles and spent a lot of time, really developing it and making sure that it was meaningful. In fact, it was his idea to put the Sister City sign up in downtown Los Angeles at the corner of 1st and Main, right across from City Hall. And his wife, Bridget, designed it so that all the sister cities had the number of miles or kilometers to the heart of Los Angeles. For instance, Berlin was 5,759 miles from Los Angeles, and he loved that. It became an iconic statue, really, in downtown Los Angeles, because foreign visitors would come and they would find out where their city was and how many miles away it was. And it still stands today. It's a great design. When I went to Berlin on a trip, when I was a council member, I was surprised to see some of Tom's iconic photos that he took hanging in the Berlin City Hall. That's how much they loved him as much as he loved them. He was famous for going up to people and asking them what their high school was, and he knew every mascot of every high school in Los Angeles. And it was sort of, he disarmed people by knowing their high school mascot. He was also famous for hopping on those Hollywood tour buses. He just hopped on, grabbed the microphone from the tour guide, and began giving his own tour of his favorite places in Los Angeles. Everybody has lots of stories about Tom. I just will say there was one that just kind of spoke to who he was. We were both council members in Los Angeles. At the time, Alex Padilla, who's our new senator, was the city council president. And during the meetings, I got breaking news. Pope John Paul II has died. Tom grabbed me and said, "Follow me," and we raced to the very top of the City Hall, and facing west, there is a bell that hangs out over the City Hall at the very top, and he leaned out. I was kind of holding on to his shirt jacket, and he rang the bell for the Pope. We ran back down before we were missed for quorum, only to find out that Alex Bia actually announced it too soon and that Pope had not really died. You know, and then just last year, we commemorated the 60th anniversary of John Kennedy, who accepted the Democratic Party nomination at the Coliseum. And it was Tom's idea that we light the torch that day, and we did, and it was really special commemoration. But that's how he thought. He thought we should celebrate, we should honor, we should never miss a day without, celebrating somebody. I'm going to miss him. He was also famous for the pumpkin bread, which was made by the monastic nuns under the Hollywood sign. And every time there was an event, every time there was a foreign dignitary that was visiting Los Angeles, Tom would make his way to the front and offer them a loaf of this pumpkin bread. Nobody's going to match his love for Los Angeles. Nobody's going to match his enthusiasm and his love of life. My condolences to his wife, Bridget, and their and Tom's son, Charles, and daughter, Mary Kate. Thank you so much, Madam Chair, for letting me honor Tom.
Thank you so much. He was one of a kind. Remember him taking pictures of us everywhere and just so jovial and smiling and always showing up here at the County Board of Supervisors, unannounced, sitting right there in the front row, and a fun person to be around. He'll be missed by so many. Thank you very much. Next, we'll recognize Supervisor Mitchell.
Madam Chair, thank you so much. And I move that when we adjourn today, we adjourn in the memory of three Angelinos: Arthur A. Day Sr., Eric Jerome Dickey, and Rabbi Alan Freeling. Arthur Day Sr. Was a native Angelino and passed away at the end of last year at the age of 82. He attended 102nd Street Elementary School, Jordan Elementary School, Jordan High, LA Polytechnic High School, and Compton Community College. He worked as a machinist for over 20 years and was vice president of the United Steelworkers Union. With the constant dream of entrepreneurship and his love of, quote, hitting the road, as he'd say, Mr. Day ventured into the trucking industry as an owner-operator of A. Day & Sons Trucking. As a business owner, he enjoyed working with his sons. Mr. Day and his wife, Betty, were married for over 60 years, and after raising their 8 kids, they provided love and care to numerous foster children. Mrs. Day, who's also committed to community service, is president of the Watts Gang Task Force. A pillar of the community, Mr. Day was an inspiration to many of the youth and young adults in the neighborhood, encouraging them to follow their dreams, to never give up, and to finish what they started. To cherish his memory, he leaves behind his wife, Betty, daughters Lisa, Cheryl, and Bridget, sons Arthur Jr., Philip, and Wayne, his sisters Helen Owens and Mildred Willis, 24 grandchildren, 37 great-grandchildren, and 2 great-great-grandchildren, and a host of nieces and nephews and other relatives and friends. Mr. Day also had 2 sons, Alonzo and Kenneth, who preceded him in death. Big Artie, as he was affectionately known, would be greatly missed, but his love and spirit will live on in the hearts of many. Eric Jerome Dickey, born in Memphis, but passed away from a long-term illness here in Los Angeles at the young age of 59. He attended the University of Memphis and earned his bachelor's degree in computer system technology before moving to LA in 1983 to pursue a career in engineering and eventually finding his passion for the arts. After beginning a job as a software developer in the aerospace industry, Mr. Dickey quickly discovered his artistic talents, picking up acting, stand-up comedy, and writing. While developing his artistic skills, he took creative writing classes at UCLA and was a recipient of a Seed Scholarship from the International Black Writers and Artists. In 1994, his short story entitled 13 was published in the IBWA's River Crossing, Voices of the Diaspora Anthology of the International Black Experience. Tapping his skills as a filmmaker, Mr. Dickey developed a screenplay, Cappuccino, which appeared in coffee houses throughout LA and was screened at the 1998 Pan-African Film Festival at the Magic Johnson Theater right there in Leimert Park. His first novel and my personal introduction to him as a writer was entitled Sister, Sister, which Mr. Dickey debuted in 1996. It was recently named one of the 50 most impactful Black books of the last 50 years by Essence Magazine. Mr. Dickey's writing skills certainly did not go without recognition. He had 5 books which reached #1 on the Blackboard bestsellers list, not to mention his 11 novels that earned him spots on the New York Times bestseller list. He was honored at the NAACP Image Awards over several times between 2001 to 2004 and 2005, and he was nominated for Storyteller of the Year at the Essence Literary Awards in 2008. He'll be remembered for his significant cultural contributions to Black storytelling and for serving as a role model for countless writers. His smart, bold characters and authentic, honest storylines gave countless Black women an accurate representation of themselves. Mr. Dickey is survived by his 4 daughters, extended family members, loyal readers, and those who consider him a role model, not only as a writer, but as one who followed his passion. Rabbi Alan Freeling unfortunately passed away peacefully in Los Angeles on the 6th of January at the age of 88. He was born in Chicago and raised in Miami, where he graduated from the University of Miami. At age 30, he enrolled at Hebrew Union College to pursue rabbinical studies and served a congregation in Toledo, Ohio, before coming to Los Angeles to serve as a senior rabbi at the University Synagogue in Brentwood. His leadership helped grow the congregation to over 1,000 families. Rabbi Freeling will be remembered as a champion of human rights and local community activist through his unrelenting efforts to improve the lives of all Angelenos. He helped create interfaith dialogues among multi-faith groups. He advocated for LA's unhoused population and sought to improve Black-Jewish relations. A natural leader, he became the first chair of the LA County Commission on AIDS and the founding chair of the International Association of Providers of AIDS Care. In his purposeful life, Rabbi Freeling developed working relationships with civil rights leaders, presidents, Pope John Paul, to name just a few. After retiring from University Synagogue in 2002, Rabbi Freeling was appointed executive director of the City of Los Angeles Human Relations Commission, becoming the first Jewish clergy member to manage a municipal department. He served as deputy chief of staff for now Congressman Tony Cardenas before moving to New Orleans to advise the city's Office of Human Rights and Equity. He remained an active community leader for the remainder of his life. He's preceded in death by his son David. Rabbi Freeling was cherished by his wife Lori and his children Shira and Jonathan, as well as 6 grandchildren, 4 great-grandchildren, and extended family and friends who will all miss him dearly.
Supervisor, I would love to be on that. I love Rabbi Freeling and Lori, and I knew him at the City of Los Angeles. And I think Sheila said maybe just all members, but I know for sure I want to be on it.
Yeah, I think it should be all members. When I was working at UCLA after my graduation in the early 70s, he came to head up the University Synagogue, and it was literally on the verge of bankruptcy. But it was more than just about money. He enlivened that congregation and grew it because they were excited by him, because he was so inspirational, and because he caught the tenor of the times of the late 60s and early 70s that was really about how communities of faith had a duty and kind of an exciting responsibility to be part of the solution. He was really a visionary and so active in so many ways, but his very brave stance about AIDS, I mean, it seems like a no-brainer now, but it really, really wasn't in the old days. because there was such a stigma about AIDS because it was only affecting, gay people. So there must be something deserved about it. And there were religious leaders that said exactly that. Alan was very strong, not only about, putting his heart there, but being a leader in terms of doing something about AIDS providers and organize them. It was just amazing. Did the same kind of thing with the Jewish-Muslim dialogue later when there was, stigma attached to that. So he was such a brave guy. So I'd love to join in. I think all members, if they want to.
I would love it.
Yeah, that's
all
fine.
members on Tom LaBonge too. I don't know if we.
Yeah. Yeah.
Yes.
And Sheila, I'd like to be added on with Larry King because I remember receiving an award from him.
Sure. Okay, we'll put you on Larry King's.
Thank you. Okay, very good, members. And if that concludes our adjournments, we'll take all the motions as seconded, and if there's no objection to a unanimous vote, that will be the action. With that, members, we're going into closed session. Madam Executive Officer, please read us into closed session.
In accordance with Brown Act requirements, notice is hereby given that the Board of Supervisors will convene in closed session to discuss item CS1, conference with legal counsel regarding anticipated litigation, item CS2, conference with legal counsel regarding anticipated litigation, and item CS3, department head performance evaluation, and item CS4, conference with legal negotiator, Thesia Davenport, and designated staff as indicated on the posted agenda.
Thank you. Okay, members.
The board is currently in closed session and will return to open session once closed session has ended. board is currently in closed session and will return to open session once closed session has ended.